Hello everyone. Very good evening to all of you. Am I clearly visible, audible? First, you have to confirm that I am clearly visible, audible, everything is good to go. So I will start the session. I'm waiting for your reply in the comment section. Those who are live, those who can see me clearly, you can reply that I'm clearly visible, audible, everything is good to go. I guess yes. Yes, thank you. Thank you so much for responding. Thank you so much. So I welcome you all for today's session. Good evening to all of you. And I welcome you all for this course that is third Prof Buster 1.0. So today's topic is very interesting topic, very interesting subject. So today there is a demo session of the forensic medicine in which I'm going to take a ultra important topic that is postmortem changes. This topic is really very important from MCQ point of view in the competitive exams, and it is also very important for the university exams. Okay, so before coming on this topic, as most of the students who are attending this session may be third prof student, so I would like to orient a little bit. Okay, I will take few seconds only. After that, quickly I will come on the topic. Okay, so first of all, I would like to tell you why third prof is most important. Many students take third prof so lightly. They think only 2 subjects or only 4 subjects are there, and the syllabus is very less, and they take third prof very lightly. But please let me remind you, in the final year, you are having 9 to 10 subjects. Yes or no? You are having 9 to 10 subjects depending from university to university in your final year. So if you are starting third prof early, finishing it early in the next 4 months along with me, you can start your final year subjects very soon. Okay, you will get a spare of 4-5 months to study the final year subjects. If you are completing these 4 subjects timely, you will get time to start at least few major subjects of the final year timely this year only. In the third prof only, you should cover at least 2 or 3 major subjects in the third prof, because in the final prof you won't be able to cover all the 9-10 subjects, right? So considering all these struggles the students are facing, the third prof students, I have launched the course that is third prof buster 1.0, in which I will teach all 4 subjects. Okay, and these 4 subjects I will not teach only from university point of view, university exam point of view. I will teach all these 4 subjects for university exams as well as for your competitive exam. I mean to say, if you are attending math session, you can solve all the MCQs, PYQs, probable MCQs based on these 4 subjects 100%. So these 4 subjects will be prepared for your NEET PG, INI-CT, and if you are a foreign MBBS student, it will be for FMG also. It will be useful, and it will be simultaneously useful for your university exams. So daily I will take live classes in the evening, so that it will bring discipline in you. I want all of you to attend it live only. And if you take the subscription and you think that I will watch the sessions later on, later will never come. No, you have to attend it live, so that along with me in the next 4 months, you will complete your syllabus of all these 4 subjects. Okay, so that is the broad plan. So we are going to complete the 4 subjects in the 4 months, 10 days to be precise. The starting date, it's already started 2 days back on 11th of October. The end date is 22 February. So it's 4 months, 10 days. The detailed schedule is in front of you. You can see the color coding of the subject. Okay. Now here, along with the daily live sessions, recordings of the sessions will be available for 1 year. I'm providing you 3 types of notes in this course. Digital notes, printable notes. You can take the printout at your convenience and mark it, annotate it. Okay, and annotated digital notes. Okay, I will provide you daily quiz. 3 type of question banks here: university exam question bank, NEET PG question bank, and PYQ question bank, along with the practical library. So these are the inclusions. FMT and PSM are the subjects in which images are very less. Okay, most of the students feel that they are very dry subjects. You may have seen the textbooks, they don't have much images, but in my lectures you will find these 2 subjects most colorful. Today you will get a demo. You have already seen the PSM demo. Now in forensic medicine, you see how many images, animations, tables and flowcharts I have included, so that you have better retention. For ENT and ophthalmology, the 2 clinical subjects we are having, I will teach you with 3D models like this. I'm having all these 3D models. I will teach you layer by layer, part by part in ENT as well as ophthalmology. So don't you dare to miss my demo classes of ENT and opthal ahead. After FMT, we are having the demo classes. In this course, I'm going to take total 87 live session, 2 to 3 hours each. Daily live session, it will be daily with breaks, pre-planned breaks, and total 87 sessions are there. There are 8 demos. Today is the 3rd demo. PSM demos are over. Today is first forensic medicine demo. Tomorrow will be the second one. After that, we are having ENT opthal demo. So I request all of you to attend all these 8 demo classes because the topics here I am taking are ultra important. Whether you are subscribing or not, that's a secondary issue. But these topics are ultra important. You should cover for your exam that we will take in the demo classes. Okay, chalo. For the notes of this session, whatever I am taking it, in the comment box you will get the link. Whatever I am teaching, the replica you will get in the form of the notes in the comment box. So you can download from there right now or later on if you wish. For any further details, you can WhatsApp on this number. Don't call on this number. Kindly drop a message. WhatsApp on this number. Now, let's start forensic medicine. How many of you are ready? Can we start forensic medicine? So today is the first demo session of forensic medicine. Excited? Yes. So let's start forensic medicine. Before I come on the topic that is postmortem changes, I would like to introduce the subject a little bit because it is the first lecture of forensic medicine. So what is forensic medicine? What is forensic medicine? Death ends life, but not the story. You believe it? Yes or no? And that's where the forensic medicine begins. So forensic medicine begins after death. It's a science that begins after death. Okay, so we can say in medicine, we learn how to save one life, how to save patients. Okay, but in forensic medicine, we learn how to let the dead speak. How to let the dead speak. That is the science, very interesting science, the forensic medicine. Okay, so silence after death is not empty. Okay, and it's full of the clues. It's only thing we have to pick up those clues. So I welcome you all in the science of forensic medicine where doctors become detectives, right or wrong. So let's start the topic now. Postmortem changes, my first session in forensic medicine. Can we start it? Are you people ready? Yes? Interesting? Sounds interesting? Yes? So let's start postmortem changes. Now the first question which arises in my mind before I start this topic, I guess you also have this question in your mind. Why, being a doctor, it is important for me to know the postmortem changes. Postmortem changes are the changes which occur in the dead body after death, obviously. Okay, in the body after death. So these are the postmortem changes. Why? Why it is necessary to study these changes in this lecture today? Being a doctor, why it is necessary? So listen, every second after death, every second, the dead body starts writing its own report. Everything turns into a clue. What is our job? Doctor's job is to read those clues, and we have to tell two things: when the death occurred and how the death occurred. To answer these two clues, we have to understand the postmortem changes in the body. So we have to answer two questions from the clues, because immediately after death, changes start taking place and clues are there. We have to pick up those clues and we have to answer two questions. When the death occur, what is the approximate timing of death? In case of medical legal cases, it's very important to know the timing of the death. Okay, and how death occur. Okay, what is the cause of the death? In medical legal cases, it's ultra important, obviously. Okay, so at the crime scene, there is no stethoscope, there is no pulse, there is no patient, there is a dead body and only questions. There is only questions, and the answer of all those questions lies in postmortem changes, and that's why postmortem changes are ultra important. So I welcome you all in the science where doctors become detectives. That is postmortem changes. Now you understood the relevance of postmortem changes. So let me start the topic. Now you have to understand that term, the definition. You have to understand this term. Sometimes you get a short note on that. What is forensic taphonomy? Forensic taphonomy. Say the word with me. Forensic taphonomy. What is that? It is an interdisciplinary study of postmortem processes. So this study is known as forensic taphonomy, first of all. Okay. With the help of this study, we examine history of changes in human body after death. So we see the changes in human body after death. And this study is known as forensic what? Forensic taphonomy. Write down this word. It is important for MCQs also. Now, what is the uses of forensic taphonomy? The same two uses. Number one, with the help of this study, we can differentiate true death from suspended animation. What is suspended animation? Suppose it is a person who is unconscious and I cannot find the pulse, I cannot find the respiration. I think the person is dead, but actually the person is not dead. Temporarily, the pulse and respiration is suppressed to such a level it cannot be detected. So person can be resuscitated. Okay, so it is not a death, it is not a true death, it is known as suspended animation. The person is looking like death, but it is not a true death. So with the help of this science, we can differentiate the true death from suspended animation, number one. And number two, of course, we want to know time since death in case of medical legal cases. The most important thing, when the death occurred, the approximate time. That's ultra important clue in medical legal cases. So for these two purposes, we are performing this study, that is forensic taphonomy. Learn the definition, learn the two applications. See the images, learn the two applications. Okay, to differentiate the true death from suspended animation and to know the approximate time of death. Don't mug the statements. Understand and try to create in your own words. Okay, now, so with the help of postmortem changes, okay, suppose I am a forensic expert and I am examining the postmortem changes in a dead body. So even a single clue from the dead body can set an innocent person free and can send a murderer to the prison. So it's the onus of the forensic expert who is examining the postmortem changes in a dead body. It is the onus of this person, because of which the judge can decide, okay, the justice can be given, the innocent person can be set free, and the murderer or any criminal can be put into the prison. So it's a very important study. Now, if you have understood the introduction, definition, applications, let's start the changes. Okay. So since last 15 minutes, I'm stating about the definition, its application, its uses, how it is useful for us. Now we will come on actual changes, the postmortem changes. We divide postmortem changes into three categories. What are the three categories? We divide the postmortem changes into three categories. You can see the three categories: the immediate changes, early changes, late changes. First, you learn the three categories. When immediate changes are seen, it means somatic death has occurred. But at cellular level, death is not there. Only somatic death is there. Okay, first somatic death occurs, then cellular and molecular death occur. Okay, so early changes indicate somatic death. Immediate changes indicate somatic death. Early changes indicate cellular death. There are 6 early changes. And there are 3 late changes, which indicates the body is decomposed. Decomposition, putrefaction, mummification, I will teach you all. So body is decomposed. So what are the 3 type of changes? Immediate, early, late. Don't get confused between immediate and early. Immediate, early, late. Immediate changes are 3 in number. You can see, I will teach you all of them today. Okay. Early changes are 6 in number. You can see. And late changes are again 3 in number. So 3 plus 6 plus 3. Total 12 changes. Today's topic. Okay, it's a long question in your university exam. And you get ample of MCQs from this topic. You are getting my point? Yes or no? Yes. So immediate changes, early changes, late changes. Learn the total 12 changes one by one. So one by one we will see. Okay, come on, the immediate changes. There are 3 immediate changes. What are the 3 immediate changes? And what does they indicate? Immediate changes indicate somatic death. Early changes indicate cellular death. And late changes indicate decomposition. First, you learn the 3 type of changes and learn what does they indicate. Okay, now learn the number. How many changes are there in each category? Now state them. One by one we will state and see their description. Okay, immediate changes are 3. What are the 3 immediate changes? Number 1, insensibility and loss of voluntary power. The person become unconscious. Obviously, a dead person is unconscious. Insensibility, there is no sensibility, there is no pain sensation, no sensation at all. Insensibility, the sensations are gone. And loss of voluntary power. Okay, number 1. So as soon as a person is not responding to any sensation, okay, so we have a suspicion the person can be dead. Number 2, cessation of respiration, cessation of circulation. 1, 2, 3. Learn the immediate changes. Okay, how to learn them? You will see, ma'am, I have difficulty in learning them. So I'm having a mnemonic for this also, this also, this also. We will see 3 mnemonic. First, you see the mnemonic of immediate changes. The mnemonic is I really collapsed. IRC. What is the mnemonic? IRC. The immediate changes. I stand for insensibility and loss of voluntary power. insensibility and loss of voluntary power, like that. Okay. Number 2, R. R is respiration, cessation of respiration. And number 3, C. C is for circulation. So cessation of circulation, no pulse. Cessation of circulation. So cessation of respiration, cessation of circulation, and insensibility. You can learn the mnemonic I really collapsed, IRC, if you want. So these are the 3 immediate changes we have learned with the help of a mnemonic. Coming on, I will give you detail of all of them. First learn them. No? You can be able to enumerate the 12 changes. Then only I can give you the details of all 12 one by one. Right? First you should be able to enumerate. No? So second is early changes, which indicates cellular death. There are 6 changes over here. What are the 6 changes? Changes in skin, changes in eyes after death, changes in skin, okay, changes in eyes, okay, muscle changes, the muscle changes, okay, cooling of the body loses temperature after death, cooling of the body, that is known as Algor Mortis, okay, postmortem lividity, there are many, hypostasis, it is also known as, and then rigor mortis. I will explain all these 3 are ultra important, they come for long question, the remaining come for shorter, very short question, and MCQ come on all of them. Okay, how to learn them? Use them, I will forget. I'm having a mnemonic, you won't forget. In my class, forgetting is not allowed. Okay, you won't forget in my class. So, there is a mnemonic. What is the mnemonic? See me clear. See me clear. This is the mnemonic. So, from C, take 2 letters, S-E. From me, take 1 letter, M. And clear, take 3 letters, C-L-R. Clear. See me clear. C, S-E. So the mnemonic is C, me ka M, or clear ka C-L-R. See me clear. So S stand for skin, changes in the skin. E stand for eye, changes in the eye. M stand for muscle changes. Okay. C stand for cooling of the body. L for lividity, postmortem lividity, hypostasis. And R for rigor mortis. Very easily you can enumerate if you have the mnemonic with you. So these are the 6 early changes. We are done with immediate changes. You have your mnemonic ready. We are done with early changes. Mnemonic is ready. Now coming on the last, late changes. Late changes are only 3 in number and they indicate the body is decomposed. Decomposition, putrefaction have started. So there are 3 changes. Putrefaction, adipocere formation and mummification. The mnemonic is PAM, P-A-M, PAM. PAM for afterlife. P-A-M, PAM afterlife. So P for putrefaction, A for adipocere, and M for mummification. So total 12 changes in front of you which you have learned with the help of the mnemonic can be tried together. You can see total 12 changes in the form of the table. If you want to learn like this, learn like this. If you want to learn like a flowchart, learn like flowchart. Whatever fits in your mind. But learn the mnemonics. IRC, see me clear, PAM. Can we revise it once? We will do it. Huh? Chalo. So postmortem changes. We are dividing them in 3 categories. Immediate changes, early changes, late changes. Immediate indicates somatic death, early indicate cellular death, and late indicate decomposition. Now say the mnemonic. What I told you, the mnemonic. Write down in the comment box, please. Say the mnemonic, people. What's the mnemonic over here? I really collapsed. Okay. Insensibility and loss of voluntary power, cessation of respiration, cessation of circulation. Early changes, C, me, CLR, clear. Changes in skin, changes in eye, changes in muscle, cooling of body, and lividity and rigor mortis. Okay. And finally, here late changes are PAM, P-A-M, PAM. Putrefaction, adipocere formation, mummification. I hope it's crystal clear. Can you enumerate all these 12 changes? Everyone who is live, give me a thumbs up. You are understanding it. You are retaining it along with me. Now, one by one, we will start these changes. Description of all these 12 changes one by one. But before that, I told you, just a second. I'm sorry. Before that, I told you it's very important to differentiate the true death from the suspended animation. So you must understand what is suspended animation before I start postmortem changes. Postmortem changes are seen in dead body. This is not a dead body. It is suspended animation. So being a doctor, you should be able to differentiate what is the true dead and what is suspended animation. So how to define suspended animation? Before I come on the details of all these 12 changes one by one, I will come on the detail. You should understand what is suspended animation. Suspended animation, the other name of suspended animation is apparent death. What do you mean by apparent death? Apparent. It is is looking like death, but it's not real death. That is the meaning of apparent. उसके जैसा लग रहा है. It is looking like death, but not real death. Okay. So it's a condition where vital functions are reduced to minimum. You can see the vital functions are not zero. The circulation, the respiration, they are reduced to such a minimal level that no visible signs of life are there. If I auscultate with a stethoscope, I can't hear the respiratory sound. If I see the pulse, I can't palpate the pulse. Okay, because the vital functions are reduced to minimum, they cannot be detected, but the resuscitation is possible. If you resuscitate this person, the life will come back because vitals are not zero yet. Okay, pulse is not palpable, but if you resuscitate, it will come back. So this is suspended animation. So in suspended animation, why the person is not respiring, still alive? The question may arise in your mind, now circulation is not there or minimal circulation is there. Respiration is not there, minimal respiration is there. But still the person is alive. How? From where the person is bringing the oxygen? So oxygen, because the person metabolic rate is reduced to such a level so that the oxygen which is dissolved in the body fluid, that is sufficient for maintaining life for the next few minutes. In the next few minutes, if the person is resuscitated, in the next few minutes, we can retrieve the person. You got my point? So here the oxygen is not taken by respiration. The person is not respiring. Okay, it's minimal. But the metabolic rate is less. So oxygen dissolved in the body tissue is sufficient for that. There are two types of suspended animation: voluntary, involuntary. Voluntary suspended animation can be done with yoga training. Okay, with yoga training or deep meditation, person can withhold his or her breath and circulation and pulse also. So it is voluntary. Sometimes it can be voluntary, like in yoga training, yoga samadhi, deep meditation. Okay, and sometimes it is involuntary. Involuntary in some diseases like drowning, electrocaution. You can see drowning may in case of electrocaution, and in case of vagal inhibition, hypothermia or drug poisoning. So these are the two types of suspended animation. You can see in case of yoga, it's voluntary. In case of drowning, electrocaution, vagal inhibition, it's involuntary. So these are the two types of suspended animation. It can be from few seconds to half an hour. The person can be in this state from few seconds to half an hour, and revival is possible with the help of cardiac massage and electric stimulation. Okay, we can do the electric stimulation and cardiac massage and revival is possible. So that is about the suspended animation, a short note on suspended animation. So if you are getting a short note on suspended animation, you can write it down. Okay, now can I start the changes one by one? How many of you are ready? Give me a thumbs up, everyone. Can we start? So let's start it. Let's start the changes. First, I will teach you immediate changes, which are 3 in number, one by one. Then I will come on early changes, which are 6 in number. And finally, I will come on late changes, which are again 3 in number. Total 12 changes. Today's challenge. Okay. So let's start with the immediate changes, which are 3 in number. The mnemonic is IRC. We will revise it again and again. So I will start with the first change, that is insensibility and loss of voluntary power. So you can see out of the 3 changes, I'm teaching you the first one, that is immediate changes. And I'm starting with the first one, that is insensibility and loss of voluntary power. So it's an MCQ. What is the earliest postmortem change? You get multiple options among these. So answer is this one. This is the earliest postmortem change. Please learn it. And this is the last one. Okay. So this is an MCQ. Learn earliest sign of death. The earliest sign of death is insensibility and loss of voluntary movement. The person become insensitive, no response on anything, and there is loss of voluntary movement. That is the earliest sign. Sometimes it can mislead if precaution is not taken. Okay, it is not always if the person is not responding, the person is dead. The insensitivity can be seen in all of them. The person can be fainted. Maybe this person is not dead. Maybe the person is fainted, syncope, or maybe it is vagal inhibition. Maybe in epilepsy, catalepsy, necrosis, or electrocaution, it occurs. So sometimes it can be misleading, but it is the earliest sign. That's it. That's it. Okay. So sometimes insensibility and loss of voluntary power can be misleading, but it is the earliest sign of death. Number one. Coming on the second one. The second one is cessation of respiration. R for respiration. Cessation of respiration. Cessation of respiration must be complete and continue to confirm death. I told you, in suspended animation, it is for few seconds or few minutes, but it's incomplete. It is reduced to minimum. It's not zero. In suspended animation, for confirming death, you should hear with the stethoscope very clearly. There is zero respiration. Zero. It is not minimal. It should be complete absence of respiration, complete cessation, and it should be continuous. It should be continuous to confirm death. Okay. Sometimes it happens, very expert physicians, very expert doctors declare death of a person, and later on it is found that it is not a true death, it is a suspended animation, and in the mortuary the person gets up without even resuscitation. So some incidences in the world have happened which are reported like this. That's why looking at these signs is very important, okay, with clarity. So there should be complete cessation and continuous cessation of respiration. So how to examine the respiration? You should take a stethoscope. Being a doctor, if you want to see whether this person is dead or not, you should take a stethoscope and put it on the upper lungs and larynx, and you should be able, even the faintest breath sound, if you are hearing, it is not dead, it is suspended animation. If the faintest breath sound are also there, but if there is no breath sound and it is continuous like that, even after trying resuscitation, okay, so it is dead. Okay, complete absence of respiration for more than 5 minutes declares death. So mind the word complete. Complete. You should be able to hear it clearly in your ears. There should be no even faint sound. So complete absence of respiration, learn, for more than 5 minutes. It's an MCQ. For more than 5 minutes, it can be declared death. Okay, and it should be heard on upper lungs and larynx. Here is the upper lungs, and it should be heard on the larynx. Upper lungs and larynx. Okay. Temporary stoppage, not true death, can occur in voluntary breath holding. I told you, in yoga practitioners, it can happen. Voluntary breath holding, it can occur in drowning, newborn infants, sometimes it occurs, and it can occur in Chinese stroke breathing. Okay, but you should be able to differentiate that it is not suspended animation, it's a true death. So these are the differential diagnosis over here. Okay, so we are done with the first one. We are done with cessation of respiration. Now I'm coming on the third immediate change, postmortem change. Among the immediate changes, I'm teaching you immediate changes, postmortem changes mein. First is done. It is the earliest change, but it is not very reliable. It is the earliest, but sometimes it can mimic with suspended animation. The second, complete cessation of respiration for more than 5 minutes declares death. And third, cessation of circulation. Coming on cessation of circulation. So we have to hear with stethoscope on the precordial area. On the precordial area, we can hear the heart sound. Over the lungs, we hear the respiratory sound. And on the precordial area, little bit on the left side, okay, we can hear the heart sound. So with this stethoscope, we have to hear both on the chest. Okay, we have to examine both on the chest. Okay, number one, on the lungs, we have to see the respiratory sound, and in the precordial area, we have to see the heart sound. So stoppage of heartbeat for more than 5 minutes, again, it's evidence of death. Okay, so here the stethoscope has to be put on precordial area. In case of respiration, it has to be put on lungs and larynx. So we have to hear the respiratory sound as well as heartbeat before declaring the person dead. Both should be stopped or ceased for more than 5 minutes. See the sign. For more than 5 minutes to declare the person dead. Don't be in hurry. You are just examining and saying there is no heartbeat, there is no respiration, the person is dead. Wait for 5 minutes. After 5 minutes, again, in the meanwhile 5 minutes, you try to resuscitate. And even after 5 minutes, it's not coming back. So you can declare the person dead. Okay, so we are done with the early changes. Can we revise? What are the three, not early, sorry, immediate changes. So what are the three immediate changes? Can we revise? You know the three immediate changes. These are the three immediate changes. Postmortem changes. Three immediate postmortem changes. Number one, insensibility and loss of voluntary power, the earliest sign, but not reliable. Number two, cessation of respiration for more than 5 minutes is evident of death. Number three, cessation of circulation for more than 5 minutes, again evident of death. These two should be confirmed with stethoscope. This on the lungs and larynx, and this on the precordial area. Okay, and this we cannot confirm. So again, I'm saying it's not a reliable sign. Okay, so let's come on the early changes now. Are you people there? Huh? Keep interacting, people. Give me some emojis, give me thumbs up, so that I feel it's a live session, it's not a recorded session. Come on. So can we continue? Yes. So let's start the early changes. Immediate are done. Revise it, revise it. In my session, multiple revisions will be there. You will retain everything in the class itself. Now, next revision just before the exam. No need to revise in between. And directly you try solving your MCQs. Okay. So these are the immediate changes which are done. And now we are going to early changes. Postmortem changes, the second category, early changes. Early changes indicate cellular death. Immediate changes were indicating somatic death, and now early changes indicate cellular death. Okay, I will teach you what is somatic death, cellular death, molecular death when I will teach you the next session. Okay, death and its causes. Okay, you do attend that also. It is very interesting. So here it is indicating cellular death. For now, you learn that. So there are 6 changes. You can see the 6 changes. We are having a mnemonic also. One by one, we will take it. These 3 are very big, to understand. These 3 are very small. Quickly, we will do it. Can you see? So these are the early changes. I'm starting early. Immediate is done, and now I'm starting early changes. So first change in the early change, I'm taking changes in skin. Can I start? Changes in the skin. The changes in the skin occurs after few minutes of the death. After few minutes. I will tell you changes in the skin as well as lips. On the skin, complete skin and the lips. So changes in the skin and lips. Both we will see one by one. The skin become pale and ashy white. See the color. After death, immediately circulation stops. Since the circulation stops, the color of complete body become pale. Pale color. Okay. And ash white color. You can see pale and ash white color. And number 2, skin loses elasticity. There is no elasticity. Normally the skin is elastic. Now you can feel the elasticity in your own skin. See, the skin is elastic. Here there is no elasticity. Loss of elasticity within few minutes after that. So loss of elasticity. Elasticity is lost. You can see. So color become pale, ash white, and elasticity. You can appreciate the elasticity of the skin is lost here. You can see elasticity is lost. So that is the changes in the skin. Now coming on the changes in the lips. The skin of the lips, you can see. Lips appear dark red to black. Appreciate. The lips of a dead body. Dead person. It is dark red to black in color. Dark red to black in color. They are dry and hard due to drying of the mucosa. Okay, these are the changes. Not really very important. See the skin changes. See the lips changes. So skin become pale and loss of elasticity, ash white. Lips become red, dark red to black in color. They are dry, they are hard because of drying of the mucosa. So these are the changes in skin which are not really very important from exam point of view. But changes in eye, make a 5-star over it. Make a 5-star over it. Changes in eye are ultra important, people. The changes in the eye after death. How many changes in the eye after death? There are 6 changes in eye after death. So let's start the big topic, ultra important topic from exam point of view. Make a 5-star, it's very important. Okay, changes in the eye. There are 6 changes in the eye. One by one, I will elaborate all of them. What are the 6 changes in the eye? So if you are examining the eye of a dead person, you should examine for the 6 things to declare it dead. Okay, these 6 things should be seen in the eye in a dead body to declare it dead. Okay, so first of all, loss of corneal reflex, then opacity of cornea. These 2 things are related to cornea. Okay, then flaccidity of the complete eyeball. Okay, cornea, eyeball. Then something about the pupil. I will tell you the changes in the pupil. Then something about the retina, retinal blood vessels. And finally, the chemical changes in the vitreous humor. There are two liquids in the eye, aqueous humor in the anterior chamber, vitreous humor in the posterior chamber. I will teach you all in ophthalmology. So here chemical changes we will see in the vitreous humor. We will aspirate the vitreous humor from the eye in a dead body and we will see certain chemicals in that. To declare, I mean, we don't do all these, some of them is done, but we can do all these to confirm the death. Okay, so these are the 6 changes we will see. First, you learn these 6 changes. I'm telling you the 6 changes in the eye. So in the eye, you can make out 6 arrows and write down the 6 changes over here. So changes in the cornea, loss of corneal reflex, loss of corneal opacity. 2 things are lost in cornea. In the cornea, the reflex is lost, opacity is lost. Loss of corneal reflex, loss of corneal opacity. Learn it. 2 things are lost in the cornea. Eyeball become sunken. Eyes become sunken, going inside because intraocular tension reduced. So eye becomes sunken. Flaccidity of the eyeball. Pupils, I will tell you some changes, whether it will dilate or constrict, miosis, mydriasis, I will tell you. Okay, and sometimes it's irregular. Retinal blood vessels, there is a very important sign, and chemical changes. So let's start one by one. Let's start with the first one, loss of corneal reflex. You see, in a dead person, if sometimes the death occurs with open eyes, sometimes the death occurs with, after a death, the eyes are closed like that, you may have seen. Okay, so if the eyes are open and you are touching the cornea, there is no reflex. So loss of corneal reflex is the earliest sign seen in the eye. Earliest sign seen in the eye in a dead person. Okay, but it's not a reliable sign. Okay, loss of corneal reflex is there, but it's not a reliable sign because it is seen in many other conditions. You have to learn the differential diagnosis everywhere. You get MCQs on that. Okay, so it is seen in deep coma. Maybe this person is not dead. The person is in deep coma. It is seen in general anesthesia, not local. It is seen in general anesthesia. If the person is in general anesthesia, loss of corneal reflex. Okay. It is seen in epilepsy and narcotic poisoning. I will teach you all type of poisonings in the end. So in the narcotic poisoning, there is loss of corneal reflex. So it is not a reliable sign. It indicates death, but it's not a confirmatory sign of the death. Okay. But loss of corneal reflex occurs in death. Along with all these conditions, in death also, loss of corneal reflex occurs. And it is the first sign seen in the eye. Number one. Number two, loss of opacity. Loss of opacity of the cornea. This was loss of corneal reflex. This is loss of corneal opacity. Second thing. So coming on the second one, cornea become dry. Can you see the cornea? See, it's dry. It's dry, it's wrinkled. So drying of the cornea. Now it depends. Death is occurring how? With open eyes or with immediately after the death, the eyes are closed. Sometimes death occurs with open eyes and eye remains open for hours and hours. So cornea become dry very fast. But if the eyes are closed after the death, it delays loss of opacity from the cornea. Okay. So it is delayed if the eyelids are closed immediately after the death. Okay. Sometimes corneal opacity is lost before death in case of cholera and wasting disorder. So you should learn these differential diagnosis everywhere. Sometimes the corneal opacity is lost before death in these disorders, cholera and wasting disorder. That is the loss of opacity in the cornea. If the eyelids remain open after death, a very important sign. See, if the eyelids are open after death, so a film of cell debris and mucus get collected and it form a triangle. Okay, if the eyelids are, suppose the person is dead like this and the eyelids are not closed, they remain open for many hours. Okay, so what happens? The cellular debris and the mucus will form a triangular figure. Initially, these triangles are yellow color. You can see these triangles. Where is the base? Where is the apex? The base is towards the corneal margin and the apex is towards the canthus, medial canthus or lateral canthus. So this is the base of the triangle. Appreciate the base of the triangle and appreciate the apex of the triangle. Can you see the base and the apex of the triangle? These triangles, this is known as tachenoid. What it is known as tachenoid. And later on, they converted into brown to black color. Initially, they are yellow, then they convert brown to black color after 3 to 4 hours. If the eyes remain open after death, they are not closed. Okay, so what happens? The cellular debris will come and cellular debris will form a triangle over here. It will form a triangle over here. Cellular debris and mucus. These triangles are known as tachenoid. You get MCQ on this. So these triangles, where is the base? Where is the apex? The base is towards the corneal margin and apex is towards the canthus, lateral and medial canthus. Appreciate it here. Can you appreciate these small triangles over here? Say yes. Can you appreciate these triangles? This is known as tachenoid. You get a short note in university exam and you get MCQ over here. So that is regarding the opacity, corneal opacity. So we have seen loss of corneal reflex. It is not a reliable sign, earliest but not reliable. Number one. Then opacity, loss of opacity of the cornea. Okay. So if eyelids are closed, it delays. If eyelids are open, it fastens. Loss of opacity. If eyelids are open, tachenoid is formed. What is tachenoid? These are triangles which are formed at both ends of the eye, both canthus of the eye. Where is the apex? Where is the base? The triangles are made up of what? They are made up of cell debris and mucus. Okay, and what is the color? Initially yellow and later on black, red or black. Okay, and please see these images. You should be able to draw in your exam if it is a university exam. Otherwise, for MCQ, you should be able to identify them in image-based questions. Okay, so that is the second point we have seen. We have to see 6 things in the eye. We have already seen loss of corneal reflex. We have already seen opacity of the cornea. Not loss of opacity. Loss of shininess of the cornea, I mean. Okay, let me correct myself. Loss of shininess of the cornea is opacity of the cornea. Okay, now third is flaccidity of the eyeball. The third sign is flaccidity of the eyeball. Now eyeball is a 3-dimensional ball. It's like a 3-dimensional ball inside which there is aqueous humor, vitreous humor. Okay, so after death, intraocular tension reduces. Intraocular tension reduces. So eyeball, I don't have a ball. So size of the ball reduces. Size of the ball. Imagine a smiley wala ball, you know, ping pong ball. So the size of the ball reduces. So eyeball sunken inside the sockets, inside the eye sockets. Can you see? The eyeballs are sunken. You can see this lady. I can see the sockets over here and I can see the eyeballs are sunken inside. I can see the sockets over here and I can see the eyeballs are sunken inside. So eyeballs are sunken and soft because of the reduction of intraocular pressure. Okay, during life, the intraocular tension is 14 to 25 gram. The intraocular tension, the ball is like this. Okay, soon after death, it half. From 25, it become 12, nearly half. So the size of the ball become half. You can see immediately after death. Okay, after 30 minutes, it reduces to 3 gram only. So it's very small and it becomes nil by 2 hours. So eyeballs keep on sunking after the death. So you have to learn these figures. So during life, the intraocular pressure is 25 grams. Intraocular tension is 25 grams. Immediately after that, it becomes half. 25 ka half, nearly, approx. It's 12. It's 12. And after 30 minutes, it becomes 3. And after 2 hours, it becomes 0. You can write down 0 over here. It becomes 0. So you can learn these figures for MCQs if you wish. So that is the third sign. So we are done with first, we are done with second, we are done with third. Coming on the fourth, pupil. Changes in pupil. So what happens after death? The pupils dilate or constrict? Pupil. What happens after death? Pupils dilate or constrict? Immediately after death, it dilates. But after few minutes, it constrict. It constrict. Because after few minutes, rigor mortis develops. Na? So when rigor mortis comes, it constricts. Immediately after death, the iris muscles relax. As soon as death occurs, all the muscles relaxed. But later on, rigor mortis, all the muscle contracts one by one. I mean, not in a particular sequence. So initially, since all muscles relax, iris muscle also relax, and that's by dilatation. But later on, rigor mortis, contraction of the muscle, okay, which is causing contraction of iris also, and that is causing constriction. So initially, it's dilatation. You can see it's dilating. Appreciate it here. It's dilating. Later on, it's constricted. But rigor mortis can be uneven. It is not necessary in the two eyes, right and left, it's even. So sometime in one of the eye, you can get dilated. One of the eye, you can get constricted. So you can appreciate uneven, unequal contraction. One of the eye is dilated, one of them is constricted. So anyway, the state of the pupil is not a good indicator of antemortem condition. It's not a good indicator. Okay, so you can see that pupil, okay, but it is not indicating any of the antemortem condition. So that is regarding the pupil. So we have seen loss of corneal reflex, opacity of the cornea, flaccidity of the eyeball, pupils. The fifth one, very important, retinal blood vessels. So within minutes after death, as soon as the death occurs, the retinal blood vessel becomes fragmented. Can you see the blood inside this blood vessel? It is fragmented. Here it is present, here it's absent. Here it's present, here it's absent. Here it's present, it's absent. This is known as fragmentation of the blood. So within few minutes, immediately after death, you can say, there is fragmentation or segmentation of the blood. They form columns in the retinal blood vessels. So suppose this is the retinal blood vessel. Imagine this is one of the retinal blood vessels. So blood is like this. So blood gets fragmented. This is known as fragmentation or segmentation. And this sign is known as Kevorkian sign. It's a very important MCQ, image-based question for your competitive exam and a short question for your university exam. Kevorkian sign, never forget. So it is fragmentation of the retinal blood vessel. Is it visible as it is? No, I cannot see the retina as it is. It needs ophthalmoscope. So it is seen by ophthalmoscope like this. You can appreciate the fragmentation over here. So it is fragmentation of the blood vessels in the retina. Fragmentation of retinal blood vessels. That is known as Kevorkian sign, seen with ophthalmoscope, not as it is. So that is the retinal blood vessel, the fifth one. The last one is the chemical changes. The sixth and the last one is the chemical changes. So we take the vitreous humor. Can you see the posterior chamber? This is the anterior chamber. This is posterior chamber. Anterior chamber contains aqueous humor. Posterior chamber contains vitreous humor. We are aspirating vitreous humor out from the dead body. We are aspirating it out and seeing the potassium concentration. So potassium concentration rises tremendously up to 100 hours after the death. It is rising, keep on rising. Okay, so potassium concentration of the vitreous humor, and it can be taken for biochemical estimation of the postmortem interval because it is increasing. The potassium keep on increasing in the vitreous humor in a steady rate. So it can, at what interval we are taking it out, its level can indicate us the time of the death, approximate time of the death. So sometime in forensic laboratories, we can take the vitreous humor out and we can measure the potassium concentration and it will give us the approximate time of death. Okay, so these are the chemical changes. I hope you got it. Yes or no? So these are the 6 changes in the eye. Can we revise it quickly? What are the 6 changes in the eye after death? Can you enumerate it? Yes. The first one is loss of corneal reflex, but it's earliest, but it's not reliable. It is seen in anesthesia, general anesthesia, deep coma, epilepsy, narcotic poisoning. So it is not reliable. Second, opacity of the cornea. Since the eyelid is open even after death for many hours, so the cell debris and the mucus form a triangle at the corners. The base of the triangle is towards the corneal margin, and the apex of the triangle is towards the medial canthus and lateral canthus. These triangles are known as tachenoid. Initially, these triangles are yellow in color, later on convert into red and black color. So that is regarding corneal opacity. Okay, third, flaccidity of the eyeball. As soon as death occurs, the intraocular tension reduces and eyeball keep on sunking. It is sunken inside because during life the pressure is 25 gram. Immediately after death, it becomes 12 gram, and after half an hour, it becomes 3 gram, and after 2 hours, it becomes 0 gram. So eyeball sunken after death. Okay. The next is pupils. Pupils may dilate initially and then constrict later on due to rigor mortis. But rigor mortis can be uneven. So one pupil can dilate, one can constrict. This can also be the scenario. Okay. Retinal blood vessels. There is fragmentation of retinal blood vessel immediately after death, and this is known as Kevorkian sign. It is not seen as it is. It requires ophthalmoscope. And last one is chemical changes. In the vitreous humor, you see potassium rising steadily. So with the help of the concentration of potassium in the vitreous humor in a dead body, we can give approximate time of death. So these are the 6 changes in the eye in a dead body, the postmortem changes in eye. You can see the table. The same 6 changes are enumerated in the form of the table. If you want to learn like this, you learn like this. You want to learn like this, it's your choice. You want a table, the table is in front of you. Okay. So can we come on the next change? So let me revise. Where were we? We will revise. Where were we? Kahan the hum? We started our topic today. What is our topic today? Postmortem changes. Postmortem changes. We divide them into 3 portions. The first portion, immediate changes, are 3. They are already done. Okay. We have revised them. Insensibility, cessation of respiration, cessation of circulation. The mnemonic is IRC. I really collapsed. Then we started early changes, which are 6 in number, in which we have seen skin changes, the 2 types of skin changes, actually changes in skin and changes in the lip. Changes in the skin become pale, the skin become pale, it become loss of elasticity in the skin, in the lips it become dry, hard, and dark red or black in color. Then we see changes in the eye. I told you the 6 changes in the eye, they are in front of you, all 6. And now I'm starting muscle changes, which are very small here. Muscle changes. After that, these 3 are the big portions we have to cover today. The biggest portion of this session will be the next 3. Okay. So coming on the muscle changes quickly. What happens to muscles after the death? You tell me, muscles relax or contract? What happens? Give a guess. Give a guess. What happens to muscles after death? So 3 things occur. Initially relaxation, then contraction, then again relaxation. First primary relaxation, then contraction, which is known as rigor mortis. That is my last change over here, rigor mortis. And then again relax. So imagine a person is dead. As soon as the person is dead, the complete body relax. All the muscles relax. All the muscles relax. From head to toe, each and every muscle relax. Okay. After few hours, 1 to 2 hours, they start contracting. Not simultaneously, one by one, in a sequence. I will tell you the sequence of the rigor mortis. Involuntary as well as voluntary. Both muscles contract. First involuntary contract, then voluntary contract. And I will tell you a particular sequence. You have to learn that sequence. They contract. And again, after 36 hours, 24 to 36 hours, they relax. That is secondary relaxation. Okay, that is known as flaccidity after rigidity. First flaccidity, then rigidity. Then flaccidity after rigidity. Learn their other names. They are very easy. Okay. Rigor mortis also known as cadaveric rigidity. Rigor mortis also known as cadaveric rigidity. It is not cadaveric spasm. Cadaveric spasm is the differential diagnosis of rigor mortis. I will tell you what's the difference between cadaveric rigidity, that is rigor mortis, versus cadaveric spasm. I will come on that. I will tell you in the differential diagnosis. So these are the 3 muscle changes. So in the muscle, 3 things happen. First relaxation, then contraction, then again relaxation. This is known as primary relaxation. This contraction is known as rigor mortis, cadaveric rigidity, and this is known as secondary relaxation. So learn their names, learn the 3 phases. You can make arrows over here. Learn the sequence of their occurrence. So currently here, I'm telling you only first change, primary relaxation. Rigor mortis and secondary relaxation, I will tell you here. So in primary relaxation, as soon as the death occurred, primary relaxation, all the muscles of the body from head to toe, they relax. All the muscles relax. Primary flaccidity. All the muscles of the body, they get relaxed. Okay. All the voluntary as well as involuntary muscles, they relax. Okay. And it lasts for 1 to 2 hours. Because after 2 hours, the rigor mortis sets and they start contracting. So first relaxation for 1 to 2 hours. After that, rigor mortis set in. So contraction, and then again after 24 to 36 hours, they relax. So please learn the duration, which are MCQs, important MCQs. Okay. So what is the sequence? First of all, lower jaw fall. As soon as the person dies, now the lower jaw falls. Okay, because these muscles are relaxing. Lower jaw falls. Eyelids loses tension. The eyelids are losing the tension. The eyes are open only, and the eyelids loses tension. Joint flexible. All the joints become super flexible. You can move it very easily anywhere. All the joints are super flexible. Okay, body flattens to the contact area. It is known as contact flattening. Whatever is the position of the dead body at that time, body flattens in that position. Okay, so this happens in primary flaccidity. So in primary flaccidity, the complete body relaxes. You have to learn like this. Okay, now why the body is relaxing? Why the complete body is relaxing? Why it is not contracting? Because for relaxation, ATP. Now, as soon as a death occurs, a remnant ATP is present inside the dead body. Remnant ATP is present. Till the ATP is present, it will relax. Once the ATP is, they are utilized, there is no more ATP. The rigor mortis start. For relaxing the muscle, you know how muscle contract and how muscle relax? Physiology. You remember? There is actin, there is myosin, actin-myosin complex is formed. So for contraction, calcium is required. For relaxation, ATP is required. You are getting my point? So as soon as the person is dead, some ATPs are already present. That is causing the relaxation. Because for relaxation, ATP is required. Once the ATPs are exhausted, rigor mortis will set in. Because there is no more ATP, now muscles start contracting. Okay, you got my point. So I will tell you this again in the rigor mortis. So because as long as the ATP is there, it will break the cross bridging between actin and myosin. ATP is required for breaking the cross bridging between actin and myosin, and it causes relaxation. Okay. Although the muscles are relaxed, in primary relaxation, if you give electric stimulus, you can see the twitchings in a dead body. If you give the electric stimulus at this stage, if we are giving electric stimulus, twitchings are seen. It responds to electric stimulus. So it is responding to electric stimulus, mechanical stimulus. If you give mechanical stimulus, again you can see the twitchings. Paralysis is still going on inside the body. Okay, there is still paralysis, ciliary movement inside the body. You know where is cilia in the body? They are still going on, and WBC motion still going on. So these all are going on in the primary relaxation. The muscles get relaxed, but these all things, the muscle, although they are relaxed, they respond to mechanical and electrical stimulus. If you give mechanical or electrical stimulus, you can see the twitchings in the muscles in the dead body. Okay, paralysis is still going on. Ciliary movement still going on. WBC motion still going on in primary flaccidity, which is for 1 hour, 1 to 2 hours. Okay, sometime you can see the focal twitchings. Can you appreciate the twitchings? It can be horror. Okay, you imagine it's a dead body and you can see the eyelids are showing the twitchings. Appreciate this twitching. It's a video, it's a GIF. You can see the twitchings. So sometime due to motor neuron discharge, focal twitchings are appreciated, and it can be a horror show. Okay, someone can be scared. Is it a dead body or is it a live person? Okay, or it can be a ghost. I don't know. Okay, so twitchings are seen. Pupils react to atropine and physostigmine, but there is no reaction to light. If you put light on the pupil, no reaction. But if you put atropine or physostigmine, it will show the reaction. That is the pupil. Okay, all the muscles are relaxing now. So sphincters also relax. So dead body passes feces and urine. Fecal and urinary incontinence is very common in the dead bodies. As soon as the death occurs, urinary incontinence occur in a dead body, fecal incontinence can occur in a dead body because sphincters are relaxing. Urinary sphincter, the bladder sphincter, and the anal sphincter, they relax because they are also muscles now. All muscles are relaxing. So urine and feces evacuation is common in the dead body. So that is regarding the muscular changes I taught you. People, are you there? Are you there? Is my volume is low? Someone is saying my volume is low. So I'm having mic in front of me at the center, but I keep on moving now. So maybe some fluctuation depending on my position from the mic. But I guess it's visible. You can use a earphone for clear audio. Can we go ahead? Okay. So what we have learned till now, postmortem changes. Immediate are done, early are going on. In the early changes, we have seen changes in the skin. We have seen 6 changes in the eye. I'm sure you are able to enumerate all 6 and say some details about them, important details about them. And then we have seen muscle changes. In the muscle changes I taught you, there are 3 types of muscle changes. As soon as a death occurs, muscle relax. All the muscle relax. That is primary relaxation. After 1 to 2 hours, it is for 1 to 2 hours. They start contracting. It is rigor mortis. And it Rigor mortis is there for 24 to 36 hours. And after that, again, relaxation. That is secondary relaxation. So currently, I taught you primary relaxation. I have not taught you rigor mortis, which I will teach you here. And secondary relaxation also I will teach you here. So muscles, partially I have taught you. Only primary relaxation. So all the muscles relax. First, the jaw. The jaw muscles will relax. After that, eyelids will become loose. All the muscles will loose. The sphincters are also loose. So fecal incontinence, urinary incontinence can be there. Okay, but focal twitchings can be there. Okay, the relaxed muscle can respond to electric and mechanical stimulus. Okay, eyelids, I mean pupil is not responding to light because the iris muscles are not contracting or relaxing, but they respond to atropine and physostigmine. Okay, so they respond to the drugs, but our pupils don't respond to light. Now coming on the most important topic, these three topics are ultra important for today. Yes, so coming on cooling of the body. Algor Mortis. This is Rigor Mortis. This is Algor Mortis. Now these three are long question. People, these all are short question. They can be asked individually for the short question. They are asked for the short question. I can be the long, but remaining are short question. But these three, all of them are long question for your university exam. And for MCQ, most of the MCQ, 70-80% of the MCQ from this portion. So the next half of the session is super important. Okay, till now you got the overview, but next half, these three things are ultra important. So coming on cooling of the body. Cooling of the body is known as Algor Mortis. Learn its other name. It is known as Algor Mortis. Okay. Now, if it is coming as a long question, you have to frame your answer under these headings. You have to describe Algor Mortis or cooling of the dead body under these headings. First, you tell me the introduction. Then you tell me the heat loss mechanism. How a dead body loss heat. What are the types of heat loss mechanism you have read in your 6th or 7th standard in your school in science book? Yes or no? Conduction, convection, radiation. These are the ways how heat get transferred from one object to another. So how heat loss takes place from a dead body? Via which way? Is it conduction? Is it radiation? Is it convection? Or is it all of the above? So that we will discuss over here. Heat loss mechanism. Then the pattern of cooling. You have to draw the graph. How the cooling takes place. Okay, we will draw the graph. Then how to measure the temperature of a dead body. How to measure? What are the ways? How temperature is measured in a live person? How we will measure the temperature in a dead body? What is the approximate formula via which we can calculate the time of death measuring the temperature? Can I measure the temperature of a dead body and can I tell the approximate time of death? Yes, I can do so. Okay, so I will tell you a formula over here based on the temperature of the dead body and based on the rate of losing the temperature. I will tell you the approximate time of death. Okay, and then finally I will tell you the factors affecting rate of cooling. There are many factors that will affect the climate and the coverings over the dead body and all. So it's very interesting. But the thing is that, you know my pattern. Most of the students are old students and they know my pattern of teaching. I always teach you the things in headings so that you can revise them faster, retain them faster, and in the exam, you can write your answer under headings, so that you get good marks and distinction. Many students got distinctions this year and I'm very happy and I'm proud of you. So the same we will apply for the third prof also. Okay, so if it is coming as a long question, you learn these headings, inside which you don't have to learn anything. You have to understand and recreate in the exam by your own, in your own words. But you have to learn these headings. You don't miss these headings. You have to describe your answer under these headings. Let's start it. Let's start with the introduction. Okay, with the introduction. Introduction may fall in body temperature after death. As soon as the death occurred, body temperature started falling. Body temperature started falling. That's why I'm saying cooling of the body. Cooling of the dead body, I must say. Okay. So it is known as chill of death. The other name is chill of death, or also known as Algor Mortis. Algor Mortis, not Rigor Mortis. It is Algor Mortis, chill of death. The mechanism is very complex, but I will try to teach you. But the mechanism is very complex. It is not uniform. It do not follow Newton's law of cooling. You know Newton's law of cooling. This dead body do not follow because it is dead now. After that, there are no rules. Dead body do not follow any law of cooling. No Newton's law of cooling. It is very complex and haphazard mechanism, but we will try to understand. It helps us to calculate the approximate time of death. That's why it's very important. I told you now, we can measure the temperature of the dead body and we can see the rate at which temperature is falling and we can calculate the approximate time the person was dead. From that, I will give you a formula for that. So that's why this is very important to measure the temperature of the dead body in medico-legal cases, not in all cases. We are talking only about medico-legal cases here, by the way. Okay, we see postmortem changes only in medico-legal cases. not in any other natural death or any other casual death. Okay, chalo. So what are the ways heat transfer takes place? In the school time we have learned there are three ways the heat transfer takes place. One is conduction, in which heat is transmitted via solids. Can you see? These are solid particles. So they are transferring heat one to another. Solid. Conduction takes place in solids. It is direct contact. Via direct contact, the heat transfer. Okay. So if it is in direct contact, then only heat is transferring. Direct contact, solid particles. This is known as conduction. I guess everyone knows that. School time. This is convection, the second way, which occurs in liquids as well as gases. Okay. It is not direct. You can see the lower molecules are heated. They come up and the upper molecules go to get heated to the below. So these waves are created. Have you tried boiling milk or water on a gas? You can see the convection. Okay. So first these molecules are heated, they come up, and the upper molecules which are cool, they go down. It is not direct contact. This is convection. It is seen in liquids as well as gases. Okay. And third, radiation. Via radiation, the heat is transmitted to the atmosphere directly. So that is radiation. So these are the three ways of heat transfer. I guess everyone know conduction. Energy is transferred via direct contact. In solids, convection, energy is transmitted via motion of the molecules. Molecules are moving. Okay, it is not direct contact. It is seen in gases and liquids. And radiation. Radiation is transmission of the electromagnetic radiations to the atmosphere directly. So these are the three ways I guess everyone know. Now with this introduction, let me come on the heat loss mechanism in a dead body. Which one is working in dead body? Out of the three? All three. Suppose this is a dead body. Okay, now it is losing heat. So how it is losing heat? Via direct contact, it is losing the heat to the surface. It is losing the heat to the surface. Wherever the body is lying, it is losing the heat. So this is conduction. Via direct contact, it is losing heats to the bedding, floor, objects all around. So this is conduction, direct contact, number one. Convection. So air is all around, na? Air is a gas. So air is all around. So it is losing the heat to the air molecules, moving air or water currents. If the body is in water, sometimes the death occurs in drowning. So in the water or in the air, that is convection. And radiation, via radiation also the heat is lost. So all three mechanisms, the dead body is losing heat. My point is that. Okay, now as soon as the death occurs, we all know circulation stops. Yes or no? Yes, obviously. As soon as the death occurs, the circulation stops. When the circulation stops, now inside this dead body, please do understand. This is the blood vessel, for example. Okay, blood is flowing in the blood vessel. So blood transfers heat. Okay, we all are alive right now. Inside our body, we have multiple blood vessels. Blood is flowing constantly in all the blood vessels. So blood is transferring heat from here to there. That's why we have a uniform body temperature. Okay, and blood is transferring the heat from here to there. So blood flow is important for transfer of the heat. But when the person is dead, this person is dead. So here the blood stop flowing. The blood stop flowing. There is no blood flow. So convection stop. There is no convection. Okay, internal heat transport by convection stop. Normally heat transport takes place in a live body via convection. We have blood vessels. Blood vessels contain blood. Blood is a liquid. And via convection, it keeps on transferring heat from heater areas to cooler areas. And that's why we have a uniform body temperature of 37 degrees Celsius. Yes or no? But this one will stop. So you must think, ma'am, heat is not transported from here to there, so body start losing heat. But no, the mechanism is complex. You know, body generate heat first. Body generate heat by residual metabolism, residual metabolic processes and bacterial metabolism in the intestine. So initially body is generating heat. Okay, at one end I am saying body is losing heat, at another end I am saying body is generating heat. So initial temperature is constant. You are getting my point? They are cancelling each other. So on one end I am saying the blood flow stop, and that's why internal heat transport stop. There is no convection. So you may thinking body is losing heat. Yes, body is losing heat. But on the other end, body is generating heat. So they cancel each out. Since they cancel each out, initially there is a plateau. I will show you the graph. If you appreciate the graph over here, I will show you the graph. In this graph, initially you can see there is a plateau. This plateau is that there is cancellation. On one end, body is losing heat, and on other end, body is generating heat. Okay, so initially there is a plateau. That's what I want to explain over here. Okay, initially there is a plateau. Now after some time this will stop. Heat generation will stop. Now body will start losing heat. As soon as the cooling begins, there is a temperature gradient. I mean, the heat is lost from the surface, not from the core. So there is a temperature gradient. The core is warmer and the surface is cooler. there is a temperature gradient in the dead body. When the cooling starts, the core is warmer and the surface is cooler. So there is a temperature gradient. There is a temperature gradient, and heat transfer takes place from here to here, from here to here, till the temperature becomes equivalent via conduction. There is no convection because blood is not flowing. In a dead body, it cannot be convection. It is only conduction. Via direct contact, organ to organ, organ to organ, cell to cell, cell to cell, it is losing heat. So this happens. Okay, and finally it happens till the temperature of the body become equal the temperature of the environment. Both of them become almost equal, then it stops. So this is how cooling takes place. You understood? So let me summarize what I have explained. So heat loss mechanism, initially, as soon as the dead body is there, so conduction, convection, radiation, via all mechanism, it is losing the heat. Okay. Now, as soon as the death occurs, circulation stop. Since the circulation stop, convection will stop. Convection will stop, so body start losing heat. On one hand, it is losing heat. On other hand, it is generating heat. So they cancel each out, and initially there is a plateau. Initially there is a plateau. Later on, generation will stop. Only losing is there. Now losing is more on the surface as compared to core. So there is a temperature gradient between the surface and core. So from the core, the heat comes to the surface and keep on losing to the environment via conduction, not convection, till it becomes equivalent to the environment. How many of you got it? It was complex, but I tried with the help of flowcharts, the complete story. Give me a thumbs up, everyone. Say, got it? So this is how the heat loss takes place in a dead body. You have to write down all the flowcharts. Initially, why there is a plateau. You have to explain. The two things are cancelling each other. You should explain. Convection stop. You should be able to explain that. Okay, and later on, what is happening? How temperature gradient created between the core and the surface. The body is losing heat from the surface, not from the core. So core is hotter, but the surface is warmer. So there is a temperature gradient, and based on which we will calculate the approximate time of death. I will come on that formula. Okay, now coming on the graph. Pattern of cooling. I will come on the graph. Okay, now what happens? What happens? How to draw this graph? So initially, in the half to 1 hour, temperature is same. It is plateau, 37 degrees Celsius. Normal human body temperature. It is known as isothermic phase, or it is known as plateau. It is known as plateau. Appreciate this plateau. Isothermic phase. You know the reason. On one hand, body is losing heat. On other hand, body is generating heat. Both things cancel each out. So initially, half hour to 1 hour, you can say. You can see the time, half hour to 1 hour. Appreciate, on x-axis we have time, and on y-axis we have the temperature. And this temperature is 37 degrees. You should be able to draw it in your exam. People, I will draw it for you. So draw here, write down 37 degrees Celsius. So initially for 1 hour, it's constant. It is known as isothermic phase. Later on, there is linear cooling rate. What is the rate of falling? What is the rate of falling the temperature? 0.4 to 0.6 degrees Celsius. What is normal temperature? 37 degrees Celsius. In 1 hour, 37 minus 0.6. In the second hour, whatever is the answer, minus 0.6. In the third hour, whatever is the answer, minus 0.6. You can do the calculations. So 0.4 to 0.6 degrees Celsius per hour for the next 12 to 16 hours. You can see fall. 0.4 to 0.6 degrees Celsius per hour for the next 12 to 24 hours. You can see. Okay, so this will happen. And finally, it will slope uniform because the temperature of the dead body is nearly equivalent to the atmosphere, to the environment. Then again it becomes constant. So this is the complete rate. You should be able to draw this graph. It is starting from 37 degree, falling, and becoming equivalent to the temperature. I don't know the temperature of the atmosphere. Maybe it is a summer season, maybe it is a winter season, maybe it is a rainy season, spring season, maybe it is a tropical country, maybe it is a temperate country zone. I don't know. So depending from region to region, season to season, climate to climate, the temperature of the atmosphere will differ. Death occurs in all seasons, of course. Okay. So it will occur till the temperature of the dead body become almost equivalent to the environment. Then again a plateau is coming. So you should be able to draw this graph. Other two graphs I will tell you later on when I will teach you lividity and decomposition and all. Currently you focus on this one graph. That is cooling graph. Algor Mortis graph. So you should be able to draw that. So please see. So tell me the graph. Say initially half to 1 hour. It's isothermic phase or plateau phase in which temperature is same, and tell the reason for that. On one hand, body is losing temperature. On other hand, body is generating the heat. You know the reason of generation, and they cancel each other. For half to 1 hour. After that, there is a linear fall. What is the rate of this fall? Say 0.4 to 0.6 degrees Celsius per hour for the next 12 to 24 hours. next 12 to 24 hour, see 24 hour, and after that it becomes constant when it becomes equivalent to the environment. I'm giving a big range, I don't know the environment. Okay, cooling occurs fast in winters, cooling occurs slow in summers. Obviously you can understand this physics, yes or no? So that is the graph. I hope you got it. Now, how to measure the temperature of a dead body? How to measure the temperature of a dead body? How we measure the temperature of a living body in a living person? I mean, we can keep the thermometer below the tongue, okay, or we can keep the thermometer in the axilla. Okay, what are the ways of measuring the temperature in a dead body? First of all, we need a long thermometer. A 25-meter long thermometer, a laboratory thermometer is needed, and we can take the temperature at the three sides. Usually the best is to take the rectal temperature. We can take the rectal temperature of the dead body, okay, to see the temperature, actual temperature, because rectal temperature will give the core body temperature, rectal temperature, okay, except in case of sodomy. I will teach you sodomy in sexual assault, okay, sexual cases. So in case of sodomy, we don't put the rectal thermometer. Otherwise, in all other cases, we can take the rectal temperature, or else we can take the temperature from the liver surface. How to take the temperature from the liver peritoneal surface? A small incision is given and insert the thermometer. A small incision is given over here and insert the thermometer and take the temperature from the peritoneal surface of the liver. That is the second way. And third is external auditory meatus or nasal passage. External auditory meatus. External auditory meatus or nasal passage. So these are the three ways via which we can take the temperature in a dead body with a 25 centimeter long thermometer. So this is how we take the temperature. Now tell me the formula. With all this, why we are doing all this? You say, ma'am, why to take the temperature of a dead body? Come on, ma'am, what clue it is giving? By doing all this thing, I can come to know the time of death, approximate time of death, with the help of a formula. I'm having a formula. What is the formula? This is the formula. This is the formula. Time since death. This is the formula. What is the numerator? What is the denominator? Appreciate the numerator and denominator. The numerator is normal body temperature, that is 37 degrees Celsius. Normal body temperature minus rectal temperature. I told you, na, rectal temperature is the best temperature. You measure rectal temperature of the dead body. Okay, so 37 degrees Celsius minus whatever temperature you are measuring right now. So rectal temperature will depend the time you are measuring the temperature, because you know at what phase you are measuring, I don't know, na. So suppose I'm a forensic expert, I'm at the scene of crime and there is a dead body. It's a medico-legal case, okay, and the police want to know the approximate time of death. So at what time I'm measuring the rectal temperature? Maybe it is this time, this time, this time, this time. We don't know, na. So we will measure the rectal temperature. We will measure the rectal temperature and we will subtract it from 37 degrees. So 37 degrees Celsius minus rectal temperature upon rate of temperature fall per hour. Okay, so what is the rate of temperature fall per hour? I told you it's 0.4 to 0.6 degrees Celsius per hour. So exact what is the rate of fall in this particular dead body which I found at the scene of crime, at the crime scene. So I have to take multiple readings. I must take multiple readings every 1 to 2 hours to know this rate. Is it 0.4 or 0.5 or 0.6? I have to be precise. I cannot take approximately 0.4 ले लो 0.6 क्या फर्क पड़ता है? No फर्क पड़ता है. Okay, it may decide the criminal. It may help the police and the judge to take the decision, to do the justice. Okay, so we will take multiple readings in the dead body. Suppose this is a dead body in front of me. Okay, at the crime scene, and the police want to know the approximate time of death of this dead body at the crime scene, and I am the forensic expert which is called at this crime scene. Okay, so we will take the body to the forensic laboratory, and what we will do, we will measure the rectal temperature of this dead body multiple times, 1 hour, every 1 hour, every 2 hours. So we will come to know the rate of fall. Is it 0.4 degree, 0.6 degree, 0.5 degree Celsius per hour? How much it is falling? So this rate, and when I found the dead body, at that time, what is the rectal temperature? The first rectal temperature. I will put these readings over here and I will get the approximate time. So please learn this formula. Everyone got this formula? You learned this formula? Normal body temperature minus rectal temperature upon rate of fall. Say the formula, learn the formula, with the help of which you can see the time since death. You can see nowadays many series, many on the, television, you can see many series now on which all these things are shown, how forensic expert tells the approximate time of death. In many movies also it's shown. CID to sabne dekha hoga bachpan mein, yes or no? So this is how actually they calculate. So this is the formula you have to learn, and it's very important for scene of crime. Okay, So yeah, but the most important thing you must ask me over here, ki ma'am, is it not necessary that at the time of the death, the person is having normal body temperature? Normal body temperature is 37 degrees Celsius. This question should come in your mind. Ki ma'am, what if at the time of the death, the person is not having this temperature? The person is having more temperature or less temperature. And that time, this formula is not applicable. This formula will not be applicable. So body temperature may not always be normal at the time of the death. You are getting my point? So body temperature is high in embolism. If the death is due to embolism, in case of septicemia, patient have high grade fever. In case of heat stroke, in case of pontine hemorrhage, brain hemorrhage, pontine hemorrhage, in case of thyrotoxicosis, stress, drug reaction, carbon monoxide poisoning, heroin poisoning, cocaine poisoning, in all of them, there is high grade 104, 105 not. So there is high grade temperature. You're getting my point? And the temperature can be low in case of collapse, okay, hypothermia, hypothyroidism, cholera, shock. You're getting it. Because here blood flow will be less. So temperature will be less. So this formula will not be applicable in such cases. We are talking about this formula when at the time of the death, the person is having normal body temperature. Are you getting my point? So all these things you have to take in consideration being a forensic expert. Okay, becoming a forensic expert is not at all an easy job. Getting my point? Now coming on the last thing. Factors affecting rate of cooling. We have already seen the formula. And finally, I'm telling you the factors which affect the rate of cooling. So how many factors? We are having 5 factors which affect rate of cooling. What are these 5 factors? Number 1, temperature difference between the dead body and the environment. Dead body and environment. What is the temperature difference between the dead body and the environment? So in tropics, in temperate. Tropic climate, temperate climate. In tropic climate, the rate of cooling is 0.4 to 0.6 degrees Celsius per hour. I told you in India it's like this. But in temperate climate, it can be 1 degree Celsius per hour. It can be as high as that. Okay, so if you get the dead body and if you are a forensic expert, measure the temperature, maybe rectal, maybe liver, maybe internal auditory canal, whatever temperature you are measuring, measure that temperature multiple times to come to know the exact rate of cooling. Okay, so it depends on the temperature difference between the dead body and the environment. The external environment is cool or warm or hot. Depending on that, the heat loss will be there. Common physics. Okay. Second, build of the cadaver. Build of the cadaver. Cadaver is a child or an old or adult. Now, simple formula is that cooling rate is directly proportional to weight upon surface area. Cooling rate is directly proportional to weight upon surface area. Okay. So, weight upon surface area is high in children and adult. Weight upon surface area as compared to adult. So, cooling is faster in children and adult. Children and old as compared to adult. So in adult, cooling is slow, but in children and old, cooling is fast. Cooling is fast. I'm talking about the dead body. Suppose there is a dead body of a child, adult and old. Okay, there are many factors, but one of the factors is build of the cadaver. It is weight upon surface area. Weight upon surface area will be high in children and old age. So cooling is faster and that will be low in adult. That's why cooling is lower. The third is the physics. Okay. Now whether there is an obese person or a lean person. There is a dead body of an obese person or a lean person. In obese person, it cools slowly because there is much of the subcutaneous fat that will act as the thermal insulator. Okay. So core temperature cannot be lost in the environment because lots of fat around the body, which will act as like an insulator. Common sense. Okay, that's why it will cool slower. Lean body don't have much fat. Subcutaneous fat is less, so it will cool very faster. So if there are dead bodies of an obese person and a lean person, so obese will cool slowly and the lean will cool fast. You can understand. It depends on the subcutaneous fat. I hope you got it. That is the physics. The next is the environment. Okay, now environment. If the dead body is kept in a ventilated room, suppose the dead body is kept in a ventilated room, so cooling is faster. And if it is kept in a packed room, cooling will be a little bit slower. Okay. And what about the body immersed in water? Suppose there is a dead body, in case of drowning, it is immersed in water for 2-3 days, 1-2 days. Sometimes it happens. Maybe it's a suicide, maybe it's a homicide, maybe it's a murder, maybe it is killed on the land and then thrown in the water. We don't know. That's what we want to know here. Yes or no? So what about the cooling of the body in water? So if the cooling in water is always fast as compared to cooling in air. In water it's always fast, obviously. In still water, cooling rate is double. In flowing water, it's triple. But in sewage water, sometimes the dead bodies are thrown in sewage, drainage and sewage sometimes. So it is lower because of the organic matter. Sewage contains the feces, the organic matter, no? So cooling is lower. So still water, flowing water, it is faster. But in sewage water, it is slower. The reason for slow cooling in sewage water is organic matter. Okay. I hope you're getting all these points for your MCQs. Don't try to mug it up everything. Whatever you are remembering, you write down in your university exam, you will get distinction. Take my words. Take my words. Okay. For MCQ, you don't try to mug it up. Looking at the options of the MCQ, you will realize the correct answer. The beauty of the MCQ, the 4 options are in front of your eyes. It's not fill in the blanks. It's MCQs. The 4 options are in front of your eyes. Only thing, your eyes must be able to pick the correct one. And by listening my lecture at least once, you should be able to do so. So don't try to mug up and take so much stress. Ma'am, there are so many points in forensic. It's okay. Whatever you are remembering, you write down in university exam. So distinction pakka. And in MCQ, I guarantee you will be able to solve all the MCQs. Okay, even if you are listening the lecture once with attention. And last thing here is the coverings of the body. The dead body is covered in blanket or simple clothes are there. If it is covered in blanket will give the insulation. So slow cooling will be slow. But if it is simple bed sheet, simple clothes, so cooling will be faster. Common sense. So these are the factors which affect cooling. What are the 5 factors? External temperature, depending what is temperate climate and tropic climate. Okay, the second is build of the cadaver. It is fast in children and old, and it is slow in adult. Okay, it is fast in lean, it is slow in obese. Okay, it is fast in a ventilated room as compared to packed room. It is fast in water as compared to air, but in sewage water it's slow. Okay, and depending on the covering, is it a blanket or simple bed sheet, the dead body is covered in. So common sense, these are the factors which affect the cooling. So if it is coming as a long question, will you be able to write down? Say yes. Will you be able to write down? Yes. So we will revise it. We are done with Algor Mortis. I will come on the next topic. Before that, you people help me in revising. Say, you people. So Algor Mortis. If you are getting a long question on Algor Mortis, you are going to describe your answer under these headings. People, give me a thumbs up. Come on. Chalo. So in the introduction, what you are going to write? In the introduction, write down, it is known as Algor Mortis. Okay. And it's a complex mechanism. It do not follow Newton's law of cooling. In the introduction, you can write down these points. Heat loss mechanism. Dead body loses heat by all 3 mechanisms: conduction, convection, and radiation. Okay, but you have to explain it. As soon as the death occurs, convection inside the body will stop. There is no convection because blood flow stops, circulation stops. There is no convection. Okay, now on one side, body lose heat, and on other side, body generate heat because of residual metabolism and the intestinal bacteria, they generate heat. So they cancel each out. And initial phase is isothermic phase or plateau phase. Initial for half to 1 hour. After that, body only loses heat. It don't generate. Generation will stop. It don't generate. Only lose. It keep on losing heat. Okay. And it will keep on losing till the temperature of the dead body become almost equivalent to the environment temperature. Okay. So if you want to draw the graph over here, the pattern of the cooling, we will draw the graph. Graph have x-axis, y-axis. On y-axis, we will take the temperature, 37 degrees Celsius, the normal human temperature. And here we will take the time, half hour, okay, half hour, 1 hour, 2 hour, 3 hour, like that. Okay, we will take the time. So initially for half to 1 hour, it's plateau. After that, it falls uniformly at a rate of 0.4 to 0.6 degrees Celsius per hour till it become equivalent to the environment and again become plateau. So you should be able to draw this graph in your exam with clarity. That is pattern of cooling, the 3 phases on the graph. You should be able to show. Then how to measure the temperature of the dead body? There are 3 ways to measure the temperature. We can measure rectal temperature. Okay. We can measure the liver temperature. We have to give a small incision over the right quadrant of the abdomen. And we should take the intraperitoneal surface liver temperature and internal auditory canal. The thermometer is put in the ear. The temperature of the internal auditory. These are the 3 ways to give the temperature of the core body temperature. Okay, so this is how we measure it. Approximate formula. Who will help me? What is the formula? So approximate time of death is equal to, what's numerator, what's denominator? Numerator is normal temperature, that is 37 degrees. Normal temperature minus rectal temperature of the dead body. Normal temperature is 37 degrees Celsius minus whatever is the rectal temperature you are measuring it here upon rate of cooling. Rate of cooling, don't take always this. You measure the exact rate of cooling by taking multiple readings of the dead body. Okay. Now factors affecting cooling. I told you the 5 factors to describe them. We are done. People, we are done. With the long question, we are done. Can we come on the next topic? People show some interest. Come on. Huh? The chat box is still. Give me an emoji. Give me a thumbs up. Huh? Whatever is it. Okay. Yes, absolutely right. Yes. Can we go ahead? So can I come on the next big topic? Postmortem lividity. Postmortem lividity. So we are studying the early changes, early postmortem changes. Immediate are done and we are doing early postmortem changes in which the first 4 are done and I'm coming on the 5th one. The 5th one is postmortem lividity. Again, it's a long question. I told you, these 3 are ultra important. Okay, and these 3 are also ultra important. So out of the 12, 6 are super duper important. The remaining 6 are also good, but not very important. Yeah, eyes is also important. So these 7 are very important. The others are okay. Okay, chalo. So we will come on postmortem lividity. Can I start postmortem lividity? You can see. If it is coming as a long question in my university exam, if I'm a 3rd prof student or final year student, wherever your forensic lies. Okay. So I would like to write my answer under these headings. Appreciate the headings. So I always teach you in headings so that it retain in your mind. See the pattern. You have to learn these headings. That's it. You don't have to learn what you have to write inside the headings. That you have to understand and create your own language, own words. Again and again, I say the same thing. It's a thing. You have to understand how to study. What to study, you have multiple sources. You study from me, you don't study from me, doesn't matter. You study from any platform, any source, doesn't matter. Everyone is good. The source are different, but everyone is good. The content is same. Only the pattern differs. Got it? So whatever frequency matches with you, you should follow that source, that platform. Okay. But the point is that how to study now, you should understand that. From whatever source you are following, you should learn the headings under which you should describe your answer. Okay. What to write inside, you shouldn't learn that. Okay, you do reverse. What to write inside, you try to mug it up and you can't do so. And you don't know the heading, so you mess up in your university exam and you don't get good marks. You are getting my point. So learn these headings under which you have to write your answer. Okay, chalo. So if you're preparing for your prof exam, if you have already cleared your prof exam and you are watching my session for your competitive NEET PG INICT, don't even learn the headings. Just listen me attentively. Take my words, 100% hit rate will be there in the MCQs from this topic, whatever I'm teaching you. Chalo. Postmortem lividity. So you have to write your answer under these headings. It is also known as what. There are multiple names of postmortem lividity. Then tell me the definition, mechanism, intensity, development. First it will develop, then it will progress, then it will shift. First it will develop, then progress, then shift, then its extent, its distribution, then it fix finally. After shifting, it will fix. It is absent in what cases? Sometimes it happens in internal organs also. Color changes and medico-legal importance. So these are the headings under which we are going to study. Okay, let's start with the first one. Postmortem lividity. It is also known as, what it is known as? It is also known as hypostasis. It is known as Livor Mortis, not rigor. Okay, so I told you 3 mortis. This is Algor Mortis, this is Livor Mortis, and this is Rigor Mortis. So understand the 3 mortis. They are different. Algor Mortis is cooling of body. Okay, Livor Mortis is staining of the body. And Rigor Mortis is contraction of the dead body after initial relaxation. Okay, all 3 terms are different. Okay, chalo. So it is also known as hypostasis, Livor Mortis, cadaveric lividity, okay, postmortem staining, subcutaneous hypostasis, and darkening of death. Darkening of that death. You can see the dead body stains at various areas. I will tell you which areas. So staining of the dead body is this. It is hypostasis. What I am teaching you right now, postmortem lividity, also known as hypostasis, Livor Mortis. So you get your long question on any of them. You should be able to identify they all are synonym. They all are synonym. Okay. So what is the definition? It is also known as, you learned, Livor Mortis, cadaveric lividity, postmortem staining, darkening after death. Okay. Now what is the definition? What happens after death? As soon as the death occurs, capillaries and the veins distend. Arteries have a thick wall. Arteries don't distend because they have a thick wall. Oh, obviously, you have learned this in pathology, physiology. Capillaries and veins have thin wall. They get distended. Okay, because all the muscles are relaxing initially. So the muscles of the capillaries and the muscles of the veins also relax. So they get distended. Once they get distended, there is bluish purple bluish purple discoloration of the skin. Can you see the bluish purple? Say the word. Which color? Bluish purple or purplish red, whatever you say. Either say bluish purple or purplish red. You have to be specific in color. Bluish purple color or purplish red color. Okay, it is seen on the dependent parts. Highlight the word dependent. Dependent areas of the body. Why it is dependent, I will tell you. Because gravity is always there. Whether we realize or we don't realize. Newton told us gravity always works. At every moment, at every second, gravity is working. So that's why it is the dependent portion. I will explain. And this is known as postmortem lividity. So don't try to mug up the definition. So say, try to create it. After death, what happens? After death, the capillaries and veins distend. Okay, and which gives the bluish purple or purplish red discoloration on the dependent areas of the body, and that is known as postmortem lividity. Got it? Now, why it is the dependent areas? You will understand here. In pathology, have you read pathology from me? Yes or no? If you have read it, you may be knowing this diagram. Yes. So what is this diagram? In human body, in all the blood vessels, the blood flows axially. This is known as axial blood flow. What do you mean by axial blood flow? What do you mean by? So this is the blood vessel. The blood flows at the center of the blood vessel. In the periphery, there is plasma. Appreciate, this is all plasma. This is all plasma. The blood is traveling at the center. RBC, WBC, and platelets, all of them, all the cells are traveling at the center. Okay, it is Bernoulli's theorem, you know. So the heaviest portion of the fluid is at the center and the lightest portion of the fluid is at the periphery. Have you read Bernoulli's theorem in physics in your school time? So that is what applicable over here, and this is known as axial blood flow. So normally in all of us, you, me, unless until it is not inflammation, okay, we don't have inflammation anywhere, the blood flow is axial. The blood flow is like this. Okay, now whenever the body is dead, blood keep on flowing, it never stops. There is no stasis unless and until there is some disease or stasis, inflammation. So blood keep on flowing, but whenever the person is dead, okay, blood stop flowing. There is no blood flow. When the blood stop, imagine the blood stop, gravity will attract it. Gravity will attract it. Okay, gravity works all the time, and because of the gravity, everything will fall on the dependent area. Now, depending the dead body is in prone position, supine position, lateral position, you know, in which position the dead body is. The dead body is hanging, the dead body is inverse. Okay, depending, I will tell you all the conditions. So whatever is the dependent area, blood will come on that area because of the gravity. So this is how you should be able to explain. So after death, circulation stop. Obviously, as soon as the death occur, the circulation stop. Blood becomes stagnant. Blood flow will stop. Blood flow will stop. It will sink by the gravity. You can see it will sink by the gravity. The gravity will attract it. All will fall down, and it will accumulate. It will accumulate. Okay, in the dependent areas, and on the dependent areas there is bluish purple discoloration. I hope everyone got it. Give me a thumbs up. You got the mechanism? Huh? You got the mechanism? This is known as postmortem lividity, and this leads to postmortem lividity. Appreciate. Now this body is supine. This body is supine. That's why I can see postmortem lividity over here, over here, over here on the dependent areas. You are getting my point? So what is the intensity? Is it light blue color or dark blue color? It depends how much reduced hemoglobin the person is having at the time of the death. So this reduced hemoglobin is giving the color. So all of them are falling. RBCs are also falling. WBCs are also falling. Platelets are also falling because of the gravity. But here, who is giving the color? The color is given by the reduced hemoglobin present inside the RBC. So how much amount of reduced hemoglobin present in the RBC, that is giving the intensity of the color. If large amount of reduced hemoglobin present before death, so postmortem lividity will be very intense, dark blue, purple, red color, like that. And if reduced hemoglobin is less, it will be slight color. I mean, faint purple or blue color. Got it? Now coming on the development. Okay, it depends on the reduced hemoglobin. You learn that. You learn the mechanism. The mechanism is the gravity. Gravity. After death, blood flow stop. Circulation stop. So gravity will attract the blood cells. So RBC, WBC, platelet, they all will fall. And that will give the bluish discoloration. The reduced hemoglobin in the RBC. I hope to be very precise, you got it. Intensity, you got it. Development. It develops soon after death. But within 1 hour, in normal case, up to 1 hour, it's not visible. It starts, but it not visible up to 1 hour. In anemia, up to 4 hours, it's not visible because anemia have less hemoglobin. Na? Suppose this person is anemic. This person is anemic. So very less hemoglobin. Okay, so up to 4 hours, it will not be visible. Normally, up to 1 hour, it is not visible. After 1 hour, it starts appearing. Okay, after 1 hour, it appears as dull red patches. then the patches coalesce with each other and form the big areas. So this is the development. This is the development. This is like this. Now this body is prone. That's why the dependent area is the chest. Okay. The body is supine. So dependent areas will be the back, buttocks. I will show you. Okay. The position to position it will differ. Now progression. Within 4 hours, it is well developed. Maximum in 12 hours. And it persists until putrefaction set in. Okay. So it is start after 1 hour, well developed in 4 hours, start in 1 hour, well developed in 4 hours, maximum in 12 hours, and persist till putrefaction. Learn like this. Start after 1 hour. I mean start visible after 1 hour. Okay, 4 hour में well developed, but not maximum. 12 hour में peak, maximum, and it remain there till putrefaction set in. Okay, and it blanches. Yes, I forgot to write here. It blanches on pressure. If we are giving the pressure, you can appreciate the blanching. You can appreciate the blanching. Okay, appreciate. Okay, this area, why this area is not showing the lividity? This area is in contact with the surface. Maybe the person is supine at the time of the death. After death, I mean dead body is supine. So this area is in contact with the surface. Okay, so remaining area it is showing. This area, the contact area, don't show it. It is compressed now with the surface like this. I will show you the images. Okay, it is more visible in fair people. Obviously, on the fair people, on the fair skin, it's more visible. It is almost absent in anemic person. So you should know in fair people, it's more visible. In anemic, it's almost absent. Color intensity, is it bluish, purplish, or reddish? The intensity of that color depends on the reduced hemoglobin at the time of the death. So learn all these pointers, people, and learn the headings. Now, shifting of lividity. Can lividity be shifted if the dead body position is changed after death? Suppose initially dead body lies supine, and after that it become left lateral, left decubitus, right decubitus, or prone position. So lividity will shift if the body is moved within few hours. Okay, if the body is moved within few hours, so original patches will disappear. Initially, suppose it is supine, so lividity is on these areas, buttock, back. Then it is prone, suppose, so it will be on the face, chest, like that. It will shift because gravity will work like that now. So gravity work on the dependent area. So original patches will disappear and new patches will form, and this is known as secondary lividity, and that can confuse the forensic expert. What was the position of the dead body at the time of the death? In the crime scene, everything is important. Okay, so ultimate purpose, visiting a crime scene, forensic expert want to answer two things. Okay, how death occur, number one, and how long does it take? How much is the time, approximate time of the death? These two answers I told you in my first slide. Okay, so if the position of the dead body is changed within few hours of the death, the lividity will shift and it can confuse the forensic expert. No? So forensic expert will consider the secondary lividity that is not showing the original position of the body at the time of the death because it is changed. Okay, based on which we can presume that this is the original position of the body at the time of the death. Okay, so this is regarding the shifting of lividity. Lividity can be shifted unless until it is not fixed. So I told you after 1 hour it start visible. In 4 hours it is well established. Okay, in 12 hours it become maximum and it remain there till putrefaction. Okay, but if the body is shifted in the initial hours, it will shift its position. Okay, that is shifting of the lividity. Please understand all these points. Now, extent of lividity. Extent of lividity, how much area it will cover? What is the extent? We have seen the intensity, but now I'm talking about the extent. Intensity depends on reduced hemoglobin concentration at the time of the death. Extent depends on two things. Number one, how much blood the person is having. How much blood volume? More blood volume, more hemoglobin, and more extent. Okay, how much blood volume the person is having at the time of the death. Okay, maybe person not in shock. In case of shock, hemorrhagic shock, maybe less blood volumes or less lividity. You got my point? And duration, the blood remains fluid after death. Duration for which the blood remains fluid after death. Blood coagulates after death, no? So after the coagulation, lividity don't appears. So on these two factors, the volume of the blood and the duration for which the blood remains fluid, the extent of lividity depends. Okay, I hope you got it. Now, the most important thing, whether you learn all these things or not, just a second. Let me save the annotations, just a second. I'm sorry. Whether you learn all these things or not, it's your choice. It's not very important. But the most important thing in postmortem lividity is the distribution depending on the position of the dead body. So there are 6 different conditions. Whether the dead body is supine, where is the lividity? When the dead body is prone, where is the lividity? The dead body is lateral, where is the lividity? Dead body is the head down condition, like this. The head is hanging. Okay, what is the lividity? In case of hanging, what is the lividity? In case of droning, where is the lividity? Okay, so it will give clues to the forensic expert to decide the cause of the death. Got it? So we will discuss one by one with the images. So coming on first, supine position. In supine position, can you see the dead body is supine? At the time of the death, the person is supine. So dead body is there in this position from last many years. So where is the lividity? The lividity will be all these in a supine position. So where it is? It is in the neck, back, flanks, and side of the neck. You can see it is at the neck, it is at the back, it is at the flanks and the side of the neck. The dependent areas. Learn one rule. The lividity will be on the dependent areas. You can see, appreciate the lividity. It will be not there on the areas which are in contact with the surface. You can see this area is in contact with the surface. So lividity will not be there in contact area. The remaining area, the pressure area, lividity will not be there. Okay. But other dependent areas, lividity will be there. Appreciate the bluish, purplish, reddish color. Appreciate the intensity, appreciate the distribution. You know the factor which decide intensity, you know the factor which decide distribution. Got it? So pressure areas like the occiput, buttocks and thigh are pale. They don't show lividity. Occiput, appreciate the buttocks. Buttocks are always pressure area when the person lie down supine. So buttocks are always the pressure area. On buttocks there is no lividity. Okay. On the occiput there is no lividity. Occiput is not shown here. This area, occiput, there is no lividity. So on the pressure areas, it is pale. Okay. Sometimes if the tight clothings are there at the point of the elastic or tight clothing is there, that area remain pale. Okay. So that is the supine. I guess everyone got it. Coming on the prone. If the dead body is prone, if the dead body is, so what is the dependent area now? The dependent area is the face and chest. Face, chest and front of the limbs. Front of the limbs, not back of the limbs. So this will be the lividity. So since the complete blood is stagnant on the face, so sometimes nasal bleeding occurs. Okay, from the dead body. Appreciate in this case, nasal bleeding can occur. Okay, so nasal bleeding is very common in this position. That is prone position. Coming on lateral, can you see the dead body is lateral? In this case, lividity occurs only on one side. Depending in which side, is it right lateral or left lateral, right decubitus or left decubitus. So only on one side the staining occurs, lividity occurs, not on the other side. So depending on the staining, we come on a conclusion what was the position of the body at the time of the death, at the crime scene. You are getting my point? It is giving a big clue. So appreciate in supine position, in prone position, in lateral position. Tell me the areas of the lividity. I have shown you the images. In supine position, say it's neck, it's back, and its thighs. Okay. In prone position, its face, its chest, and its upper area of the limbs. Okay. In lateral decubitus position, it is only on one side, whether right or left. So you should be able to draw these images and explain. After that, coming on the fourth, head down. Sometimes the head is hanging. Suppose someone is lying on a bed and the edge of the bed, suppose this is a bed. Okay. And dead body is here like this. Okay. The head of the dead body is hanging like this. Okay. Don't laugh at the images. I'm trying just to explain you the hanging head. So the head is hanging. The head and the neck are hanging like this. In that case, the complete lividity in the face. Okay. Face and neck. Deep congested. Looking like suffocation. It may mimic suffocation. Okay, it can be seen in drunkards. Okay, the person is drunken and died like this, or in case of epilepsy, like that. Okay, hanging. What about hanging? Where will be the lividity? What is the dependent area? It will be legs. It will be genitalia. Legs and genitalia. So it will be the legs, hands, and genitalia. Legs, hands, and genitalia. You can appreciate the dependent area very easily with the image. So appreciate the legs, appreciate the hands, and the genitalia. So that is in case of hanging. What about drowning? Where is the lividity in case of drowning? Huh? If the body is constantly moving, there is no lividity. If the body is constantly moving, so position of the body keep on changing depending on the flow of the water. So gravity cannot act it. So there is no lividity. Lividity will be absent. But if the body is there in the border, stationary, I mean not moving. So it can be on the face, chest, hands, feet, and the calves. Dependent in the water, depending what is the position of the body in the water. So that is in case of drowning. Okay, drowning is not very specific, I mean. So these are the positions, and you should be able to draw the diagrams and explain the position of the lividity. Okay, I hope you got the distribution of lividity. Yes or no? Will you be able to explain all of them? Will you be able to explain all of them? My voice is not clear. Is it that? Kindly give a genuine review. My voice is clear to all, or it is not clear only to some students. You can write down in the comment box. So I can work up on the mic or something like that. I guess my mic is very close to me. Let's try now. My mic will be in the screen. It's okay, but let me make it more closer. Now, is it audible? Now, is it audible? Okay, the mic will be in the scene. It's okay. Chalo. So if it is audible now, let's go ahead. Is it clear? Chalo, let's go ahead. The students who are finding difficulty in voice, why don't you use earphone? It will be clear in that case. Let's try. I mean, you can try like that. So chalo, can we revise the distribution of the postmortem lividity in all these cases one by one? Can we revise together? Chalo. In supine position, where it is on the neck, back, and it is on the back of the thigh. Where it will be in prone position it is on the face, chest, and upper part, superior part of the limbs. In the lateral position, it is only on one side of the body, whether right or left. In the head down position, it will be on the face. It will mimic suffocation. Okay. In the hanging, it will be on the hands. It will be on the legs and genitalia. Okay. In case of drowning, it can be anywhere, but if the body is moving constantly, there will be no lividity. I hope I'm crystal clear in that. Can we go ahead? Can we go ahead? Now, fixation of the lividity. Let's come on the next topic, fixation of the lividity. Okay. Now lividity get fixed after 12 hours. After 12 hours. After 12 hours, what happens now? The blood vessels rupture. The blood come out and blood will deposit in that area. See, blood vessel will rupture. Now, if the blood vessel is rupturing, blood will deposit here. No, it will not shift, even on changing the position of the body. So if the dead body position is changed within 12 hours, the lividity will change and secondary lividity will develop. But after 12 hours, once the blood vessels are ruptured and lividity develop here, even on changing the position of the dead body, it will not change, and it is known as fixing of the lividity. So lividity becomes fixed after 12 hours because of breakdown of the blood vessel, hemolysis, blood comes out, and blood spread in the soft tissue. Blood spread in the soft tissue. I hope you got it. This is known as fixing of lividity. Lividity is absent in two cases. Whether the person is severe anemic, hemoglobin hi nahi hai, there is no reduced hemoglobin, severe anemia, or whenever there is severe blood loss before the death. Example, accident, surgery, okay, any case, severe blood loss, more than 65% of the blood loss. So either there is severe anemia or severe blood loss. In these two cases, after death, there is no lividity. No lividity. So lividity is giving many clues to the forensic expert and helping the forensic expert to come on the conclusion on the cause of the death and the approximate time of the death. You are getting my point? It's very important. Lividity occurs only on external skin. It occurs on internal organs also. Okay, the dependent internal organs. So dependent part of the internal organs also show lividity. We can see it externally only. But if we do perform the autopsy, we can see internal lividity also in the organs. Okay. So in case of supine position, it will be on the cerebrum or cerebellum. Suppose the dead body is supine like this. So it will be on the cerebellum. This is cerebellum. So it will be on the cerebellum. It will be on the dorsal lungs, not the ventral lungs. The dorsal side of the lungs. The posterior stomach wall, not anterior, the posterior stomach wall, dorsal liver, kidney, spleen, larynx, and lower intestine. So if you do the autopsy, you will find the lividity in the internal organs also. Common sense. Okay, gravity works everywhere. Got it? You have to differentiate lividity from congestion. Congestion before death versus lividity. So this table you can read by yourself. Yeah, the last thing in the lividity. Color changes. Okay, color changes occurs in various poisoning. I will teach you various types of poisons in the end. In the forensic medicine, I will teach you poisons also in the end. So in various types of poison, the color of the lividity is something different apart from purple, apart from blue and red. I told you till now bluish, purplish, reddish lividity, na? But in case of carbon monoxide poisoning, if death is occurring due to carbon monoxide poisoning, lividity is cherry red in color. If death is occurring in case of hydrocyanide, HCN poisoning, or death is occurring due to burns, it is bright red in color. If death is occurring due to nitrites or potassium chloride or aniline, the lividity is chocolate brown in color. Chocolate brown in color. In case of phosphorus poisoning, the lividity is yellow in color. In case of hydrogen sulfide, it's bluish green. Bluish to normal bhi hota hai, lekin it is greenish. In case of hydrogen sulfide. In case of carbon dioxide, it is deep blue color. So these are important for your MCQs, especially MCQ already asked on the cherry red color in carbon monoxide poisoning. So you should be able to learn it. You are getting my point. So learn the colors of the lividity in various poisons. Learn the color of the lividity in various poisons for your MCQ purpose. Okay, chalo. Last thing, why it is important. Why lividity is important? Medico-legal importance of lividity. What is the medico-legal importance of lividity? Can you tell me? There are 6 medico-legal importance. If I'm a forensic expert and this is a dead body, I can see the postmortem lividity. First thing is sure, it's a sign of death. Is it immediate sign? No. Is it late sign? No. It is early sign of death. So first I'm sure if the dead body is showing lividity, the person is dead. It's a sign of death. Number 1. Okay. Number 2, it can help me to calculate the approximate time of death. Okay, so there is no formula for that. Like cooling, we have the formula, but depending on the position, intensity, distribution, we can have an approximate time of death. Okay, it can mainly tell us the posture of body at the time of the death, because the lividity will be on the dependent areas unless and until the body position is changed after death. Okay, within few hours of death. Okay, it may sometime because of the repositioning, we can get lividity at 2 areas: the primary lividity, a fainted primary lividity, and an intense secondary lividity. So it indicates the body is repositioned after death. Okay, and it can also tell us the cause of the death, like carbon monoxide poisoning, the lividity is cherry red color, so it can give us clues like that. And it can tell us the manner of the death. For example, hanging. In case of hanging, the lividity is on the legs, hands, and genitalia. In case of drowning, there is absence of lividity if the constantly body is moving. So it can tell us the manner of death, cause of death, posture of the body, repositioning of the body, time since death, and sign of death. Learn these 6 things and you can understand all. I have given you ample of examples to understand all. So this is the medico-legal importance of the lividity. We are done with postmortem lividity. How many of you got it? Say, how many of you got it? Yes. So postmortem lividity, also known as cadaveric lividity, okay, and hypostasis. It is darkening after death. Many names I told you. You have to learn all the synonyms. What was the definition? Due to capillary venous congestion at the dependent areas, staining of the dead body occurs, and this staining is known as postmortem lividity. Mechanism, you know, mechanism is gravity. Okay, so when death occurs, you draw the flow chart. When death occurs, circulation stop. Circulation stop, axial blood flow. Gravity will attract the blood. RBC, WBC platelet will fall, and that will give the staining, and that will cause the lividity. Intensity depends on reduced hemoglobin. Okay, development, you know, in 1 hour it start visible. In 4 hours it is well established. In 12 hours it is maximum, and it persists till putrefaction. Okay, so this is what you have to learn in development progression. Shifting, if the body position is shifted, the primary lividity will convert into secondary in the new dependent areas, but primary position you will get a faint stains. At the secondary lividity you will get a dark stain. So it indicates the body is repositioned after the death, maybe to manipulate someone like that. And the extent of lividity depends on 2 things: volume of blood at the time of the death and the time taken by the blood to convert into the fluid. These 2 things decide the extent. So what decides intensity, what decides extent? Okay, distribution depends on 6 positions. Prone position, supine position, hanging position, inverted position, drowning, you know all the positions, lateral position, and you can draw the diagrams and tell the lividity. Okay, fixation, after 12 hours, blood vessels rupture, blood comes out and it becomes fixed. Even after changing the position of the body, it will not shift now. Absence of lividity in 2 conditions. What are the 2 conditions in which lividity is absent? Severe anemia and blood loss more than 65%. Okay. Internal lividity also occurs in the internal organs, on the dependent internal organs. You can enumerate the dependent internal organs in supine position, like cerebellum, dorsal part of the lung, dorsal part of the stomach, dorsal part of all the organs, like that. Okay, color changes, you can it can give a clue of the poisoning. For example, in carbon monoxide poisoning, the lividity is cherry red color. And medico-legal importance, you know the 6 medico-legal importance. What does it tell us? So this is how you should be able to enumerate postmortem lividity. Got it? Can I come on the last? Can I come on the last sign of early postmortem changes? The most important, rigor mortis. Can I start rigor mortis? How many of you are ready with me? I can start? Say yes, people. Come on. Let me see the chat box. Yes. So let's start the last thing, rigor mortis. In the early changes, we are done with immediate changes, and in the early changes, we are already done with the 5. The 6th one, rigor mortis. Again, it's a long question. It's a long question for your university exam and many MCQs are asked. Rigor mortis. So we will describe rigor mortis under these headings. So you have to learn the headings here, headings here, headings here. Others were very small. You don't have to learn the headings. But in these three, I appreciate if you learn the headings under which you are going to describe your answer. Okay. For MCQs, you can solve as it is. Chal, rigor mortis. So rigor mortis also known as, tell me other names of rigor mortis. Then tell me its definition. Most important is mechanism. Maximum rigidity at what time? After death. What is the order of rigidity? How it developed? Fully developed rigor looks like what? How to test whether the rigor mortis have developed or not? Time of onset, what is the duration? And tell me the conditions which mimic rigor mortis. It's obstructing me. Can I do it down? I guess I will be audible. Okay, just a second. Yes, chalo. So you can see under which we are going to describe our answer. So it is also known as death stiffening or cadaveric rigidity. You can see the muscles are rigid. There is no table down this body. You can see the muscles become rigid after death. So I told you muscular changes in a dead body. There are 3 phases in muscular changes. As soon as the death occurs, the complete body relaxes. It is known as primary relaxation or primary flaccidity. We have already discussed that. Okay. After that, rigor mortis develop. The complete body becomes stiff. All the joints become stiff. You cannot move it. You cannot flex the joints. The complete muscles are very hard and rigid. This is death stiffness. This is second stage. Okay. So for 1 hour, there is primary relaxation. After 1 hour, till 12 to 24 hours, there is rigor mortis. And after that, there is secondary relaxation. When the rigor mortis ends, then there is secondary relaxation. Okay. It is also known as cadaveric rigidity. Death stiffness or cadaveric rigidity. Learn the 2 names for that. So whether you are getting a question on rigor mortis or death stiffness or cadaveric rigidity, the meaning is the same. Okay. What's the definition? You can see the rigidity. This is a dead body. Appreciate the contraction of the muscle. Appreciate the contraction in the arms. Appreciate. So postmortem stiffness of the muscle. Okay. Why postmortem stiffness is occurring? There is no neurological component. Okay, there is no. It is due to chemical changes. I will tell you what chemical changes. Exactly what chemical changes. ATP got depleted. And because of this, all the muscles are contracting. Okay, as soon as the death occurs, some ATP is present inside the body at cellular level. So that ATP is utilized in relaxation. For relaxation, ATP is required. But when that ATP is depleted, exhausted, there is no more ATP, muscles contract. Because there is no ATP to relax it. So that is a chemical change which is causing so. Okay, it indicates cellular death, molecular death. At rigor mortis, when it is developing, now the cellular death starts. Okay, the cellular death is starting. It is indicating cellular death. So that is the definition. It is stiffness of the muscle due to chemical change, due to formation of actin-myosin complex. The actin and myosin are contracting because there is no ATP to relax them. Okay, so actin-myosin complex formation. This is the definition you have to write. Don't mug it up. Try to frame in your own language. So what is rigor mortis? It is muscular rigidness or muscular stiffness in the dead body. Postmortem stiffness in the dead body because of chemical changes, because of actin-myosin complex formation, because of lack of ATP. So mechanism, same thing is shown. You know, normally muscle fiber have actin and myosin. Physiology, first year, MBBS, you all have cleared, no? You know what is actin myosin? I'm not teaching is this, huh? How does relaxation occur? How does contraction occur? Can you see where is actin, where is myosin? You can appreciate actin and myosin, no? So you can see this is myosin, the blue one, the thick one is the myosin, and these red one are the actin. These are actin. So actin, myosin, how does they contract? For contraction, calcium is required. Whenever calcium is present in the sarcoplasmic reticulum of the muscle, calcium is released from the sarcoplasmic reticulum and they contract. You can see it is contracting. Z band is formed. Yeah, that physiology padha hai, huh? So this is how contraction occurs. But when ATP is present, the complex is broken and they relax. So contraction require calcium and relaxation require ATP. I guess everyone knows this. See the video. You can see. This one is myosin, this one is actin. Okay, appreciate. They form the complex. Now this is contraction. Okay, then relaxation. Again contraction. Then relaxation. Then again contraction. Then again relaxation. I guess you can understand. For contraction, calcium is required. But for relaxation, ATP is required. I hope you got it. So during life, ATP is present. ATP is present. So relaxation occurs. Calcium, ATP both are present. So relaxation is easy. Contraction, I can contract my muscle. I can relax my muscle. Whenever I am contracting, the calcium is there. Whenever I am relaxing, ATP is present. ATP is constantly generated in a living body. But after death, there is no ATP synthesis. Okay. Oxidative phosphorylation in the mitochondria stops biochemistry. You know. So after death, ATP synthesis stops. Mitochondria is the powerhouse of the cell. You know, ATP synthesis takes place in the mitochondria. So ATP synthesis stops. The existing ATP also destroyed. Initially, as some ATP, so suppose the person is dead. So initially some ATP is there. Okay, so that is causing primary relaxation for 1 hour. But after 1 hour, half hour, 1 hour, the ATP get exhausted. After that, you know, there is no more ATP now. There is no more ATP. Now, because there is no more ATP, there is no, what do you call, aerobic glycolysis. You know, in mitochondria, aerobic glycolysis, oxidative phosphorylation takes place in presence of oxygen. So no ATP generation. No anaerobic glycolysis takes place. Anaerobic glycolysis leads to generation of lactic acid. Lactic acid. When there is no ATP, body is trying to generate the ATP with the help of anaerobic glycolysis. So lactic acid generated, which will cause fall in pH. Fall in pH will cause rupture of sarcoplasmic reticulum. That will release the calcium. Now, two things are there. There is no ATP, there is abundance of calcium. There is no ATP, ATP khatam, and there is abundance of calcium because of rupture of sarcoplasmic reticulum. Both of these will cause sustained contraction of the muscle, and that's cause rigor mortis. I told you two things now over here. I told you for contraction, calcium is required, and for relaxation, ATP is required. You remember, for contraction, calcium, and for relaxation, ATP. So I'm saying after death, two things are happening. Number one, ATP synthesis stop. ATP synthesis stop. And existing ATP also depleted one time. Okay, so this is regarding the ATP. Now body try to generate ATP with anaerobic glycolysis, and body will generate the lactic acid. Lactic acid will cause fall in pH. Fall in pH will cause rupture of cytoplasmic reticulum, and that will cause increase in calcium. So two things are happening. There is no ATP, there is abundance of calcium. Calcium causes constant contraction, and since there is no ATP, so there is no relaxation. There is only calcium, there is no ATP. Okay, why there is calcium? You have to understand that also. Calcium is due to rupture of sarcoplasmic reticulum. Why sarcoplasmic reticulum is rupturing? Because of fall in pH. Why fall in pH? Because of lactic acid generation. Because there is no ATP, now body is trying to generate it with anaerobic glycolysis. So lactic acid generation, which is causing fall in pH in the cell, in the myofibril. Okay. So this is how constant contraction takes place. That is known as rigor mortis. People, give me a thumbs up. I'm trying. Say, got it? So this is rigor mortis. You can see this is a dead body, but it is contracted. Appreciate the muscles. Appreciate the muscles. Appreciate the muscles which are contracted. Rigor mortis. Constant, sustained contraction of the muscle in a dead body. After initial relaxation. Initially there is relaxation. After that there is contraction. Initially there is relaxation because residual ATP is there. Once the residual ATP is exhausted, there is contraction. So this is known as rigor mortis. Maximum rigidity occurs when ATP drops to 15% of the normal. ATP drop. When ATP is less than 15% of the normal, maximum rigidity. Okay. And lactic acid keep on increasing. So ATP keep on falling. Lactic acid keep on increasing. ATP fall to 15% and lactic acid increase to 0.3%. Normally there is no lactic acid, but it is increasing to 0.3%, so that is maximum rigidity. These are for your MCQs. Okay. Rigor mortis always develop in all dead bodies. Gradually it disappears. It always develop in all dead bodies. What is the order of appearance? In what order the muscles contract? There is a particular order that follows Nisten's rule. Via Nisten's rule, I will tell you the order. All muscles contract, whether voluntary or involuntary. But there is a rule. The Nisten's rule says that first involuntary muscle contract and then voluntary muscle contract. So learn the Nisten's rule. For rigor mortis, we are having this rule. Nisten rule. First involuntary muscle contract, then voluntary muscle contract. In the involuntary muscle, first of all, heart and other viscera. Okay, heart and other viscera will contract. Heart and other viscera. First organ to contract is heart. Internal organ. Involuntary muscle. In the involuntary, heart and other viscera will contract. Okay, now coming on the voluntary. Voluntary may first of all eyelid. Eyelid will contract. Eyelid. After eyelid, neck. Neck will contract. Then lower jaw. Lower jaw will contract. Then face. Entire face will contract. Okay. Then chest. Chest muscle will contract. Then upper limbs. Upper limbs will flex like this. Okay. Then abdomen. Then lower limb. And finally the fingers. The fingers and the toes. The last to contract. You have to learn this order. Okay. We'll try again. Chalo. One more slide. We will try again. Say. Bina dekhe, without seeing that, you try here. First heart will contract, then eyelids will contract, then neck will contract, then lower jaw, then entire face, then chest, then upper limb, then abdomen, then lower limb. Very easy. Chest, upper limb, abdomen, lower limb. Bolo. Chest, upper limb, abdomen, lower limb. And finally, fingers and toes. Fingers and toes. So easy to learn, not very difficult. Nisten rule. Which rule? Nisten rule. So this is order of contraction. You can see the dead body is contracted. Appreciate the contraction. Appreciate the rigidity. Appreciate the stiffness. So stiffness, rigidity, that is rigor mortis. Okay. Now, what are the developmental features? It is independent of nervous system. It is due to chemical changes, that is depletion of ATP and increased calcium concentration. Two chemical changes are there. ATP नहीं है और calcium भरपूर है. There is no ATP and abundant of calcium, which is causing rigor mortis. So there is nothing involvement of the nervous system. I will tell you cadaveric spasm, which mimic cadaveric rigidity. This is cadaveric rigidity. Cadaveric spasm is due to nervous system, but this one is not due to nervous system. Suppose the person who is dead, when he was alive, the person is paralyzed. So in a paralyzed limb, does the rigor mortis develop? It's an MCQ. In a paralyzed limb, rigor mortis develop or not develop after death? Suppose the person is paralyzed. Suppose this limb is paralyzed when the person was alive. So after death, in the paralyzed limb, it develops slowly. It develops slowly. Okay, got it. Before the full rigor mortis develop, if the body position is changed, then there is re-establishment. Okay, suppose it is stiff and I am breaking the stiffness. The stiffness can be broken. It is very stiff. It takes efforts to break the stiffness, but it can be broken. Once it is broken, it will re-establish, but re-established rigor mortis is weaker than the primary one. Like the lividity. In the lividity also, there is re-establishment, but their secondary lividity was strong than the primary. Here, primary remains strong. The secondary one will not be that strong. Okay, and frequent handling of the dead body will break the rigor mortis again and again. Okay, if the dead body is frequently handled, suppose death occurs in some city, some other country, so dead body is carried and multiple handlings occurs at multiple times, so rigor mortis can break. Okay, so these all things should be considered to the forensic expert who is examining the dead body and examining all these features. So this all history is important, whether there is handling of the dead body, multiple handling and all that, whether the position of the dead body is changed after the scene of the death, like that. Okay, now when there is fully developed rigor mortis, tell me the features. The entire body is stiff. Can you see the entire body is stiff like this when fully developed rigor mortis after 12 hours. Okay, muscles are short and hard. All the muscles, you will see they are very hard. If it is like this, you take efforts to open in a dead body. Okay, so the muscles are short and hard. Major joints are flexed. You can appreciate the major joints are flexed. All the major joints, the knees, the elbows, the shoulders, they are flexed in a dead body. The fingers and toes are strongly flexed. It's not visible here, but fingers and toes are very strongly flexed in a dead body. So these are the features. You can appreciate the fingers are like this in a dead body when the rigor mortis is developed. You know this muscle, erector pili muscle. What is this muscle? This muscle is present in the skin, na? That causes goose flesh, erection of these hairs. Okay, whenever we feel cold or whenever we are excited, whenever we fear, we have this appearance because of contraction of erector pili. So erector pili muscle also contract along with all other muscle. All the muscles are contracting, no? So erector pili muscle also contract. So dead body have this appearance. It is known as goose flesh appearance, or also known as cutis and serina. So this appearance is there in the dead body. Okay, dartus muscle also contract. Dartus muscle in the males, in a male dead body also contract, and that cause semen discharge after death in the male. When the rigor mortis sets, the semen discharge takes place in a male dead body because of dartus muscle contraction. Suppose there is a lady who was in labor and she got death, maternal death. I teach you maternal death in community medicine. Yes. So if a maternal death, when there is a lady who is in labor, a pregnant lady who is in labor and she dies at the time of the labor, when rigor mortis sets in that pregnant lady who have the fetus in the uterus, whether the fetus is dead, mostly the fetus is also dead. So uterine muscles also contract in rigor mortis, and sometimes it can lead to expulsion of fetus in a dead body, pregnant dead body. The expulsion of fetus takes place during rigor mortis. Got it? Facial expression, I told you na, here face also shows rigor mortis. So face ka which muscles show rigor mortis? The muscles, we have various muscles on the face na. Some muscles contraction cause smile like this. Some muscle contraction cause exclamation like this. Okay, and some muscles called like grimace and dukh, sad, like this. Okay, so which muscles are contracting in rigor mortis? So in rigor mortis, the muscles which contract give a grimace face. Right. So dead bodies are like upset, they are not happy. Okay, when the rigor mortis settle, okay, so on the face it's a grimace wala expression. the grimace expression, the sad expression, because the muscles which are contracting during rigor mortis gives a sad expression on the face. So dead bodies have a sad face because of this facial muscle contraction, the grimace expression. I hope you got all the features of the rigor mortis. Huh? How to test it? Try to open the eyelid. If you need resistance to open the eyelid, it means the rigor mortis have already developed. Okay, so lift the eyelid. If it is resist reopening, so it means the rigor mortis have already started developing or it is fully developed. This is the easiest test to test the rigor mortis. Okay, now what is the onset? It starts 1 hour after death. Till 1 hour it is relaxation, primary relaxation. After 1 hour it starts. It fully developed in 6 hours and it disappear in 36 hours. After 36 hours it's secondary relaxation. Okay, so duration in summers it's 36, in winters it's 48. Okay, got it. Now the last thing, conditions simulating rigor mortis. Very important. It's a very important MCQ as well as university question. There are 3 conditions which simulate rigor mortis. They are not rigor mortis. Heat stiffening, cold stiffening, and cadaveric spasm. Among them, the most important is cadaveric spasm. This is instantaneous contraction after death, not after 1 hour. Rigor mortis develop after 1 hour. This one is instantaneous. Okay. Heat stiffness. Have you ever imagined the death occur because of hot liquid immersion? Suppose it is a boiling oil and someone fall in that, the complete body, the person will die. Obviously, hot liquid immersion or high voltage shock or burns. In all these conditions, the body looks like this. Can you see the body is contracted? But this is not rigor mortis. When the body dies, at that time, if the body temperature is more than 65 degrees, in case of burns, in case of high voltage shock or hot liquid immersion, like this, okay, can you see the body? You may think, ma'am, is it rigor mortis? No, it is not rigor mortis. When death occurs in such a condition, when the body temperature is more than 65 degrees, it is known as pugilistic attitude. What is known as pugilistic? The limb flaps due to muscle contraction. So at the time of the death, the person is contracting all the muscle and person dies in that condition only. So from death itself, it's like this. It is not rigor mortis. It is mimicking rigor mortis, but it is heat stiffness. Because a death occurs when the temperature of the body is more than 65 degrees. Okay. Here, rigor mortis does not follow. In such case, don't search for rigor mortis because the muscles are already contracted from the time of death only. And this is known as pugilistic attitude. You get an MCQ on that. Pugilistic attitude seen in heat stiffness. The death due to heat. Okay. Number 2, cold stiffness. Okay. Suppose the death occurs due to frozen. Someone is locked in the cold room. Have you watched that series? Huh? You don't watch series, movies, something. Huh? So if the temperature is -5 degrees or lower than that for hours, the person will die. Definitely for many hours. Someone may be accidentally locked in cold rooms, in freezer, like that. Okay. So subcutaneous fat will solidify. The person's subcutaneous fat will solidify. Okay. And if you do forcible, complete subcutaneous fat is solidified like ice. If you touch it, you may feel it's ice. The tissue is like ice, hardened like ice. And if you flex it, you will hear the voice of cracking of the ice. Okay. So forcible flexion, ice in the joints may crack, sound like a crack of the ice. Okay. On warming, stiffness disappear. But here, if you warm the body, okay, in warm water or what, it will stiffness will disappear and then rigor mortis will develop. In heat stiffness, rigor mortis don't develop at all. Pugilistic attitude is permanent. But here, this flexion is temporary. On warming the body, this will disappear and after that, the rigor mortis can develop. And last is cadaveric spasm. Here, the reason is neurogenic. It also mimic rigor mortis, but it is not rigor mortis. It occurs immediately after death. When at the time of the death, the person is in excitement or fear. Okay. At that time, because the person is in intense emotion like fear, anger, or excitement, or cerebral hemorrhage, head injury, drowning, strychnine poisoning, in all these conditions, adrenocortical exhaustion takes place. And that will stimulate the brain and that will cause this spasm-like condition. It is neurogenic in origin. In contrast to rigor mortis, which is not neurogenic in origin, which is chemical in origin. The rigor mortis is due to less ATP or ATP exhausted and high calcium. This one is neurogenic in origin because of adrenocortical exhaustion. Okay, so you should be able to differentiate the rigor mortis from the cadaveric spasm. The rigor mortis develop after 1 to 2 hours, but cadaveric spasm is instantaneous after death. This occur in all muscles, voluntary and involuntary. This one occur only in few muscles. voluntary, not involuntary. Here the origin is chemical. Here the origin is neurogenic. Okay, here outcome overcome by force very easily. This one is requiring great effort. Cadaveric spasm, you can't open it. Once the fist is there, you can't open it. It's require great efforts, very great efforts. Okay, so you have to learn these differences which are important. That's it. So this is how you can revise the entire rigor mortis in 1 minute. If you have written these headings and all the things you have understood already, you can revise it in just 1 minute. So you make your notes like this. People, this is a way to make the notes. Got it? This is how you can revise. So we are done with the immediate postmortem changes, which are 3 in number, which are done with early postmortem changes, which are 6 in number. The late postmortem changes, I guess I will take tomorrow because it's too late now. I'm also tired. So this I will take tomorrow. That's a free session. I will take either this tomorrow or I will put a recording this on the app and I will teach the another topic tomorrow. Maybe I will take this first and then start the another topic also. Okay. So tomorrow also we are having a free session of FMT only. The topic is not legal procedure. First I will finish this and after that I will take a very important topic, impotency and infertility and abortion. These important topics I'm going to take tomorrow, but the session is on app, so please do watch it on the app, MedLive by Dr. Priyanka app. The session is on MedLive by Dr. Priyanka app. The time is same. It is a free session. The only thing you have to download or install the app. The link to download the app is given in the comment section. It is pinned in the comment section. Please go on that. If you have not yet downloaded the app, please download that. And session is absolutely free like the YouTube only. You may be thinking why we are taking it on the app, not taking on the YouTube only if it's free. Because on app we have a features of polling and other features also that will, the session will be more engaging. So tomorrow you can realize and it will be a super duper hit session like today's also. And you will learn a lot. So don't you dare to miss tomorrow's session, 6 p.m. on MedLive by Dr. Priyanka app. The topics I told you, the important topics, first we will finish it and then we will continue with other important topics. For any other query, please WhatsApp on this number. Calling is not available, only chat, WhatsApp is available. Please note down the number for any query. You can WhatsApp on this number. Thank you so much. Hope to see you tomorrow, 6 p.m. Forensic Medicine on MedLive by Dr. Priyanka app. It's a free demo session. Okay, everyone please join. Thank you so much. Bye-bye. Good night. Hope you enjoyed and learned. Okay, chalo, bye-bye, bye-bye, good night. I'm ending the session, chalo. Hello everyone. Very good evening to all of you. Am I clearly visible and audible? First, I will wait for your comment in the comment box. Kindly assure me that I'm clearly visible, audible, everything is good to go. So I will start the session ahead. Okay, I'm waiting for your comments. Am I clearly visible and audible? I'll start the session soon. First, you write down in the comment box who's those all who are live. Is everything is good to go? You can see, you can hear. Can we start? Yes. I guess yes. I guess yes. Hi Harika. Hi Swatima. Thank you. Thank you. Thank you, Reddy. Thank you. Okay, I got it. Thank you so much for confirmation. So I welcome you all for today's session. Very good evening to all of you. And today we are going to continue our topic of forensic medicine, which we have started yesterday. So as you all know, these are the demo sessions of third Prof Buster 1.0. So I will continue my topic, that is postmortem changes, which I have left incomplete yesterday. So yesterday was the first session of forensic medicine on YouTube and I started this topic. I guess most of you may have attended it. Yes or no? So if you have not attended it, you can watch it on the YouTube as well as it is uploaded on the app also. Okay. And today we are going to complete it, finish it. It's a big topic, very important topic. But before coming on this topic, as many students I can see they are new here. So I will just for few seconds, I will orient regarding the groundbreaking course, that is third Prof Buster 1.0. Okay, so what is the most important thing here in this course which I want to highlight over here? I am going to complete these 4 subjects in just 4 months, 10 days. Yes, I'm going to complete all these 4 subjects of the third Prof. Most of the students have only PSM and FMT in third Prof and ENT Ophthal in the final year. But my advice for all of you, you should cover ENT and Ophthal also in the third year. Okay, so if you are covering these 4 subjects in just 4 months, that is, they will be completed in February itself. So from February onwards, you have ample of time to start these major subjects of your final year. I will not be teaching you these subjects, but I'm providing you, I'm giving you the time to study from wherever you want to these subjects. Because I will assure you, these 4 subjects will be completed from both prospects. I mean, for NEET, PG, FMG, MCQs also, and for your university exam also. You don't have to touch any of these 4 subjects. You have to just revise before your exam after February. So that is the biggest thing of this course. Okay, that is third Prof Buster 1.0. All these 4 subjects will be covered by me in the daily live sessions we will take. I guess the sessions are not daily. The pre-provided structured schedule is with you. We have 2:1 ratio. 2 days class, 1 day break. 2 days class, 1 day break. With such a schedule, we are completing the entire syllabus of these 4 subjects in 4 months, 10 days. Right? So this is the starting date. It is already started. And I guess today is the 4th session. And 22 February will be the last date of this session. You can see the detailed schedule over here. And along with the daily live sessions, recordings will be available for 1 year. The sessions will be, live sessions will be for 4 months. But the recordings of those will be available for 1 year. One more big thing here I want to announce, along with the digital note, I am providing printable notes. Whatever I am teaching in the class, word to word, slide to slide, you can get the printable notes, but you have to take the printout by yourself. Okay, the hard copy books are not shipped in this combo plan. Okay, hard copy books are under publication. It will take months, it will take time, but meanwhile I'm providing you my notes. You can take the printout. Whatever I'm teaching word to word, you will get there. Okay, so digital notes, printable notes, annotated notes, all the notes will be provided to you. You will be given 3 type of question bank for university exam as well as competitive exam as well as previous year question bank. Okay, now PSM and FMT, I will teach you with multiple images. You will realize today in FMT how many images I'm going to show you so that it imbibe in your mind. And ENT Ophthal, I will teach you with 3D models. Don't you dare to miss my demo sessions of ENT and Ophthal. My next 2 sessions are demo sessions, so I'm going to teach you ENT and Ophthal with these 3D models so that you will have a better understanding, better clarity in 3 dimension. I will change my camera to show you all these 3D models layer by layer, structure by structure. So please do attend my demo sessions at least. So total there are 87 live sessions. Out of the 87, today is the 4th one. In these 87 live sessions, I will pack the entire syllabus of the 4 subjects. So today is demo number 4. So PSM demos are already completed. FMT will be completed today. After that, we have ENT and Ophthal demo. You can appreciate the topics of that. Okay, so let's start it. If you have any other query, you can WhatsApp on this number. Now let's start. Let's come on our topic, that is postmortem changes. Yes, can we start? Are you people there? Yes. Okay. Yes. So chalo, let's start it. So let's continue postmortem changes. But you know my way of teaching. I cannot continue directly. So in the first 5 minutes, we will revise what we have read yesterday. In my classes, there will be multiple revision so that you retain everything in the class itself. You don't have to open the book later on. Got it? So in the first few minutes, 2-3 minutes, we will revise yesterday's session and then we will continue because I cannot jump directly on the topic where I have left. Okay, so postmortem changes. The first question which arises in my mind, being a doctor, why? Why it is necessary to understand the postmortem changes? Why is it necessary, being a doctor, for me to understand the postmortem changes? Why it is there in MBBS curriculum? Yes, it is necessary because the answer is as soon as the death occurs, the dead body starts writing its own report. There are many clues hidden in the dead body which occurs every second, every minute. Okay, what is our job? Being a doctor, our job to detect those clues. Being detective, detect those clues and tell two things. Number one, when the life stop and how the life stop. Only two questions in medical legal cases. Most of the medical legal cases, the forensic expert, what is the job of the forensic expert? To tell two things to the police. What two things? When life ended and how does it happen. Okay, so we can come on that, we can help the police and the judiciary to come on this conclusion based on the clues in the postmortem. So that's why postmortem changes are very important to understand. Now we divide the postmortem changes into three categories. Yesterday also I taught you immediate changes which show somatic death, early changes which show cellular death, and late changes which show decomposition and decay of the body. Okay, so immediate changes are 3 in number, early changes are 6 in number, and late changes are again 3 in number, so total 12 changes, out of which the immediate are done yesterday. The early are also done yesterday. So out of 12, the 9 are done yesterday. Today we are left only with the late changes. They are looking very small, but all three are long questions for your university exam. They are big topics. So we will focus on them one by one. All three we are going to see in detail. Before that, a quick snapshot of these and these. Okay, so immediate are 3 in number. I told you a mnemonic to learn the 3. Okay, what are the 3 immediate changes? Insensitivity, insensibility and voluntary loss of the muscles. Cessation of respiration, cessation of circulation. You can see this is insensibility, the earliest postmortem change. It's an MCQ, but not reliable. It is seen in suspended animations also. Okay, number 2, cessation of respiration for more than 5 minutes is evident of death. Again, cessation of circulation for more than 5 minutes, okay, is evident of death. So cessation of respiration and circulation for more than 5 minutes is evident of death, but they should be complete and continuous. So it differentiated from suspended animation. What is suspended animation? Yesterday I taught you. So we have seen a quick review of these three. Now a quick review of these and then we will come on today's topic. So early changes. Yesterday I taught you the 6 early changes. Changes in skin, changes in eye, changes in muscle, cooling of body, that is Algor Mortis, postmortem lividity and rigor mortis. Yes or no? Yesterday I taught you, na? So again, I taught you a mnemonic here also to learn. The mnemonic here was the IRC, I really collapse, I really collapse. Insensibility, respiration cessation, circulation cessation. Okay, here the mnemonic is in front of you. The mnemonic is see me clear, CMCLR clear. Okay, so you can see S stand for changes in skin, E stand for changes in eye, M for changes in muscle, C for cooling, L for lividity, and R for rigor mortis. So quickly, we will revise only important one slide on that, and then we will move on the late changes. That is the main topic for today. Okay, so changes in the skin, we have seen 2 changes in the skin. Number 1, skin loses its elasticity, become dark color, ash color, and in the lips also become red and dry. So that is changes in the skin. Changes in the skin. You learn these images. If you have watched my yesterday session, you can remember. Changes in the eye. I taught you 6 changes in the eye. You remember the 6 changes in the eye? Loss of corneal reflex. Okay. Cornea become opaque. Opacity in the cornea. And there are triangles formed in the cornea. I'm sorry. The base of the triangle is like this. And the apex is like this. You can see. The base is towards corneal margin. And the apex is towards the canthus. Medial and lateral canthus. These triangles are known as tachenoid. Due to the loss of intraocular pressure, eyes are sunken. The third change. First, second, third. Pupil, sometime initially it is dilated, but later on when the rigor mortis comes, it's constricted. So initially dilated, then constricted. Okay, what about the retinal blood vessels? The retinal blood vessels shows fragmentation of blood. as soon as the death occurs. Fragmentation of blood. This is known as what it is known as? Yes, Kevorkian sign. Don't you forget. Kevorkian sign. It's an MCQ. And the vitreous humor. We aspirate the vitreous humor from the dead body and see the potassium level. Potassium level rise up to 100 hours steadily. So it helps us to estimate the death, time of death. So these are the 6 changes in the eye. I told you all of them yesterday in detail. Muscular changes. Okay. So as soon as the death occurs, the complete body relax. Unless until it again contracts when rigor mortis comes. Okay. So complete relaxation, but with electric stimulation, it responds. But in this phase, there are twitchings. Appreciate the twitchings. Twitchings are there. Pupil don't respond to light, but it responds to atropine and physostigmine. Okay. And there is the peristalsis still going on. And there is relaxation of the sphincter. Okay. Urinary sphincter, bladder sphincter, anal canal sphincter. So there is evacuation of the bowel. Incontinence of the urine and feces occurs in dead body, which is very common immediately after. Okay, so these are the changes in the muscle. Then I told you cooling of body. Remembering Algor Mortis. So body lose heat after death by all 3 mechanisms: conduction, convection, radiation, as well as evaporation. I told you how to draw this graph yesterday. And there is a temperature gradient between the core and the surface. Okay, and I told you a formula how to calculate the time from cooling of body, time of death. Okay, this was the formula yesterday I taught you. How to measure the temperature of dead body? Rectal temperature, liver, peritoneal surface temperature, and internal auditory canal temperature. These are the 3 ways to measure the temperature in a dead body. Yesterday I taught you. Then postmortem lividity. What is postmortem lividity? Remembering staining of the dead body. The dead body started staining few hours after the death, maybe 1 to 2 hours. Okay, why it happens? Because as soon as the death occurs, circulation stop and the blood sink due to the gravity. RBC, WBC, everything sink, and the hemoglobin of the RBC is giving this color. The reduced hemoglobin is giving this color. That is known as lividity. Okay, postmortem lividity, or known as hypostasis. I told you all the features regarding this, and it depends. The position of this depends on the position of the dead body. I told you what happens in supine, in prone, in lateral position. Okay, in inversion of head position, hanging position, droning. I told you the lividity, the features of the lividity, where it will occur. Okay, the distribution you can say. And last I taught you rigor mortis, the rigidity of the dead body. So initially, as soon as the death occurs, the complete body relaxes. But after a few hours, it contracts. Okay, you can appreciate the contraction. You can appreciate the contraction. That is rigor mortis. Okay, I told you the sequence of the muscles showing contraction. First involuntary, then voluntary. Right? So we are done. This was the revision, people. I know it was boring maybe for few of you, but it's essential part. You know, revision is essential as compared to studying new things. Now you have revised, now it is fixed in your mind forever. Okay, anything which is revised at least once, it is fixed in your mind. Okay, now we will start with today's topic, that is late changes, late postmortem changes. Immediate are done, early are done. We have revised them, and now we will start the late changes. There are 3 late changes. Are you people there? Yes? Chale? Can we continue? The 3 late changes. What are the 3 late postmortem changes? The mnemonic is PAM, whatever you say, PAM after life, PAM after life. P for putrefaction, A for Adipocere formation, and M for mummification. So these are the 3 late changes. We have done immediate, we have done early, and now late changes. So this immediate indicates somatic death, early indicates cellular death, but the late changes, what I am teaching you today, today's topic, what I am teaching you, the late changes indicate decomposition of the dead body, decomposition and decay of the dead body. What are the 3 late changes? Putrefaction, adipocere formation, and mummification. The mnemonic is PAM, P-A-M, PAM. The mnemonic is PAM. Got it? Just a second. I'm sorry. So we will start them one by one. So can I start with the first one? All 3 are very big, people. The biggest among them is putrefaction, on which you get frequently long question if you are appearing for your 3rd, 4th university exams. So it is a frequent long question. Okay, very important, and you get many MCQs also. And these are also important. Mummification is equally important. Okay, so let's start with the first one, putrefaction. I'm starting with the first one, putrefaction. Can I start putrefaction? Before I start the first one, putrefaction, let me give you an overview of all 3. So I'm teaching you the late changes PAM, P-A-M, PAM, putrefaction, adipocere formation, and mummification. So first you understand the basically what they are. Read their definition. You can see the 3 definition, or else you can see their images. You will realize what they are. So this is PAM, putrefaction, adipocere formation, and mummification. So one by one we will see. What is putrefaction? Now bacteria, dead body attracts bacteria. You know, bacteria will attack on the dead body. These are not external bacteria. These are commensal bacteria. The bacteria which are usually present in living body. What is commensal? Commensal bacteria are the good bacteria. They are already present in human body. They don't harm us. They are not pathogenic, but they change your location. I mean, the bacteria which are present in my oral cavity, they are commensal for the oral cavity. But once they enter in the soft tissue in other organs, they are no more commensal. They become pathogenic. I mean, they are harmful like that. So the commensal bacteria, they attack the soft tissue, destroy the soft tissue, and that is known as putrefaction. So that is known as putrefaction. The dead body become like this. Okay. And there is a peculiar odor, smell, which comes from the dead body. The dead body get liquefied, okay, because of the bacteria, and that is known as putrefaction. I will give you the details. So putrefaction, learn the main word in the definition of the putrefaction. It's bacterial destruction of the dead body. Bacterial destruction of the soft tissue of the first soft tissue of the dead body is destroyed, and later on the skeleton of the dead body is also destroyed. But for destroying skeleton, it requires years. And soft tissue destruction occurs in days and months. Okay, so bacterial destruction of the dead body is putrefaction. What is putrefaction? Learn one word in the definition. It is bacterial destruction of the dead body. That is putrefaction. The second I will teach you. I will give you the detail. First you learn the definition of the 3. Then I will give you the detail of all 3 one by one. Okay. The second is adipocere formation. What is adipocere? We all have fat in our body, no? We have 0.5% of fat, subcutaneous fat in our body. Our entire body contains the fat. Whether the person is lean, thin, obese, whatever. But we all have some amount of fat in our body. Okay? That fat in human body, body fat, after death, that fat gets converted into a waxy, greasy, water-resistant material. And that material, it is a soap-like. You can say it is saponification. Have you read saponification in chemistry in your childhood? I mean, in your school time. Saponification. So adipocere is basically saponification. So fat of the human body is converted into soap. Okay, conversion of fat into soap. Soap-like substance, which is waxy, which is greasy, which is water-resistant. And this soap is known as adipocere. So this is known as adipocere formation. Can you see yellowishness of the body? Appreciate. Here the color initially green, later on purple, finally black. And here it is yellowish. Okay, so it's a modification of putrefaction. It prevents putrefaction. They don't occur simultaneously. If adipocere is occurring, it prevents putrefaction. Okay, in putrefaction the body gets destroyed. It's very difficult to identify the body after putrefaction because the facial expressions, facial identity, everything gets destroyed. But in adipocere it is maintained to some extent. Okay, so this is adipocere. So when adipocere formation occurs, when moisture is there, when the dead body is in moisture, in moist environment, then it favors this. When the dead body is in air, then it favors this. When it is in moisture, it favors this. I will teach you the details. First you understand. So here the fat of the body, one word you learn. Here the fat of the body get converted into adipocere. Adipocere. What is adipocere? It's a soap-like substance. It's water-resistant and it's waxy, greasy substance. So this is known as adipocere formation, and it prevents putrefaction. That is the thing. Okay. Now third and the last is mummification. You can see mummification. Mummification occurs because of drying. The entire dead body is in hot environment. It gets dried. We all have water. Of course, human body contains how many percent of water? After death, if the dead body is kept in hot atmosphere, very hot atmosphere, all the water in the dead body get evaporated. Okay, so drying, complete drying or dehydration of the dead body because of evaporation of water. It is known as mummification. Again, it prevents putrefaction. So these two are the modifications of putrefaction. They prevent putrefaction. Okay, again here facial expressions are retained even after years and thousand years. We got the mummies, na? Deep burial mummies in the history, you may have read it. So this is mummification. Mummification is due to drying or dehydration. So you understood the definition. So one word you learn here is drying or dehydration of the dead body because of evaporation of water. You got the 3 definition. Bacterial destruction of the dead body. First soft tissue, then skeleton. It is known as putrefaction. It destroys the complete body. It's difficult to identify the body after putrefaction. What is adipocere formation? The fat in the dead body get converted into a waxy, greasy, water-resistant, soap-like material which is known as adipocere. It prevents putrefaction. And what is mummification? Mummification is dehydration and drying of the dead body. Okay? Dehydration and drying of the dead body because of evaporation of water. That is known as mummification. Appreciate the 3 definitions. and appreciate the three images. Can I start them one by one? Can I start with the first one, putrefaction? How many of you are ready? Can we start? Chalo. So we will start. So just a second. We will start with putrefaction. I'm starting with the first one. You got the overview, what I'm going to teach you in the next 1.5 to 2 hours. Okay. These three things I'm going to teach you in detail. So most of you know my way of teaching. I don't teach the topic haphazardly, line by line, paragraph by paragraph. I always give you orientation before I start. So before I start, I told you I have given you a bird's eye view, that the entire map, what I'm going to teach in the next 2 hours. These three topics. What's the difference between the three? You got their three definition. Now details of each of them. Okay, so putrefaction is a long question. If it is coming as a long question, you have to frame your answer under these headings. You have to revise these headings before you go to your exam. You don't have to mug up inside the heading. Inside the heading, you understand and write your own. But headings, you cannot skip the headings. So putrefaction, write down the definition, introduction, whatever you say. Then tell me the mechanism of putrefaction. There are three main features in putrefaction, the three cornerstones of the putrefaction. Color change in putrefaction, gas evolution or gas formation, the dead body form the gases, and distend, the dead body get distended. Sometimes rupture occurs, abdominal rupture, eye rupture because of the gas formation. I will show you the images. And finally, the dead body get liquefied. First color change occur, then gas formation occur, and finally the dead body get liquefied. Sometimes if the dead body is in some forest or very far away from the reach of the human, and after many days or months the dead body is found, most of it is liquefied. Sometimes it happens in case of murders or some eventful death like that. So liquefaction of the dead body. So these are the three main features which I will give you the detail. Then after these features, then I will give you the distribution of putrefaction. Then factors affecting putrefaction, rate of putrefaction. Then from the putrefied body, there is a peculiar smell which comes, which is known as odor mortis. You should know this term. What is odor mortis? What happens if the dead body is in water in case of drowning or homicide, suicide, whatever? So putrefaction in water. And what about the skeletonization? Here the soft tissue is destroyed. Finally, putrefaction destroys the skeleton also. So first you understand the headings, people, under which you have to frame your answer. One by one we will discuss. Let's start with the introduction. Okay, you have seen the headings. Now I will show you this page in the end after half an hour or 40 minutes when we will complete all these headings. So we will revise it. So focus on each and every heading. Okay, so start with the definition. What's the definition of putrefaction? I already told you. It is final stage of the postmortem changes. I'm teaching you late changes now. Immediate changes are done, early changes are done. What I'm teaching you? Late changes. So it is one of the late change, final stage of postmortem. You already know that. What's the definition? It is bacterial destruction of the soft tissue of the dead body. And later on, the skeleton of the dead body. Basically, bacterial destruction of the dead body. Bacterial destruction. The dead body is destroyed by the bacteria. Okay. It follows after disappearance of the rigor mortis. You remember I told you three type of changes. Now, what were the three type of changes I told you? Postmortem changes. Immediate changes were three. You know the three immediate changes. Early changes are six. What was the sixth change? Sixth early change. Sixth early change is rigor mortis. So once the rigor mortis disappear, then putrefaction appear. So putrefaction occur after the disappearance of rigor mortis. I think you can correlate. Okay. So this line is written here. So it follows putrefaction occur after disappearance of rigor mortis. Okay. So that is the definition. I hope everyone got the introduction, definition. Now mechanism. Most important is mechanism. How does it occur? How does it occur? So after death, obviously respiration stop. Immediate sign. What is the immediate postmortem sign? Three signs. Insensibility, cessation of respiration, and cessation of circulation. So cessation of respiration. As soon as the death occur, respiration stop. So since the respiration stop, person is not inhaling, exhaling. So oxygen concentration in the dead body is less. Oxygen concentration in the blood falls because person is not respiring. Person is dead. Okay. And hydrogen ions concentration is high. So oxygen concentration is less and hydrogen ion concentration is high as soon as the death occurs. And this is the ideal condition for bacterial growth. Bacteria grow in low oxygen and high hydrogen ions. It's the ideal condition for the bacterial growth. Now post-death, the bacteria, which bacteria? The commensal bacteria, which are already present in the intestine, respiratory tract or wound. If before death some wound is there, in the wound may be contaminated with the bacteria. Okay, so these are the commensal bacteria. This is the commensal bacteria in the intestine. This is the commensal bacteria in the respiratory tract. Or in the wound, they can be pathogenic bacteria. So the bacteria which are already present in the dead body, they multiply within 4 hours. You can see. So these are the bacteria already present in the intestine. The bacteria already present in the respiratory tract, or the bacteria already present in the wound. They will multiply because oxygen is less and hydrogen ions are more. You can see. Mainly it is intestinal bacteria. They multiply. You can see they multiply like this. They keep on multiplying. They keep on multiplying at a very high rate via binary fission. You know how does bacteria multiply. So the bacteria are multiplying. Within 4 hours, they start multiplication. At 24 hours, they are peak at multiplication. Once the bacteria are at peak, they rupture and they release enzymes. Not rupture, they release enzymes. Bacteria release enzymes. And those enzymes break down the protein, carbohydrate, and fat of the dead body. Our body is made up of 3 things. The 3 major components of human body. Human body is made up of protein, carbohydrate, and fat. Yes or no? Carbohydrate give us energy, but the skeleton, the complete structure of the human body is made up of protein, and we have fat as a storage. Yes or no? So all the 3 things are destroyed by the bacterial enzyme. This leads to destruction of the soft tissue, and this is known as putrefaction. Will you be able to draw this flow chart? It's easy. Okay. So try to say it. Try to say it. You can see. So these are the bacteria. They multiply, multiply, multiply. In 4 hours, they start multiplication. In 24 hours, they peak multiplication. 4 hour, 24 hour. And once they multiply, they release enzyme. You can see they are releasing the enzymes. And the enzymes are destroying the tissue, the soft tissue in human body. Those enzymes which are secreted by bacteria, they are destroying the soft tissue. Okay, so you got the complete mechanism. So what is happening in the dead body? You tell me what is happening. So after death, the respiration stops. Since the respiration stops, oxygen fall and hydrogen ions are high. It is an ideal condition for bacterial growth. Okay, so bacteria from the intestine, respiratory tract, or wound, they multiply. In 4 hours, in 24 hours, they peak. Then they release enzyme. And those enzymes, the bacterial enzymes, break down the carbohydrate, fat, and protein. This causes destruction of the soft tissue, and this leads to putrefaction. I hope you all got it. This is putrefaction. Okay, which is the main bacteria. Tell me all the name of the bacteria. Learn one bacteria, which is the most common cause of putrefaction, Clostridium welchi, also known as Clostridium perfringens. Welchi and perfringens is one and the same. I hope everyone know. If you have studied microbiology from me, you may be knowing this. Yes or no? Okay. So you can understand this is Clostridium welchi or Clostridium perfringens. This is the most important bacteria, the main bacteria which causes putrefaction. Which enzyme it releases? So as soon as the death occurs, Clostridium welchi present anywhere in the body, maybe in the wound, it multiplies. After multiplication, it releases enzyme. The name of the enzyme is lecithinase. This enzyme is secreted. What does this enzyme do? It dissolves the cell membrane, it digests protein, carbohydrate, fat, and it causes putrefaction. Other bacteria, there are many names. You can read them. But the most important bacteria for your MCQs is Clostridium welchi. People, give me a thumbs up. Are you people there? What happened to my voice, Sanjeev? Am I audible? Am I audible clearly? Yes or no? Say people, am I audible clearly? Yes or no? I guess I am. Use earphones. It will be better if you are using the earphones. My voice is clear. Can someone respond? I'm waiting for your comments. If my voice is clear, I will go ahead. Chalo. So we are done with 2 things till now. You know the definition of putrefaction. What is putrefaction? It is bacterial destruction of the soft tissue and finally, eventually, skeleton of the dead body. Okay, and you know the mechanism. You will be able to draw the flowchart of the mechanism. Now I'm coming on the features. Features of putrefaction, the third thing. Definition is done, mechanism is done. Now features. There are 3 features in putrefaction. What are the 3 features? First, the color change occurs in the dead body. Okay, color change occurs in the dead body. Then gas evolution, gas formation occurs in the dead body, which causes distension of the gas body. And finally, the dead body get liquefied. These are the 3 main features, the cornerstones of putrefaction. Please learn. What are the 3 things? First of all, it is color change, then gas formation, and then liquefaction. Please learn it. Okay, so one by one we will take first color change. One by one we will take the 3 features. Color change. Why color change occur? Now color change occurs externally also in the dead body and in internal organs also. So we will discuss both. External color change, internal. You can make 2 arrows over here if you wish. So external color change, internal color change. External, internal. Let's start external color change. External color change में bacteria from the bowel invade abdominal wall directly. You can see these are the bacteria in the bowel. The bacteria in the bowel. The most important bacteria which cause putrefaction are the bacteria in the bowel. The bacteria in the bowel, they invade, they come out and involve the abdominal wall directly. They go in the abdominal wall directly, involve the abdominal wall directly. Then they cause destruction of the blood vessels over there. They cause destruction of the wall of the blood vessels so that hemoglobin release out. So the bacteria from the intestinal wall, they invade the abdominal wall. That's what written. The bacteria from the intestine, they invade and go to the abdominal wall directly. After that, what does they do? They diffuse hemoglobin from the vessel. They rupture the vessel walls. Okay, they secrete enzymes, and enzymes destroy the vessel walls, and from which the hemoglobin is secreted, and that hemoglobin is giving reddish brown discoloration in the abdomen. Where in the abdomen? Right iliac fossa. The first sign of putrefaction, the earliest visible sign of putrefaction is greenish discoloration in right iliac fossa. Take my words. What I have said? So it is greenish discoloration in the right iliac fossa, that is known as cecal fossa, the right iliac fossa, cecal fossa. You can appreciate the greenish discoloration over here. Can you appreciate the greenish discoloration in the right iliac fossa? Here also, here also. Later on it spread, but it starts with the right iliac fossa. Okay, greenish discoloration. So why greenish color is formed? Why? Who is forming the green color over here? You're getting my point? So the bacteria in the bowel, they invade, they involve the abdominal wall, they rupture the wall of the blood vessel, hemoglobin is secreted. Okay, this hemoglobin get converted to sulf-meth hemoglobin, because the colon, the large intestine, contain a gas, hydrogen sulfide. Everyone knows, na? Colon contain gas. The name of the gas is hydrogen sulfide, H2S. Hydrogen sulfide gas is present in the colon. So the hemoglobin which is released, it get converted to sulf-meth hemoglobin, and this is green color, and that's why the green color. So you get an MCQ on this. Why there is green color in the right iliac fossa in the putrefaction, the earliest sign of putrefaction? It is due to conversion of hemoglobin to sulf-meth hemoglobin, which is done by H2S. So basically I am saying the bacteria in colon, okay, they invade and come in abdominal wall. After coming in abdominal wall, they rupture blood vessel. From the blood vessel, hemoglobin is secreted. This hemoglobin gets converted to sulf-meth hemoglobin by H2S gas present in the colon. This gas, okay, and this is giving greenish discoloration first in the right iliac fossa. So this is what I want to say. I hope everyone got it. Okay, so see the images. I will show you. Can you appreciate the greenish discoloration in the right iliac fossa? Yes, this is the earliest sign of putrefaction. You can appreciate the greenish discoloration in the right iliac fossa, earliest sign of putrefaction. What is the reason for green color? Conversion of hemoglobin to sulf-meth hemoglobin. Conversion of hemoglobin to sulf-meth hemoglobin by H2S gas present in the colon. And this sulf-meth hemoglobin is of greenish color. Okay, I hope everyone got it. So the greenish coloration is not confined only to right iliac fossa. It then diffuses. It starts with that point, but it is diffusing in this manner. It is diffusing in this manner. Okay, so it is starting with right iliac fossa, the cecal fossa. After that, it goes on the liver surface, then gallbladder surface, then the complete abdomen. Then it goes downwards. First it goes upwards, then it goes downwards to the genitals. Then chest, neck, face, limb, everything is involved. You don't have to learn the sequence, but the point is that it is starting focally like this, and then diffusely it is involving the entire body. Okay, that is color changes. So it is greenish color. Initially the color is green. After green, the color changes to purple, and finally the color changes to dark black. So after a few days, 2-3 days, the color will be dark black. Okay, so green color, it starts with green, then purple, then dark black. Okay, what is the time it appears? Finally it become black color finally. Okay, so it 12 hours, I mean half day, 12 to 18 hours. If it's a range, not take one of them. 12 hours means half day in summers, and 2 days, half day in summers and 2 days in winters. So putrefaction ka time, half day in summers and 2 days in winters. Winters mein it's slow. In summers, it's fast. Okay, summers mein it's fast. It is clearly seen in fair skin. Obviously, if the skin is fair, it is clearly seen. You can see here. In fair skin, it's clearly seen. In dark colored people, it's difficult to notice. But in fair skinned people, it's clearly seen. So these are the features. Okay, one more thing. Color changes. I'm teaching you external color changes. External color changes में we have seen the first location. It is iliac fossa, right iliac fossa. Then it diffuses to the whole body. We have seen the color finally converts to black. We have seen the timings also. Okay, now one more thing, marbling of skin. Okay, it is also seen in the external color changes. What do you mean by marbling of skin? What do you mean by marbling of skin? Now, superficial veins. We have superficial veins, na? Especially the leg veins, superficial veins. Okay, superficial veins. In the superficial veins, hemolysis of RBC. The wall of the vein is destroyed by the bacteria. Okay, hemolysis of the RBC leak out. RBC is leaking. That is basically putrefaction. What is putrefaction? In which bacteria is destroying the tissues. So when bacteria destroy the wall of the vessel, blood leaks out. Hai na? So there is hemolysis of RBC, and the RBC, the pigment of the RBC, that is hemoglobin, is infiltrating the vessel wall. It is infiltrating the vessel wall and giving greenish or purplish discoloration, looking like a tree. I mean, how should I explain? Listen, these are superficial veins. Can you see? It is not diffuse discoloration like green color. It is like a tree. If you can appreciate, it is greenish color, purplish color, but it is like tree because it is on the course of the superficial vein. And that is known as marbling of the skin. You got it? You can see this. Appreciate the marbling on the breast superficial veins. You can appreciate it well. The tree-like structure. Okay. So the veins, superficial veins, the course of the superficial veins, you can appreciate it here in the leg veins. You can appreciate it here on the chest. So the superficial veins, the infiltration of hemoglobin in the wall of the superficial vein, giving greenish discoloration or purplish discoloration. This is known as marbling. Marbling means like a tree because it is superficial veins. So marbling of skin. You will remember this term, marbling of the skin, you understood? So in external, I taught you color changes. The first location of color changes, right iliac fossa. Iliac fossa. Okay. Why it is right iliac fossa? You know the flow chart. How does it is occurring? The colon bacteria infiltrate, come in the abdominal wall, rupture the vessel, and hemoglobin is giving this color. Okay, and hemoglobin get converted to match self hemoglobin by H2S gas, because of which this color comes at this location, and the color is green. So this is the location. This is the color. Okay. After that, it diffuses to entire body. Okay, from right iliac fossa to liver to gallbladder to genital to chest to neck to face. Okay, and green color changes to purple and changes to black. So first learn the first location and first color. Then location also changes, color also changes. This is what I taught you, and you know the reason, mainly reason for that. You know the flow chart mechanism. And I taught you marbling of skin. You know what is marbling of skin? Okay, so pigmentation, not diffuse. Here the pigmentation is diffuse. Here the pigmentation is along the courses of the superficial vein. That is looking like a tree-like structure, and that is known as marbling of skin. So this is what external color changes takes place. Now coming on internal color changes. So can I come on internal color changes? So putrefaction, color changes, occurs not only external, it occurs internal also. Internally also, the blood vessels get destroyed and internal organs get colored. So first internal organ which get colored is aorta ki inner surface. First external is right iliac fossa, and first internal is aorta ki inner surface. So learn the first external and first internal for your MCQs. Okay, so first internal color change takes place in the aorta ka inner surface. You can appreciate. This is the inner surface of the aorta, the root of the aorta, and appreciate the color change over here. Can you appreciate? This is aorta arising from the left ventricle, the root of the aorta. You can appreciate. So aorta inner surface become reddish brown discoloration. After that, all viscera, multiple viscera, there is no particular sequence. Dark brown to red color. Okay, finally they become soft, greasy, and they can't convert it into a liquid mass. You can appreciate the viscera. You can appreciate the viscera inside. All the viscera. You can appreciate multiple internal organs show reddish brown discoloration, and finally they get liquefied. So this is color, internal color change. Okay, one more thing I would like to add over here before I move to the next feature of putrefaction is maggot activity. What is maggot activity? What is maggot, by the way? Maggot. What is a maggot? Maggot is the larva of fly. Have you seen a maggot? These are maggots. Can you see? These are maggots. These are the larva of flies. Larva of flies, makhi, flies को हिंदी में मक्खी बोलते हैं, उसका larva. The larva of flies is maggots. Okay, so dead body attracts maggots. Dead body attracts flies actually. Okay, so flies come, they lay egg. Egg will hatch and larva will destroy the dead body further. Initially, the dead body is destroyed by its own bacteria. This is a dead body. Initially, the putrefaction started with its own bacteria. The bacteria present in the intestine, in the respiratory tract, in the wound, they multiply because of low oxygen. Okay, and they secrete enzyme. Those enzymes is causing destruction of protein, fat, carbohydrate, and the dead body is putrefied like that. It was initial. It was giving color changes. But later on, maggots is adding the destruction. Okay, maggot is external. So within 1 to 2 days, if the dead body is not secured, within 1 to 2 days, flies come on the dead body. Makkhiyan aa jati hain, flies. And once the flies come, they lay egg. Okay, egg will hatch. When the egg will hatch, maggots will come. Maggots don't come on the dead body. On the dead body, flies come. Flies will lay eggs, hundreds of eggs, thousands of eggs on the dead body. When the egg will hatch in next 1 to 2 days, maggots will come out. Okay, maggots will come out, and maggots produce the enzyme. These are the external enzymes. Okay, maggots produce the enzyme. Again, they digest the dead body. Okay, again they digest the dead body. If the temperature is high, it speeds up the decay, and maggots creates holes in the dead body. Maggots creates, you can see the maggots in the dead body. They are creating small holes in the dead body, which resemble gunshot wound. Okay, so maggots the hole resemble gunshot wound. I will teach you gunshot wounds also. Okay, mechanical injuries I will teach you. It's very interesting topic. So this is maggot activity. I hope you all got it. You can appreciate the maggot activity. If the dead body is there for 1 to 2 days, you can appreciate it. Looks like horror, scary. So if the dead body is there for 1 to 2 days, it attracts flies. Flies will come, flies will lay egg, the egg will hatch, the maggot will come, maggot will secrete enzyme, and those enzymes also digest the dead body. Initially also the dead body is digested by enzymes only, but those enzymes were secreted by internal bacteria, and now the enzymes are secreted by maggots. So it is cherry on the top. Okay, add-on feature. Okay, so ultimately dead body was already destroyed by the enzyme produced by bacteria, and now the dead body is also, along with that is continuing, along with that the dead body is also destroyed by the enzymes produced by the maggot. So this is maggot activity. So we are done with the color changes. Okay, got it everyone? Are you people there? People keep interacting. I mean, give me emojis, thumbs up after every topic, so that I feel that I am teaching and you are understanding. Okay, it's a live class, not a recorded version. Yes. And if you have any doubt, you are writing here. Maybe I'm far from the comment section. If I'm missing it, don't worry. After the end of the topic, I will give you time to ask the doubts. This is not for today only. For everyday class, it will be the same. In between, I will not address the doubts, but it doesn't mean I don't want to do. I don't want to address your doubts. I will address all your doubts, but by the end of the topic, so that it will not interrupt my flow. Okay, got it? So color changes are done. Now coming on guest evolution. I'm teaching you the 3 cornerstones, the 3 main features of putrefaction. We have seen color changes. We have seen external color change and internal color change. Yes or no? External color change may we have seen right iliac fossa and the color is green. Later on, from right iliac fossa it shifts on entire body, and the color also changes from green to purple to red to black, like that. And internal may, the first organ is internal surface of the aorta. And after that, multiple viscera is involved, and the viscera get liquefied. Finally, everything will get liquefied. Okay. Apart from that, I told you maggots also here. You know, maggots are also destroying and doing the color change. Now coming on gas evolution, gas formation, dead body form gas. Yes, dead body form gas. How does, I will tell you. You know what is the most common bacteria? I told you the name of that bacteria, no? The most common bacteria which is producing enzyme and responsible for putrefaction. Name the bacteria. I told you, no? Clostridium welchii, Clostridium perfringens. It's a gas forming bacteria. Yes or no? I told you microbiology people, come on. Yes. So Clostridium. So the main bacteria is Clostridium perfringens or Clostridium welchii. Okay. This bacteria metabolize protein and carbohydrates of the human tissue, dead body tissue. So this is the main bacteria which is causing metabolism of the human body, destruction of the human body. It produces gases. It produces carbon dioxide, hydrogen, methane gas, H2S, hydrogen sulfide, ammonia, phosphine, mercaptans gases. All these gases are produced by the bacteria. They give a crepitant feel. You know, crepitant like a balloon, spongy feel. The word is crepitant. It's like a spongy feel, and it distends the dead body. It causes distensions in the dead body. The dead body get distended after few days, few hours and few days. I will tell you the timing. This is gas formation in the dead body. Okay. Now, because of gas formation, learn 7-8 features. One by one, I will show you the image and the flowchart. Okay. This is basically gas formation. From the gas formation, you can draw 8, 9 features. I don't know the number, but there are many features, the many consequences of gas formation. Learn them one by one. So this is how gas formed. I told you the mechanism. How does the gas is formed? Because of the bacteria. The main bacteria is Clostridium perfringens, which is a gas producing bacteria. So when it causes metabolism of the protein and carbohydrate, it produces multiple gases, because of which the dead body distension of the gas body. Okay, distension of the dead body. Okay, now gases collect in the intestine first of all within a half day or 2 days. Again, the same summers and winters. In summers, it's fast. In winters, it's slow. Half day or 2 day. Half day or 2 day. Gases collect first of all in the intestine. So dead body, abdomen distant. Dead body, abdomen distant after half to 2 day, depending on the season when the death occurs. Okay, if the death is occurring in summer, so abdomen distant in just 12 hours. Okay, after death. And if the death is occurring in winters, so abdomen distant after 2 days. So first of all, because the gas is distending the intestines are in the abdomen, so it leads to abdominal distension. First thing. Okay. Second thing you learn, in the eyes also gas is produced. Okay, so because of eye is like a ball, it's like a curvature. It flattened. First it becomes flattened, the cornea flattened. You can appreciate the cornea, the flat cornea become flattened, and sometimes because of the gas, rupture, eyeball rupture in a dead body. Appreciate the rupture, appreciate the protuberance of the tongue, appreciate the rupture. The eyeball is completely ruptured inside the eyeball rupture. If we are looking, we are getting only blood, clotted blood, no eyeball. So it is already ruptured. Okay, so eyeball can collapse, can rupture because of the gas. Okay, so that is the second thing. So we have seen intestine distend, eyeball become first flattened, collapse. The third, gas in the vessels and the tissue forces the fluid under the skin. Okay, so in the viscera, the gas is there, in the tissue, in the gas is there. So it forces the fluid. The gas is forcing the fluid to go in the skin. So skins have blisters, which contain the fluid, serous fluid. So blisters are there on the skin. So blisters with clear reddish fluid or reddish fluid. It don't contain gas, it contains fluid. Okay, so fluid is forced by the gas. So inside this skin, we have tissue. So gas is there in the tissue, which is forcing the fluid in the skin and which is giving these blisters. Appreciate. So there are blisters in the skin, mostly on the trunk, thigh, and hypostatic regions, the stained regions. So that is blisters on the skin. The next is, this is all due to gas. So what we have learned, first of all, abdominal distension, then cornea flattening, then we have seen blisters in the skin. Now fourth thing. What is the fourth thing? Gases give crepitant feel. This I already told you. The complete body bloats grossly. You can see the complete body, not only abdomen. The complete body is bloating because of the gases. Okay, complete body is bloating because of the gases. Okay, now gases in the abdomen shift the diaphragm upwards. Have not put the diagram. You can imagine, here is abdomen, there is gas in the abdomen first. It is forcing the diaphragm upwards. When the diaphragm is forced upward because of gas in the abdomen forcing the diaphragm upwards. So diaphragm is pushing upwards, so lungs and heart is pushed. The lung and heart is compressed. When the lung and heart is compressed, pulmonary and pharyngeal vessels are ruptured. The pulmonary vessels in the lungs are ruptured. Okay, and blood-stained frothy fluid comes from the mouth and the nostril. This is known as postmortem purge. What it is known as? So sometimes from the dead body, blood can come from the mouth and the nostril, and this is known as postmortem purge. So gases in the abdomen is responsible for this phenomenon. Postmortem purge. What it is known as? Postmortem purge. Why it is there? Because of the gases in the abdomen, which is pushing the diaphragm upwards. Because of pushing of the diaphragm upwards, the lungs and the heart get compressed. So the arteries can get ruptured, and the blood tinged fluid coming out from the nostril and the mouth. And it can be mistaken for bleeding, following the antemortem. Okay, so it is postmortem purge. Got it? So this is again due to gases. This is due to gases in the abdomen. So next thing, gas pressure can change the location of the hypostasis. Hypostasis location, I told you, no, it depends on the position of the dead body, in supine, in prone, in lateral, in hanging. I told you yesterday, in inversion, all the things. So hypostasis location, distribution tells us the position of the dead body. But because of the gases, it can shift from here to there. The hypostasis can also shift from here to there. Okay, and because of the gases in the abdomen and the reproductive tract, There can be rectal prolapse or uterus prolapse. Appreciate the rectal prolapse in a dead body. Appreciate the uterus prolapse. It is not a real diagram. It is so much prolapse. It is a small prolapse maybe. So uterus prolapse, rectal prolapse can occur in the dead bodies because of the gases in the abdomen. Okay, so this all can happen. One more thing. Suppose there is a pregnant lady who is having fetus in the uterus. Okay, so gas pressure can compress the uterus, and in a dead pregnant lady, postmortem fetal extrusion can occur. The lady is dead. The pregnant lady is dead. Okay, and she is having uterus. She is having a fetus in her uterus. So this is the uterus. You can see, and imagine this is the fetus inside the uterus. This is the fetus, and this lady is dead. Now, because of the gases over here, the gases are compressing the uterus, and fetus expulsion can occur in a dead pregnant lady. This is known as coffin birth. Obviously, fetus is also dead because the mother is dead, the placental circulation have stopped, but this birth is known as coffin birth. Everyone got it? This birth is known as coffin birth. So, yeah, so these are the features. One more feature, skin slippage. The gases separate epidermis from dermis. Gases separate epidermis from dermis. You can see epidermis is separated from dermis. Gases separate epidermis from dermis. Large blebs are formed between epidermis and dermis, and clear fluid is filled between epidermis and dermis. Okay, and when dries, it becomes yellow color, and it is giving an appearance of glove and stocking. Can you see? On the hands and feet, it is giving appearance of glove. It is giving the appearance of gloves. We wear gloves in winters, na? Glove and stocking. So this appearance is known as glove and stocking. This is again due to gases. So can you enumerate all the features you remember due to the gas? First of all, abdominal distension within half day to 2 day, depending on the season. After that, IMA, cornea ka flattening and collapse. After that, there were many, na? You can remember. We will revise like this. Sure. One by one, you remember. First, abdominal distension. First, you learn how gas formed. It is because of Clostridium perfringens, which is digesting the proteins and carbohydrates and producing multiple gases. There is no one gas. All these gases are produced. That is causing distension of the dead body. So first, only abdomen distend. Then the eye. Okay. Then the blisters on the skin. You don't learn in a sequence. You can say haphazard also, but first is abdominal distension. You learn that. After that, you can follow any sequence. After that, eye is there. After that, blisters on the skin is there. After that, complete body distension is there. The body is bloating like that. After that, you can say the postmortem purge is there. You can explain why the postmortem purge is occurring. The shifting of the hypostasis is there. That can mislead the expert, the forensic expert later on. Prolapse of the rectum, prolapse of the uterus. Not only this, coffin birth. You should be able to explain what is coffin birth. Okay. And skin slippage because of the gases, which is giving the appearance of glove and stocking pattern, you can say. So all these features you have to enumerate. It is due to gas evolution. You can get MCQs also. Everyone give me a thumbs up. We are done. Yes, can we go ahead? Are you people there? Just a second. Yes, so we are done with color change. We are done with gas evolution. Color change, I told you in external color change, internal color change. External color change में right iliac fossa greenish color, the start point, and internal में internal surface of the aorta, okay, reddish brown color. You know the reason, flow charts, mechanism. Apart from that, I told you maggots also here. Maggots also I told you here. Okay. Then in the gas evolution, I told you multiple things in the gas evolution. Now can I start the third thing? Liquefaction. Yes, I shall start. So let's start liquefaction of tissue. Can I start? Yes. Liquefaction of the tissue. Okay, finally, the third important feature of putrefaction. Forensic medicine is very easy. Actually, it's factual. Many students commented or saying that, ma'am, forensic medicine and PSM, these two are very factual subjects. What you are going to teach in us. So if it is factual, you can learn of your own. But here my thing is that, my job is that I can show you multiple images. These images are not given in any book, anywhere. I have accumulated it from multiple sources. I show you here one slide. I hardly stay on that slide for few seconds, maybe for 2, 3, 4, 5 seconds. Okay, not, but for making the slide, I need more time. So I spend more time in making each slide to make these flowchart, to put arrows, okay, to convert paragraphs into bullets, into flowcharts, and put the corresponding images from multiple sources I collect. And then I present in front of you so that it fits in your mind. Okay, if you read the paragraph, it's not going to fit in your mind. You will understand, but you will not be able to recall. But in the form of the flowcharts and bullets and basically images, you will retain it better. That is for sure. So I agree these two subjects are more of factual, but I assure you each and every fact fit in your mind in these classes only. Okay, and the remaining two subjects, surgical subject, they are conceptual. You have to understand the surgeries. I will show you with 3D models, each and everything there. Anyways, come back. So let's move on the third thing, that is liquefaction. Can we start liquefaction? Yes, let's start it. You keep on revising the last two. Coming on the third feature of putrefaction, liquefaction. Finally, liquefaction. Have you studied pathology from me last year when you were in second prof? I guess many students are pre-existing users. Yes or no? So I taught you the necrosis. What are the 5 type of necrosis, people? You may have seen this slide if you have read pathology from me. So these are the 5 type of necrosis. Now, coagulative necrosis, liquefactive necrosis, caseous necrosis, fat necrosis, or fibrinoid necrosis? Yes or no? These two are special type of necrosis. Everyone knows. And these 3 are the main necrosis. What is the meaning of these 3? What is the difference of these 3? You can understand. You may have seen this also. I have explained you very well in second prof. Yes. So what are these 3 main necrosis? Coagulative necrosis, liquefactive necrosis, and caseous. Currently, I'm interested in liquefactive necrosis. Liquefactive necrosis in the dead body leading to liquefaction of the tissue. So basically, liquefaction of the tissue is due to liquefactive necrosis, also known as colligative necrosis. Coagulative necrosis, second is liquefactive. Liquefactive also known as colligative necrosis. This one, the second one, this one is responsible for the third feature of putrefaction, that is liquefaction of the dead body. Okay, so this is the necrosis. I hope everyone got it. You can see the 3 type of necrosis. Here, what is happening in liquefactive? In coagulative, the cell margins architecture is intact. Only the cytoplasmic detail is lost. But this one is not happening here. In the liquefactive, the complete cell is lost. I mean, its architecture is also lost. Its cytoplasmic detail and nuclear detail, all the things are lost. And ultimately, it gets converted into liquid. A liquid. That is liquefactive necrosis. So after 5 to 10 days of the death, not immediately, not after 2 days, half days. You have to learn these timelines. After 5 to 10 days, after death, liquefactive necrosis of the dead body start, and that leads to liquefaction of the tissue. So I guess you know the reason of all 3 now. What is the reason for color change? What's the reason for the color change? It is the bacterial enzymes which is causing degradation of the vessel, which is causing release of the hemoglobin, and hemoglobin get converted to self-meth hemoglobin by H2S gas, and that is giving the color change. What is the reason for gas evolution? It is Clostridium perfringens, which is digesting the human tissue, carbohydrate, protein, and forming the various type of gases. You know the reason. You know the name of the gases. And what is the reason for liquefaction of tissue? Liquefaction of tissue is due to colligative necrosis of the dead body after 5 to 10 days of the death. Okay. Okay. So that is the reason. Now, tell me the features of liquefactive necrosis. The complete abdomen burst. Sometime in the dead body, the abdomen burst because of liquefaction. The complete abdomen burst. Everything get liquefied inside. Abdomen burst, stomach, intestine can protrude. In children, thorax can also burst. Thorax is also soft, ribs are soft, and that can also burst. The complete fat liquefies. It becomes translucent yellow color. All the internal organs are soft and black. They are black because of putrefaction, but they become soft and liquefied. Okay, if it's a small fetus, it is completely liquefied. Okay, and cartridges and ligaments are last to liquefy. So these are the features of the liquefaction. You can say everything is getting liquefied. Okay, eyeball can also get liquefied. So this is the third and the last feature, that is liquefaction. So we are done with the first thing, putrefaction. Today I am supposed, no, not done. The features are done. Okay. So features of the putrefaction are done. The 3 features. You know color change, you know gas evolution, and you know liquefaction. You know the reason of all 3, features of all 3. Okay, try to summarize it here only, so that you don't have to read such a text. You can summarize it here. Now, I was teaching you putrefaction under these headings. Okay, can we revise it? I already taught you the definition. What's the definition of putrefaction? Bacterial destruction of the dead body. Or you can say bacterial destruction of the soft tissue followed by skeleton of the dead body. Bacterial destruction. Okay, mechanism I already explained you, the flow chart, and the 3 features we have just completed over here. You can see the 3 features we have just completed. Now I'm coming on distribution of the putrefaction. Distribution of the putrefaction. Tell me the sequence in which putrefaction occurs, the distribution. Okay, after that I will tell you the factors affecting rate of putrefaction and some small terms like what is Algor Mortis, putrefaction in water, skeletonization, all these. So first coming on the distribution of putrefaction. Distribution of putrefaction, it starts with abdomen. I told you, right iliac fossa. It starts with right iliac fossa, then complete abdomen. Okay, so first it starts with abdomen. Okay, then it moves to the chest, then it moves to the neck, then it moves to the face, then it moves to the legs. Okay, and then shoulders, and then arms, then shoulders and arms. You can learn the sequence if you wish. If you can't learn the sequence, learn the starting point. Putrefaction externally start from abdomen. If you can learn complete sequence, it's well and fine, but nobody is going to ask, at least in MCQs. For university exam, if you can write down, very good, you will get good marks. But you can't forget the first thing to start. So putrefaction externally start with abdomen, especially right iliac fossa, thecal region, abdomen. Then complete abdomen, then it moves to the chest, then move to the neck, then face, then shoulders, then arms. So this is the usual sequence, but it depends on the temperature, body to body. There are many factors I will come on that. This is the external order. Internally, it start with larynx and trachea. The putrefaction start with larynx and trachea. You can appreciate here, larynx and trachea. Okay, after that it goes in the abdomen, stomach, intestine, pancreas, spleen, then liver, lung, brain, heart, kidney. Don't learn the complete sequence, but just starting from larynx and trachea. So this is the internal sequence of the order of putrefaction. Fastest putrefaction, occurs in larynx and trachea, and slowest occurs in bones. You can learn like that, the fastest and the slowest internal organs. So that is the distribution. Now coming on the factors affecting rate of putrefaction. What are the factors? There are two types of factors, external factors, internal factors, which affects the rate of putrefaction. So external factors are 5, internal are 3. So total 8, 5 plus 3. 5 plus 3. 8 factors are there. 5 are external, 3 are internal. Total 8 factors. You try to learn. Okay, what are the 5 external factors? One by one we will take. So let's start with external factors only. Let's start with external factors. First is temperature. Temperature affect putrefaction? Yes. Below 10, it don't occur. I mean, it begins when the temperature is more than 10 degree. When the temperature of the dead body is more than 10 degree, then it begins. It is optimum 21 to 38. What is human body temperature? It is 37 degrees Celsius. But after death, the dead body start cooling. Yesterday I taught you Algor Mortis. So it loses heat till it reaches the temperature of the environment. Yes or no? So 21 to 38 degrees, it's optimum. And below 0 and after 48, it don't occur. Putrefaction occurs optimum. It's optimum at 21 to 38. Okay, just a second. It's interrupting the digital board. So putrefaction is optimum at 21 to 38. Okay, and below 0 and above 48, it don't occur. Below 0, above 48, it don't occur. Rate doubles every 10 degree rise. Rate doubles every 10 degree rise. Okay, these are the features of the temperature. Coming on moisture. Moisture is essential for putrefaction. Dryness arrests putrefaction. Moisture is essential. That's why putrefaction is very fast when the body is taken out from, in case of drowning, taken out. In water, putrefaction is slow, but once the body is taken out, it's very fast. In edematous body and drowned dead body, the body which is drowned, then it is exposed to air. It's very fast. Okay, that is moisture. Air is very essential. Okay, bacteria will survive in presence of air only. So air is essential for putrefaction. Clothing will increase the rate of putrefaction or decrease the rate of putrefaction. Initially, clothing hasten the rate of putrefaction. It is hastening because it is providing heat to the body, na? And in heat, the bacteria will survive better. Putrefaction is all about bacteria. Okay, bacteria need air, bacteria need moisture, bacteria need adequate temperature. At low temperature and high temperature, bacteria can't survive. So if bacteria survive at optimal temperature, putrefaction is maximum. Moisture is essential for bacteria. Air is essential for bacteria. Clothing provide heat to the dead body. If the dead body is covered with the cloth, blanket, so it provides heat to the dead body. Okay, so it is good for the bacteria. So putrefaction is fast. But later on, it resists the entry of the maggots. Na? If the dead body is covered, flies cannot come. You know, I told you, na? After 1 or 2 days, flies comes on the dead body and then they lay eggs and maggots come. So insects ka entry is blocked by the cloth. So later on it delays putrefaction because putrefaction is due to 2 things. First, it is due to bacterial enzyme. Later, it is due to the enzyme secreted by the maggots. Got it? So clothing can hasten initially because it provides heat. Later on, it delays because it blocks the entry of the insect. Okay. On a naked dead body, the insect entry is easy. Okay, the next is burial. The dead bodies are buried. Okay, sometime it is buried, sometime it is burned, depending from caste to religion. There are many ways for the last ritual of the dead bodies. So burial, in case of burial, so burial is shallow or deep. Putrefaction will be fast where? So bacteria survive better in shallow, because shallow burial are damp. If the burial is very deep, it will be dry. So shallow, if burial is shallow, superficial or shallow, putrefaction is fast. If burial is very deep, the soil is dry and putrefaction will be slow. So everything is common sense. You don't have to learn. Putrefaction depends on soil to soil. There are various types of soils in which the burial of the dead bodies is done. So it is fastest in the marshy soil. Okay, and little bit less than that, faster in the porous soil. Okay, and this acid, if the soil contains acid, it can destroy even bones. Okay, so it depends from soil to soil. That is the burial. So these are the factors, the 5 factors, external factors, which decide the rate of putrefaction. Temperature may, optimum temperature is 21 to 38 degrees Celsius. Below 0 and after 48, it is arrested. It don't happen. Putrefaction don't happen because bacteria can't survive. Okay, moisture is essential. Air is essential. Clothing initially increase the rate of putrefaction because it provides heat to the body, and later on it decreases the rate of putrefaction because it blocks the entry of the insects. Burial may, shallow burial, it increases the rate of putrefaction, and deep burial, it decreases the rate of putrefaction. You can write here only like this. Okay, so you don't have to read all these slides. Okay, and depends from soil to soil also. You can learn the soils for your MCQs. So this is the external factors, common sense. Okay, internal factors. Does age affect condition of the body and cause of death affect putrefaction? Yes, age, regarding age. You know, newborn gut, as soon as the newborn is born, if it is unfed, no milk, no mother milk, as soon as the newborn is born and the newborn is dead after birth. Okay, so intestine is sterile. There is no commensal bacteria in the intestine. So there is sterile intestine. If the newborn is born, as soon as the newborn is born and not fed, intestine is sterile. So there is no bacteria. So putrefaction is very slow. Okay, and remaining all, the putrefaction is fast because they have bacteria in the gut. So that is the age importance. What about fat and lean? The person who is fat, the person who is lean, if both of them are dead bodies, so putrefaction will be fast in which? So fat decompose faster. Okay, and fatty body may putrefaction is fast because fat decompose fast. Bacteria can decompose the fat very fast, but in a lean body the decomposition is slower. So putrefaction is fast here in an obese person, in an obese dead body, and putrefaction will be slow in the lean dead body. If you understand the concept, you don't forget, because bacteria can digest the fat faster. More fat, faster digestion, fast putrefaction. Here less fat, so slower putrefaction. Okay, what is the cause of the death? Putrefaction is fast after septicemia, peritonitis, asphyxia, and anasarca, and putrefaction is delayed in all these diseases if you want to learn. Okay, so that is about the factors. We are done with the factors affecting putrefaction. I told you 5 external and 3 internal factors. If you want to learn, you can write down 1 to 1 line on each of them. The factors affecting putrefaction. You can get MCQ on that. You can easily solve that if you get the MCQ. If you can write down 1 to line over here only. Okay, and for your university exam, you can fill at least half or 1 page. Okay, based on the factors affecting putrefaction. Now coming on odor mortis. What is odor mortis? Odor mortis, it's an offensive or sweet smell, offensive or sweetish odor from the dead body due to the typical chemicals which are produced because of putrefaction of the human tissue. So when putrefaction of the human tissue is done, so 50 typical chemicals are produced which are not produced in the putrefaction of other animals. Okay, so that can be detected by the dogs also, the trained dogs. Okay, because they have good smelling power. So dogs can smell and tell the dead body if the burial is shallow. They can smell it. Okay, so that is known as odor mortis. Or there are cadaveric detection instruments also apart from the dog that can detect the smell of these 50 typical chemicals which are produced due to putrefaction of the human tissue. Okay, not due to animal tissue. So this term is known as odor mortis. Okay, now one more thing, putrefaction in water. What happens in What happens in putrefaction in water? There is Casper dictum. You learn this name. Casper dictum. Casper have said what? See the ratio. Putrefaction in air is to water is to earth. Earth means burial, deep burial inside the soil. So highest putrefaction occurs in air, on the land, in the air. Okay. Slower than this is in the water, and very slow in the burial. That's why the dead bodies are buried at many places. I mean, many religions. Dead bodies are buried because putrefaction is slower. Putrefaction is slower as compared to air and water. You are getting my point? So this is the ratio you have to learn. Air is to water is to earth. Say the ratio. Air is to water is to earth. So putrefaction is 8 times as compared to burial in the air. In the water it is 4 times. On the earth it is 1 time. So here it is 8 times and here it is 4 times as compared to burial. You are getting my point? So same thing is written. So fastest putrefaction is in air. Slower than this is water. And slowest, very slow, is in burial, deep burial. So that is Casper dictum. Okay. So basically what we have learned, I'm interested in water. Water mein putrefaction is fast or slow as compared to air? So water mein putrefaction as compared to air it's slow, but as compared to burial it's fast. But as compared to air it's slow. So water slows down putrefaction as compared to air. Okay. Now it depends. Is it moving water or stagnant water? The dead body was where? In the moving water, putrefaction is very delayed. In the stagnant water, it is relatively fast. Okay. So that is regarding the water. So that is regarding the water. In the water, many aquatic animals are present. Like fishes are present. They can eat the flesh. They can eat the flesh of the dead body. So sometime if the dead body is in water for long, for days or for months, we take out the dead body after that. So we found the flesh is already eaten. The body is not decomposed. The body is not putrefied. Putrefaction is not there. So where is the flesh? Where is the flesh? Is it putrefied? No, the animals have eaten it. I mean aquatic animals. So aquatic animals like fish, crab, rats, they can destroy the flesh. And sometimes there is fungal growth over the dead body in submerged dead bodies. Fungal growth can be there. So we are done. The last thing in putrefaction is skeletonization. So this was all about soft tissue. Okay. The soft tissue is destroying. Does putrefaction destroy bones also? Yes. Okay. So this is known as skeletonization. It varies with temperature and insects. How many insects are there? Now listen. If the hot, humid climate is there, complete skeleton in few days. But dead bodies are not kept in hot, humid climate. No, dead bodies, the last rituals are performed as soon as possible. Either they are buried or they are burnt. Okay, whatever is the last ritual. They are not kept in the hot, humid climate. Otherwise, in few days only, the complete skeletonization will be there. Putrefaction will be very fast. Okay. If the body is exposed to flies, ants, dogs, or vultures, they will within few days only, they will take out all the soft tissue. And skeletonization is there. Okay. In buried bodies in India, I'm talking about Indian soil. In buried bodies, skeletonization occurs in 1 to 2 years after burial. Okay. And sequence of disarticulation. First of all, the head disarticulate, then trunk disarticulate, then limbs disarticulate in a buried body. I'm not talking about the burnt. I'm talking about a buried body. And bone decay takes 10 to 12 years. So that is about the skeletonization, and we are done with putrefaction. Today I'm supposed to teach you 3 topics. One of them, the biggest one, is done. Now these 2 are small and relatively small and easy to understand. So putrefaction is done. Yes or no? Can we revise it quickly? Yes, we can do so. So if putrefaction, long question coming in your exam, can you write your answer under these headings? Yes. Can we revise these headings quickly? Yes. What's the definition of putrefaction? It is bacterial destruction of the dead body. Bacterial destruction of the dead body. Okay, what is the mechanism? You know the mechanism? The bacteria which are present in intestine or respiratory tract, they will invade out in the soft tissue. They will release the enzyme, and those enzymes are causing the destruction. First, they will multiply because oxygen is less. I've told you the complete flow chart. Okay, now 3 main features. Color changes external, right iliac fossa, greenish color. Internal में aorta, internal surface, the reddish brown color. You should appreciate the maggots also. The maggots also add on the you can put the maggots in the mechanism only if you wish. So maggots also add on in the putrefaction apart from the commensal bacteria. Okay. Second is gas evolution. Gas evolution, I told you many things. Now, first abdomen distend, then eye, then blistering of the skin, then prolapse of uterus, prolapse of rectum, postmortem purge, that is bleeding from the nose and the mouth. This all due to gas evolution. Liquefaction, mein, you know the reason for liquefaction. It's colligative necrosis. Out of the 5 type of necrosis, which necrosis? Liquefactive or colligative necrosis is responsible for liquefaction, and all the things get liquefied one by one. Okay, distribution mein, you know the distribution of external organs and distribution of internal organs. External mein first is abdomen, and internal mein first is larynx and trachea, and last is bones. If you wish, you can learn the complete sequence over here. Factors affecting putrefaction mein, I told you external factors which are 5 in number, and internal factors which are 3 in number. They all were common sense, you can understand. Algor Mortis, you know, it is a peculiar offensive or sweetish odor which comes from the 50 typical chemicals which are formed during putrefaction of the human tissue, and that can be detected by cadaveric instruments or dogs. Okay, and then putrefaction is water is slow as compared to air. You know the Casper dictum, 8:4:1. Air is to water is to earth. Okay, and last is skeletonization. So this is how you can frame your answer. At least you can write down 4-5 pages if it is a long question. If it is a short question, they will ask you a peculiar portion. You have to write down that only. And MCQ 100% done. Try it out now. Try it out. Whether I say, you try by your own. Okay, putrefaction is done. Can I come on the second feature? I mean, second postmortem change. Late postmortem changes mein first is done, putrefaction. Now, second is Adipocere formation. So, let's start the second, that is Adipocere formation. What is Adipocere? If Adipocere is coming as a long question, or usually it is not long, it is asked as a short question, you have to frame your answer under these headings. So, first of all, you tell me Adipocere is also known as saponification. Saponification of the dead body. Okay. So, first you tell me the definition. Obviously, then you tell me the mechanism. Okay, then factors affecting the formation of adipocere, properties of adipocere, distribution of adipocere, and what is its medical legal importance. So one by one we will see what is the definition. What is adipocere? First of all, the remaining two, these two are modifications of putrefaction. They prevent putrefaction, both of them. Adipocere formation as well as mummification. They prevent putrefaction. They are modifications of putrefaction. Okay. So adipocere formation, in the introduction itself, you can write down it's a modification of putrefaction. It's a modification of putrefaction in which the body fat, the dead body have fat, all human body have fat, whether obese or thin. So body fat, this full sleeves now, it interact with the digital board and changes the slide again and again. So this body fat get converted to waxy, greasy, soap-like substance, and that is known as adipocere. Can you see? This is adipocere formation. So in the dead body, whatever fat is there, the fat in the dead body get converted to waxy, waterproof, soap-like material, that is known as adipocere. Okay, this conversion is known as adipocere formation. It is common in the bodies which are immersed in water. Okay, or which are kept in moist environment. Okay, and it represents chemical preservation of the fatty tissue rather than destruction. So here fat is not destroyed, rather it is preserved. It is saponification of the fat. Saponification of the fat. In putrefaction, the fat was destroyed. The fat is destroyed by the bacteria in putrefaction. Here fat is not destroyed. The fat is preserved. The fat is preserved. That's why I'm saying it's a modification of putrefaction. So you know you have to learn this definition. What is adipocere formation or what is saponification? The body fat of the dead body get converted into waxy, greasy, soap-like substance which is known as adipocere. And this is a definition. Okay, you can see adipocere formation. Okay, so what is the mechanism? Whatever pre-existing fats are there in the dead body, okay, they are get hydrolysis or hydrogenation by the lipase enzyme. The lipase enzyme is secreted after death, and that lipase enzyme act on the pre-existing fat present in the dead body, causing hydrolysis and hydrogenation of those fat and convert them into fatty acids. So pre-existing fat convert into fatty acid by the enzyme lipase. The pre-existing fat in the dead body, you can see this is the dead body, the pre-existing fat converted to fatty acid with the help of lipase enzyme because of hydrogenation and hydrolysis. So that is the main mechanism. Now, these fatty acids combine with calcium and ammonia ions and form the soap, form the water resistant soap, and that is known as adipocere. That is known as adipocere, and that inhibit putrefaction. Okay, that inhibit putrefaction. So say the complete mechanism. I know it's factual, but I'm trying to retain it with the help of images and flowcharts. So this is a dead body. In the dead body, there is fat. Okay, we will draw. In a dead body, there is fat. That fat is converted to fatty acid with the help of lipase enzyme. This lipase enzyme causing hydrogenation and hydrolysis of the fat, converting it to fatty acid. This fatty acid combined with calcium and ammonia ions, and now it is known as soap. It is known as soap. Soap or saponification. It is waxy, greasy, water resistant. Okay, and it inhibits putrefaction. It inhibits putrefaction. This is how you have to draw it and understand it. Okay, you can see. So body fat, lipase is acting on it, converting it into fatty acid. Fatty acid combined with ammonia, calcium, and form a soap, water resistant soap, saponification. Learned it? This is the mechanism. So mainly mechanism is asked. Mainly the definition and mechanism. That's what you have to learn. Okay, water is essential, which is required for hydrolysis of the fat. Without waters, adipocere formation cannot occur in dry environment. And first of all, it occurs in subcutaneous fat and then deep on tissue. So it starts with the subcutaneous fat, then deep on tissue. So it is preventing putrefaction. It is preserving the dead body for longer. Okay, that is adipocere formation. Okay, what are the factors influencing? The most important factor is water. The major factor is water. In presence of water only it occurs, because in the formation we require hydrolysis. Hydrolysis is because of water. So fats, hydrolysis of the fat because of lipase will lead to fatty acid. If there is no water, there is no hydrolysis, so fatty acid will not form. So the major contributor here is water. Then second is temperature. We know in warm environment it's faster, in cold environment it's slower, like all other things. Then body build. It is more common in obese. Common sense. Obese have more fat, that's why more common. Okay, side. It occurs in the bodies which are submerged in the water. Okay, and it starts after 4 to 5 days. So that is the factors affecting property. Tell me the color. It is whitish to pale yellow. Appreciate. It's whitish to pale yellow color. What was the color of putrefaction? It started greenish. You know the reason for greenish. Typical greenish color. Because of sulf-math hemoglobin formation. And here the color of the soap is white to pale yellow. Later on it converts to brown. Okay. The texture is soft, greasy, waxy. Have you seen a wax? Soft paraffin wax. It's like that. It's soft, greasy, waxy initially. Later on it becomes hard and brittle. And odor is ammonia odor. The smell is like ammonia. When urine is retained in the bladder for very long time, then ammonia is generated in the bladder, and then after with the full bladder or holding the urine for very long, when the urine is passed, there is a peculiar odor comes, that is ammonical odor. So same odor comes from the dead body if adipocere is formed. Okay, inflammable? Yes, it burns. It is inflammable, it burns. Okay, if a matchstick is put, the complete body can be burnt. It's inflammable. The adipocere is inflammable. Okay, it floats in water and it persists for decades. It prevents putrefaction for decades. For decades, the dead body is preserved. I mean, putrefaction destroys the dead body. Na? Adipocere is preserving it. Okay, so adipocere formation only if water is present around the dead body, moisture is present. Distribution, I told you already, it starts in subcutaneous fat. Subcutaneous fat of face, cheek, breast, abdomen, buttocks, thigh and limbs. So maximum fat is present where? Subcutaneous fat. Okay, and then it goes to the deep fat of internal organs. So that is a distribution. Okay, and epidermis disappear. Later on epidermis disappear and dermis darken. You can see in extensive case the entire body converted to adipocere. The entire dead body converted into adipocere. It starts like this, and then entire body converted into adipocere. What's the medico-legal importance of adipocere? Is it important? Yes. It preserves the body features, and it is required for identification. In case of unknown dead body, unidentified unknown dead body is found after many days of the death from some forest or submerged in some water, in some lakes like that. So in medico-legal cases, it's important for identification. If adipocere is formed, putrefaction will not happen. Putrefaction destroy the features. It is preserving the dead body. So it's the most important medico-legal importance is preservation of the body features, which is useful in identification in medico-legal cases. Okay. It preserves the wounds and fractures also. So it helps us to determine the cause of the death. Okay, whatever is the wound, it will also preserved. Okay, whatever is the fractures, that will also preserved. Putrefaction destroy everything. After 2-3 days, putrefaction start and it destroy everything. But here it is preservation. Okay, and it indicates post-mortem interval based on which we can tell the approximate time of death, and it suggests the dead body was in moisture after death. Okay, so this is the medical legal importance. Learn 4 points. Medical legal importance of all the things you should know. You should be able to write, because what we are studying, what is the subject? Forensic medicine. Why? My first slide every day I show you for forensic medicine is medical legal importance. So forensic expert helps the police to tell answer of 2 questions: how the death occurred and how long is the post-mortem period. When did the death occur? So for answering these 2 questions, this medical legal importance of all the things you should be able to know. So medical legal importance is very important. Okay, am I not audible? Harshita, am I not audible? Others, kindly respond. Am I audible or not audible? Can you please respond, everyone? Am I audible or not audible? Is audibility is the issue? Many students sometimes say I am not audible. What is the issue? I don't know. I'm audible now. Okay, so what is the problem? Can we go ahead? We are done with Adipocere formation. Can we revise it quickly? Adipocere formation is done. So Adipocere formation under these headings. Okay, what's the definition of Adipocere formation? In Adipocere, the fat of the body, dead body, get converted into Adipocere. What is Adipocere? Adipocere is soap, saponification. It's waxy, greasy, water-resistant soap, and that is known as Adipocere. How does it occur? You know, the fat get converted to fatty acid because of hydrogenation and hydrolysis by lipase enzyme. And this fatty acid combined with calcium and ammonia, and it forms the soap. And this soap is known as Adipocere, and it prevents putrefaction. Easy. The factors I told you, the 5 factors, you please learn the same: temperature, moisture, lean and obese body, the same factors. Okay, properties of Adipocere: tell its color, tell its texture. The color is yellow, white, the texture is greasy. Okay, so you have to write down all the properties. Distribution: it starts with subcutaneous fat of cheek, face, breast, buttock, thighs, and then it goes to deep fat of the internal organs. Medical legal importance: learn the 4 points of medical legal importance you already know. Coming on the last thing for today, mummification. Can I start mummification quickly? Okay, so mummification. What is mummification? It is a short note. If you're getting a question on mummification, you have to write down your answer under these headings. First of all, tell me definition of mummification. What is mummification? Then mechanism. Everything will start with definition and mechanism. These 2 headings are common in all, whether it is putrefaction, adipocere formation, or mummification. So these 2 headings are common: introduction, mechanism. Okay, introduction, mechanism, features, time required, and medical legal importance. One by one we will see. What is mummification? Mummification is evaporation of water from the dead body. If the dead body after death, it is kept in a very dry, hot environment, in absence of water, very dry environment. So complete dehydration of the dead body because of evaporation of complete water from the dead body. From the dead body is complete water is evaporated. There is no water inside the dead body. 100% dehydrated. So for the first 2 things, water is essential. I told you, for putrefaction as well as adipocere, for both of them, water is essential. So they both can't happen and mummification will occur. So mummification again prevents putrefaction. It preserves the features of the dead body. I hope you are getting it. So what was putrefaction? Bacterial destruction of the dead body. Okay, what is adipocere formation? Adipocere formation is conversion of fat of the dead body into a soap-like material. What is mummification? It is dehydration of the dead body, drying and dehydration of dead body because of evaporation of water. So these 2 are modification of putrefaction which prevent putrefaction. Okay, so mummification, it's complete dehydration and drying of tissue due to evaporation of water. It's a modification of putrefaction. Okay, body becomes dry. You can see the dead body become dry here. Okay, it becomes dry, leathery, light. The weight is reduced, the dead body weight, because the water evaporates. Okay, and it is shriveled, but maintain the general form and features. You can see the general features can be identified. The general features can be identified. So what is the mechanism? How does mummification takes place? What is the mechanism of mummification? When the dead body is exposed to hot, dry air. Okay, now which one is fast? Is evaporation is fast or bacterial activity is fast? So inside the dead body, the bacteria are already present. Okay. But if evaporation is faster rate as compared to bacterial activity, then putrefaction will not take place. Mummification will take place. So after death, there is a competition between the two. Is evaporation is at a faster rate or bacterial activity is at a faster rate? If evaporation is not faster, the body is in humid environment, or it is in winters, it is in humid environment. Okay. So bacterial activity will fasten. In that case, putrefaction will go. Okay. But if evaporation is fast, if the dead body is in very hot, dry, desert area, and in that case bacterial activity will not be very fast. I told you na, bacterial activity optimum temperature is 21 to 38 degree. If the temperature is more than 38, so bacterial activity is not very high. Okay, after 48 it is 0, 48 degree. 38 to 48 it is very less. So in summers the temperature sometimes touch the 40s, 50s. In that case, if the dead body is kept in open in summers in dry environment, then evaporation of the dead body occurs. Okay, evaporation of the dead body occurs, and evaporation of the dead body is more than bacterial activity. It causes rapid evaporation of the water. It causes rapid evaporation of the water, and bacterial activity is suppressed. Evaporation is fast, bacterial activity is low. So tissue desiccate before it decomposes. You have to learn this line. Tissue is desiccating before it decomposing. Putrefaction decomposes the tissue, and this one is desiccating the tissue. So tissue get decipated and mummification occurs. I mean the body convert into a mummy. This is known as mummification. The body converted into a mummy. A dead body with dehydrated, complete dry dead body I'm sorry, is known as mummy. This is known as mummification. Everyone got the mechanism? Give me a thumbs up. I will work on the sound. Many students are saying, no, audio is the problem. Will call my tech person tomorrow to set my mic, or if required, I will change it. But give me a day. Tomorrow we don't have any class, so tomorrow I will work up on the sound, and I'm assuring you that the next class you will not face this problem. Okay, currently I will go with the same settings, because if I change the setting, class will not be continued. I guess you can understand. I mean, the voice is not very less. Yes, can I continue the class with the same setting? In the next class, I will try to change the settings with my tech person. Okay, can we continue? Sure. Yes. So this is the mechanism. So we are done with definition and mechanism. Definition is dehydration and drying of the dead body. Okay, mechanism, when evaporation exceeds the bacterial activity. So dead body desiccate as compared to decompose. Learn this line. Dead body desiccate faster as compared to decompose, because evaporation is at faster rate as compared to bacterial activity. Evaporation leads to desiccation of the dead body, and bacterial activity leads to decomposition. Decomposition is the other name of putrefaction. Okay, getting it? This leads to mummification. I hope everyone got it. What are the features? Now enumerate the features one by one. Okay, it start at the exposed part. I cannot tell you one part. Like for putrefaction, I told you this one start at right iliac fossa. Externally and internally, it starts in larynx and trachea. Adipocere, I told you, it starts in subcutaneous tissue of the face, cheek, buttock, thigh, breast, wherever fat is there. Mummification, there is no fixed area. Exposed portion of the body. So it starts at the exposed parts of the body, like face, hands, and feet, usually not covered with the clothes. So it starts at this point, and later on it extends to the whole body. Okay, including internal organs also. So this is the features. The skin of the mummy is dry, brittle, leathery, and parchment type. The color is brown to black. Okay, there can be fungal growth on the surface. That's it. Body weight reduced by 60%, 60 to 70%. Suppose there is a person whose weight was 100 kg at the time of death. Okay, so after death, after mummification, it will be only 30 kg or 40 kg. The remaining one is lost, okay, in the evaporation. So rate is reduced by 60 to 70% because in human body, 60 to 70% is water, and that is evaporated. So weight reduction, significant weight reduction is there. Limbs are thin and rigid. You can appreciate the limbs. They are thin, they are rigid. Muscles are contracted. The muscles are contracted. So usually elbows, knees, and fingers are flexed. It's not very good visible here, but the elbows are flexed. Okay, flexion is there. The muscles are contracted. Internal organs are shrunken. You can appreciate all the internal organs, not visible over here, although they are shrunken, hard, and dark brown color. And insects there is no maggot. Maggot occur in putrefaction. Here moths and larvae can come. Moths and larvae can come in a mummification dead body. Okay, what's the time required? In dry environment, it requires 6 months. In moderate environment, it requires 12 months. And it persists for years if the environment is favorable. So in dry environment, it's very fast. Mummy is formed in 6 months, and in moderate, it takes 12 months. So you have to learn the time requirement. What is the medico-legal importance? 5 medico-legal importance. Number 1, it confirms death. Obviously, this person is dead. It is not dead, it is mummified. So it confirms death and postmortem desiccation. Number 1, it preserves the identity. It is preventing putrefaction. It is preserving the identity. We can identify the person from the facial, all the features. Okay. So it preserves identity. It preserves injuries also, like adipocere only. It indicates the body was in dry environment since last months or years. And it tells us the approximate time of death. Okay, so that is the medico-legal importance, is same as that of adipocere. You should know the medico-legal importance of all of them. You frequently get short or very short question on the medico-legal importance of these things. So I always insist to understand the medico-legal importance instead of mugging it up. I highlight the main word that you have to keep in your mind. Okay, so we are done with mummification also. I guess you can write your answer under these headings. So we are done with all 3. One more thing I want to teach you. Next 5 minutes, 10 minutes. Wait. First, you see these 3. So if any of the question coming in your exam, long question, short question, will you be able to define the 3? What is putrefaction? Bacterial destruction of the dead body. Adipocere, formation of soap-like material in the dead body. Okay, waxy, greasy, water resistant. And what is mummification? Dehydration and drying of the dead body. You know the mechanism of all, definition is written in front of you. You know the mechanism mainly, medico-legal importance, features, factors, you know everything. Yes or no? These are the headings under which I taught you these 3 topics. So before going to your exam, if you are going for a prof exam, you should revise these headings for framing your answer. And if you're preparing for competitive, go for MCQs directly without revision. Okay, got it? You can see we have completed putrefaction, adipocere formation, mummification. Everyone give me a thumbs up. Everyone. Got it? Those who are live, please. Last one topic I want to teach you before leaving. It is also given in this chapter only in the standard textbook. So this chapter will be 100% complete. Okay. Estimation of postmortem interval. How to estimate postmortem interval? That is time since death. What are the ways? There are 12 ways. You get a long question on this. How to estimate postmortem time? The most important job of a forensic expert. Whenever there is a suspicious death in which there is a suspected or multiple suspects are there. Okay, so police call a forensic expert on the crime scene, and forensic expert, the most important job is to tell time since death. Okay, so how the forensic expert reach on some conclusion? Suppose we all are forensic experts and there is a suspicious death. Okay, and some unnatural conditions, and there are multiple suspects the police is having. Okay, like a movie story, like a series, right? And we all are forensic experts. We are on the crime scene and we have to tell time since death to the police. We have to submit our report to the court so that the justice can be given. Okay, got it? So these are the 12 parameters based on which I can tell the time since death. It's very easy. Everything is common sense. You have to just learn these 12 parameters based on which, looking at the dead body, we can tell time since death. Okay. Before coming on these 12 parameters, I would like to tell you the definition of postmortem interval. PMI. It is known as PMI. Postmortem interval. It is known as PMI, postmortem interval. What is the definition? What are the objectives? Why we want to know the time since death? If we found a dead body, okay, even suspected death in unnatural condition death, why we want to know this time since death? Why? What are the objectives? What are the general principles? And then I will tell you the 12 ways, how the 12 parameters based on which we can find out this time. It's very easy. Okay, so please understand it's a very important topic, I'm warning. So what is the definition? The time interval between death and examination of the body. I'm a forensic expert. There is a dead body handed to me by the police. Okay, I'm examining this dead body. So what is the time interval between the death till this moment? Death, what is the time between the death till the examination of the body? Okay, so this time interval is known as postmortem interval. This time interval between the two things is known as postmortem interval. The time between death and examination of the body. Learn the definition. Between death and the examination of the body. This is known as PMI. What is the full form of PMI? Postmortem interval. Okay. It is not determined based on single criteria. There are 12 criteria. Okay. Which are, some of them are based on physical changes in the dead body. Some of them are based on chemical changes and some of them are based on the biological changes in the dead body. So in the dead body, we will see physical, chemical, and biological changes. There are 12 parameters, total 12 parameters, based on which I will come on a conclusion. What is PMI? Postmortem interval. That is time since death. Okay, so learn the definition. If you're done with the definition, what are the objectives? What are the objectives? Why you want to determine it? To identify the exact time of crime. Exact time of crime. Okay, if it is a murder, we want to know at what time the murder was done. Exact time of crime. It will verify suspect statement. If there are multiple suspects or one suspect, we will ask the suspect at that particular time, where were you? Because the time of death is that given by the forensic expert. Okay, so at that time, where was the suspect? So based on which we can see the suspect, we can match the suspect's statement. No? You watch movies, series, you are understanding all these. Huh? It adds investigation and inheritance in civil cases. Okay, and it determines the insurance policy. Sometimes insurance policy may last just at that moment only, insurance policy and all. So the time of death, if it is 1 o'clock, the insurance policy is valid, but if the time of death is 2 o'clock or 3 o'clock, it's not valid. It may be the cases in some time, no? Or it may be the cases of the inheritance, or it may be the insurance policy, whether it is valid or not valid at the time of the death. So time of death is important because of these 4 objectives. So learn the 4 objectives. It tells that the time of death tells us the time of crime. In medical legal cases, time of death is equal to time of crime. If it is a murder, yes or no, time of death is equal to time of crime. It will verify the suspect's statement. Where was the suspect at the time of the death? We can verify. Okay. It will add in the inheritance in civil cases and insurance policy validity. So these are the 4 objectives. So we are done with definition and objectives. Now I am a forensic expert. We are detectives. Yes. So we will follow 4 principles, based on which we will tell the time of death to the police and to the court. We will submit our report based on the 4 principles. Forensic expert, based on these 4 principles, submit the report to the police and the court. What is the time of death? Okay, exact time of death cannot be told. No, I will not write down the death occur at 1 a.m., 1 p.m., 2 a.m. No. I will always give a range, because exact, based on all 12 parameters, we cannot say exact time of death. No, it will be in a range. So always give time range, not a single value. So so save your skin first. Save your skin first. Okay, being a forensic expert, you have to save yourself first. Suppose I'm a forensic expert, first I will save myself, then I will try to save others, or give the punishment to the murderer, whatever. But first I will say, so I will always give the range. I will not give exact time, because based on all 12 parameters, I cannot tell the exact time of death. I was not present at the crime scene. I don't know. Based on the 12 parameters, I will try to figure it out, but I cannot figure it out the exact value. Number 1. Number 2. Okay. Biological variability is there. It depending from individual to individual and environment to environment. The dead body is in which environment? Is it in moist environment? Is it in dry environment? It is submerged in the water. And individual to whether the individual is lean, obese, there are many factors to consider. We have seen, I have told you all of that. So biological variability is very high. That's why we should give the range. Okay. Accuracy decreases with time interval. So if death occur last few hours, suppose death occur, and just when the death occurred, the police got the information, and as soon as police got the information, I got a call from the police that you are a forensic expert, madam. Please do come at this site. We will take the permission from the court, and it's a medical legal case. Okay. So I'm reaching the crime scene very fast, within few hours of the death, and I'm examining the dead body within few, so accuracy will be high. But if the forensic expert is called very late, after many hours, so accuracy of this will be low. So these 4 principles will be there. So what are the 4 principles, people? What are the 4 principles based on which the time since death can be told? PMI can be told. Number 1, exact time of death cannot be told. Always give a range of PMI. Biological variability is always there, and accuracy decreases with the length of time. Learn these 4 principles. Give me a thumbs up, people. Come on. Now, can I start the 12 parameters? One line on each. Very easy. You know all of them. I taught you all of them. There is nothing new in this. Okay, we are just doing the revision, what we have read yesterday and today, combination of the both. Postmortem changes. I will include immediate, early, and late. All changes in this. Okay, that is the postmortem change, the chapter. Okay, so first I will see cooling of the body. First of all, I will see the cooling of the body. Let's start the 12 parameters. First, I will start looking at the cooling, the rate of cooling of the body. Yesterday, I taught you what is cooling of the body, Algor Mortis. I will, as soon as I will receive the dead body from the police, I will measure the rectal temperature of the dead body and I will apply the formula. You know the formula: normal temperature minus rectal temperature upon rate of fall. I will take multiple readings to know the rate of fall. Ideal rate of fall is 0.4 to 0.6 degree Celsius per hour. Yesterday I taught you. Okay, it is reliable only in indoor cases. It is not reliable in outdoor cases. So that is cooling of the body. Cooling of the body. Okay. Number 2, I will see lividity. First, I will see Algor Mortis. Then I will see lividity. Yesterday I taught you lividity. So lividity will tell me the position of the dead body at the time of the death. But currently I am interested in time since death. So first, it appears within 1 hour. Okay, it's fully developed in 12 hours and it is fixed by 18 hours. So I will see, is it just appearing or fully developed, or is it fixed? So based on which I can give a range. Ki time since death is 1 hour or 12 hours or 18 hours. If lividity is 100% fixed, so time since death definitely more than 18 hours. If it is still developing, it is not fixed, so I will say it is 6 to 12 hours. And if it is just initiated, so I will say it is 1 hour. Okay, so it is useful for early PMI, less than 24 hours. You can see it is useful for early PMI. It is postmortem interval. Early PMI mein it is useful. Okay, then I will look for rigor mortis. Then, being a forensic expert, first I have seen Algor Mortis, then I have seen lividity, then I will see rigor mortis. Okay, for Algor Mortis, I will apply the formula. You know the formula, rectal temperature. Here, it is useful for early PMI. You know early PMI. Okay, up to 18 hours. Okay, and this one, rigor mortis. So rigor mortis, you know what is rigor mortis? I'm not teaching you rigor mortis. It is a parameter to tell PMI, postmortem interval. Okay, the rigidity in the dead body, you can see. So it start at 2 hours. It start at 2 hours. It complete in 6 hours and it lasts for 36 hours. Again, it is a good guide for first 2 days. This one is for 1 day. Up to 24 hours, this can guide. Up to 24-hour death, this can guide. Up to two days, because 36 hours it can tell. Na? Suppose rigidity is still there. When I got the dead body, rigor mortis is still there. So time since death is within 36 hours. It is not more than 36 hours. If when I got the dead body, rigidity is already gone. It is secondary flaccidity. So time since death is more than 36 hours. Okay. So up to 2 days, it's a good guy. 2 days or 2.5 days. Okay, you are getting my point. Up to 2 days, it's a good criteria. The next is what I taught you today: putrefaction, adipocere formation, and mummification. I told you all three today, no? Putrefaction, adipocere formation, and mummification. So putrefaction, I told you 3 features. Color changes occurs in 12 hours. Gas formation occurs in 18 to 36 hours. And liquefaction occurs in 5 to 10 days. I told you today only. Adipocere formation 4 to 5 days. And mummification 6 months. This is all told you in summers. The winters, the timings will be less. Got it? So this is for longer PMI. This is for longer PMI. You can see it is in days and months. It is in days and months. So for early PMI, we look at this within 24-hour PMI. Within 2-day PMI, 48-hour PMI, we look at this. And within long PMI, if I get the dead body after 6 months, I will look for these changes. Then if I get the dead body after 3 months, 6 months, I will not look for all these. These are already gone. I will look for these. You are getting my point. The next is entomology. What do you mean by entomology? The insects. What is forensic entomology? What do you mean by forensic entomology? Study of insects on the dead body. Study of insects. There are many insects which get attracted on the dead body. So entomology. Looking at the entomology, we can predict the time. Okay. So if the dead body is fresh, the death occurs right now, we can get up to 150 eggs of the flies on the dead body. Okay, on the dead body, if fresh eggs are present, the dead body is fresh within few hours only. Within 24 hours, eggs will hatch and you will not get egg now. You will get maggots. You will get maggots. You will not get egg. Okay, up to 3 to 6 days, the larva will mature. The maggots will mature and they will convert into adult flies into 5 to 6 days. So you can see the life cycle of the fly. Okay, and based on which we can predict the time. We can predict the time. Okay. And the next is gastric emptying. It will be useful if we know what is the last meal of the dead person, the deceased person, the dead person. What was the last meal? How much? Is it mild, moderate? How much the person have eaten? Okay, gastric emptying. Because the point death is occurring, the gastric emptying stops. Okay, it is helpful if the last meal is known. If the last meal is known. Okay, if light meal is there, gastric emptying occurs in 2 hours. Medium meal, gastric emptying occurs in 4 hours. Heavy meal, it requires 8 hours. So suppose we got a dead body, we are doing the autopsy, we open the stomach, inside the stomach still food is there, and we will inquire the family what the person have eaten. Is it a light meal, moderate meal, or heavy meal? We will decide based on the food, the quantity and quality. Suppose the person have taken heavy meal and still food is present, so gastric emptying is not complete. So I will say from the time of eating of food and the death, it is within 8 hours. Like that, we can come on some conclusion. Now, one more fact is there. Gastric emptying is fastest of carbohydrate, then followed by protein, then slowest for the fat. We can inquire the family or the known person that the deceased person, what exact meal the person have eaten. So does it contain carbohydrate, does it contain protein, what does it contain fat, what is the proportion of the three, based on the meal the person have taken, and based on which we can decide the time of the gastric emptying, and we can tell the approximate time since death. Got it? So this is the complete story. If so, overall interpretation, if you want to learn this, learn, otherwise learn the interpretation. If the dead body have a full stomach, so it is within 4 hours of the last meal. The death is within 4 hours of the last meal. If it is partial stomach, partial is fed, partial is in duodenum, the gastric emptying have occurred. Partial is in stomach, the partial is in duodenum. It is full stomach, the death is within 4 hours of the last meal. If partial stomach, partial duodenum, the death is within 6 hours. If the stomach is completely empty, so it is already past the duodenum and intestine. Okay, so death is more than 6 hours from the last meal. So last meal timing can be confirmed from the family. When the person have eaten the last meal, the exact time, and from which we can consider the gastric emptying as a criteria. And if you know these facts, you can do the interpretation. How many of you got it? Give me a thumbs up. This is gastric emptying. Now CSF. We will aspirate the CSF from the lumbar puncture. We will aspirate the CSF of the dead body. We can do the lumbar puncture, and we can aspirate the CSF in a test tube. In the CSF, we will see potassium. Cerebrospinal fluid, we will see potassium. Potassium keep on rising in the CSF up to 20 hours of the death in a linear pattern. So it will tell us up to 20 hours. It will be useful in early PMI detection. So potassium increases in CSF linearly up to 20 hours. So it will tell us approximate time of death. Depending on the concentration of the potassium, we can tell the time. Suppose potassium is this, so approximate time of death is this, like that. There is a linear relation like that, but it is approximate. The next is blood chemistry. We can take the blood in a test tube from the dead body, from the dead person, deceased person. Okay, we can take the blood and we can see all these parameters if you want to learn. Lactic acid increases 50 times of the normal value. Acid phosphatase increases 20 times. Amylase increases 3 times, and LDH and AST linearly increases up to 60 hours of death. You can see the timing. So approximate timing can be tell, but it is not reliable. It is have limited reliability because blood coagulates after death. So it is not very reliable. Blood chemistry. The next, we can take the vitreous humor of the dead body. Yesterday also I taught you this now. We will take the vitreous humor from the dead person. We will aspirate it, and again we will see the potassium. Here also, like the CSF, we will see the potassium, and it is having a linear relation. There is a formula also if you want to learn. This is the formula. Whatever is the amount of potassium present in the vitreous humor, you just multiply here. 5.26 into the potassium minus 30.9. Whatever is the value. First you do this multiplication, minus 30.9. Whatever is the answer, that is the PMI. It is an approximate formula, not exact. That is the hours passed till death. It will be in hours. So if you want to learn this formula, okay, you can learn. And it is applicable up to 120 hours of death. This formula applicable. Okay, so vitreous humor mein potassium we can test. We can test the muscle enzymes. We can test the muscle enzymes, not important although. Okay, we will test myofibril protease and CPK. CPK you can learn, the important one. CPK decreases linearly and protease increases linearly. Okay, you don't learn, you have to learn the formula. Next is hair. You know, after death, hair don't grow. Normally, hair keep on growing at a very slow rate. Our hairs keep on growing, although we don't realize, but they are constantly growing at a slow rate. But hair does not grow after death. The moment death occurs, hair does not grow. Okay, now we can see, if it is a male, we can see the beard, okay, the size of the beard, and we can ask the family when the last shave is done. So based on the size of the hair of the beard, we can predict the time of death. You got my point? We can ask the last shave done, when the last shave is done. And based on that, suppose last day is done 2 days back, 48 hours back, okay, from the time of examining the dead body, and the size of the beard hair, size of the beard hair is showing it's 36 hours. After 36 hours, there is no growth. Okay, so 36 to 48 is the time of interval. I hope you are getting it. I'm able to explain you. So this is here. The last is radioactive carbon dating, which is not applicable in forensic medicine. Because in forensic medicine, we see the death up to 100 years. It tells the death before 1000 years. Okay, so the half-life is 5600. We read carbon dating na, in science in our school time. It is not applicable. Okay, because it is only useful for architectural remains. It is not for the forensic medicine. But these are the 12 parameters based on which we can predict PMI, postmortem interval. You just learn these 12 parameters. Something to write inside, you will get it. What you have to write, you have understood it. And MCQs definitely you can solve. So we are done. Yes or no? This is the final table of time since death. Yes. So we are done with time since death. Okay. So today's session is done, people. Today is the 4th demo I have given. Okay. So PSM demo already done. Now the classes will be on app, PSM classes. FMT demo already done. Okay. Now the classes will be on app. Okay. Now we have ENT demo. Tomorrow there is no class. There is break. No class tomorrow, Wednesday, 15th October, no class. We will meet again on 16th. Okay, I will teach you ENT, the first class of ENT. Don't you dare to miss it, people, please. I will teach you assessment of hearing. Assessment of hearing. And I will teach you with a real tuning fork. I will show you the 3D models. Okay, it will be very super duper interesting class. So, next class will be on Thursday. 16th October is not Wednesday, I'm sorry, it's Thursday. 16th October, Thursday, ENT, assessment of hearing. The class is on YouTube, not on app. The first session of all 4 subjects is on YouTube. The second session of ENT will be on app. Okay, the first session is on YouTube. The time is same. It's 6 p.m. sharp. For any queries, further queries of anything, you can WhatsApp on this number. You can note down this WhatsApp. Thank you so much. Wish to see you 6 p.m. a day after tomorrow on Thursday. ENT, YouTube. Okay, thank you so much. I hope you learned it. How was the forensic? You understood postmortem changes? The complete forensic is a small subject we will quickly finish in the remaining 19 sessions. There are total 20 sessions of the forensic. So remaining 18-19 sessions, I will pack this subject and it's an easy subject. I know it's more of factual, but I will help you in learning the facts in an easy way. Okay, got it, everyone? People, you are there? Huh? Respond now. Okay, chalo. See you tomorrow with the day after tomorrow with the ENT. Bye-bye. Good night.